President of the Legislative Council. Addresses. The Chief Secretary for Administration will address the Council on the Government Minute in response to the report of the Public Accounts Committee number 78 and number 79. Chief Secretary for Administration. President, laid on the table today is the Government Minute, or GM, responding to report number 78 and 79 of the Public Accounts Committee, or PAC, presented to the Legislative Council on the February 15th this year. I welcome the PAC report, and I am grateful to the Chairman, Mr. Peter Hsu, and members of the PAC for the time and effort they put into the work. The government accepts the PAC's recommendations and sets out in detail in the GM the specific responses of the relevant bureaus and departments. The PAC conducted public hearings on the chapters on licensing services for drivers in report number 78 and continuing education fund in report number 79. I would like to highlight the key measures taken and progress made by the government and the relevant bodies in response to the recommendations. On the comments and recommendations made by the Audit Commission about the licensing services, the Transport Department, or TD, has taken various measures to ensure an effective driving training and testing system for promoting road safety. On the provision of driving tests, the TD has taken measures to boost driving test output. With the time saved from electronic driving test forms and getting driving examiners to take up additional work on Saturdays starting from late March this year, around 1,000 additional driving tests can be provided for early test appointments per month. This is to improve the overall waiting time for driving tests. In addition, the TD is conducting a new round of driving examiner 2 recruitment exercise. New recruits will assume duty in the second half this year. Meanwhile, the TD has been working with the Independent Commission Against Corruption since February this year on reviewing the duty reporting arrangement of driving examiners. This is to explore ways to further increase the driving test output. The review is expected to be completed in the third quarter this year. On updating the computerized question banks of driving written tests, the TD has enhanced the system to ensure that the question banks are reviewed regularly and as necessitated by legislative amendments. This is to ensure all the questions and answer options are up to date. On the management of driving training schools, the TD will enhance the monitoring of the operators' gearing up progress during the tendering and selection exercises for schools in future to ensure the schools have met all the requirements before being designated as driving schools. The TD has also consulted the Competition Commission and adopted a new marking scheme for awarding tenders. Under the new scheme, the technical assessment and the rental proposal each makes up half the overall score. The TD will continue to conduct regular retendering exercises with the Lands Department for the schools located on the government's short-term tenancy site, and to explore further enhancements to the assessment criteria in future tendering exercises. The goal is to have more competition in the market of driving training schools. On licensing and monitoring of private driving instructors, or PDIs, the TD will continue to regularly review and closely monitor cases of inactive PDIs in assessing the need of issuing new PDI licenses. The TD plans to collect information from candidates about their driving instructors and the number of training hours taken, etc., when they attend driving road tests starting from June this year. Our goal is to enhance the monitoring of inactive PDIs. Besides, the TD has strengthened regular roving inspections of PDIs to monitor the quality of PDIs more closely. on the Continuing Education Fund, or CEF. In response to the recommendations of the CEF, the Labor and Welfare Bureau, or LWB, and the Working Family and Student Financial Assistance, or the agency, have taken various measures to proactively improve the different aspects of the CEF's operation. On monitoring inspections, the LWB has completed a review of the service agreement with the Hong Kong Council for accreditation of academic and vocational qualifications for 2022 to 23 and have followed up and rectified the arrangement on inspection of registered courses. The institution agreed to refund the fees paid for the unsuccessful audit visits in the past 5 years, as mentioned in the audit report, after the deduction of service fees payable for the preparations for conducting audit visits. The formalities to refund the remaining fees were completed in 2022 to 23. In addition, the organization could only charge service fees for successful audit visits. Upon completion of the 2022-23 service agreement, the LWB will engage a service provider for audit visit through open tender. The LWB will follow the recommendations of the audit report and the PAC report by spelling out the content of the service agreement and the arrangement, adding appropriate provisions to define clearly the roles and the responsibilities of the service provider and the service requirements, etc. The LWB and the agency attach great importance to safeguarding national security. They issued a letter in March this year reminding all CEF course providers to follow the national security law. The LWB and the agency will issue letters to all CEF course providers in June this year, requiring them to sign an undertaking on safeguarding national security, as well as revise the application forms for new course registrations and renewal, requiring all course providers to sign a declaration to confirm that they run CEF courses in line with the requirements of the national security law. Additional provisions on safeguarding national security will be added to the CEF terms and conditions and the guide in mid-2023. On strengthening the regulation of the promotion of CEF courses, the LWB and the agency have reminded all course providers in writing not to promote CEF courses in any way deviating from the objectives of the CEF. The LWB and the agency have also stepped up inspections of promotional materials of CEF courses online to ensure they are compatible with the CEF's objectives. The CEF authorities have requested the course providers to submit duly prepared promotional materials upon application for course registration. The materials will be checked to make sure they are in line with the CEF's goals. If course providers are found to have allegedly promoted CEF courses as preparations for emigration or in any way deviating from the CEF's objectives, the CEF authorities will request them to withdraw or cease using those promotional materials and take other appropriate regulatory actions in case of serious breaches, such as issuing warning letters or reprimand to the course providers involved or deregistering the courses. The LWB and the agency have made greater use of information technology to improve the efficiency of the CEF's operation, including starting the development of a centralized e-service portal in the first quarter this year to provide a one-step service portal for applicants of all financial assistance schemes, including the CEF. Under the purview of the agency, the portal will let CEF claimants submit applications and supporting documents online with ease. They can also check the status of their applications. The LWB will also consult the Office of the Government Chief Information Officer to explore the feasibility of setting up an operating system to coordinate the operation involving multiple parties. The LWB and the agency will continue to monitor the implementation of the various improvement measures to ensure that the CEF can fully serve its functions and safeguard learners' interests. President, I thank the PAC once again for its effort and suggestions. The bureaus and departments involved will strictly adhere to their responses in carrying out the improvement measures in the GM. Thank you, President.
Questions. Question number 1, Mr. Chen Xiu-hong. Thank you, Mr. President. It is learned that the first hydrogen fuel cell bus and the first hydrogen refueling station in Hong Kong are expected to be put into operation this year. In this connection, will the government inform this council, 1, given that the existing legislation does not allow hydrogen fuel cell vehicles to run on roads, whether the government will expedite the establishment of a legal framework for the use of these vehicles and improve the relevant laws, regulations, standards, and technical guidelines? If so, of the legislative timetable. If not, how it promotes the development of hydrogen transport without laws and regulations. 2, whether the government will expeditiously explore the feasibility of installing hydrogen refueling facilities at petrol filling stations or appropriate locations across the territory. If so, of the details, if not, the measures in place to enhance the supporting infrastructure facilities for hydrogen transport to expedite the promotion of extensive use of hydrogen fuel cell vehicles in Hong Kong. And 3, as this year's budget has proposed earmarking $200 million under the new Energy Transport Fund for commencing trials of hydrogen fuel cell electric double-decker buses and heavy vehicles, whether the government has assessed if the amount is adequate for promoting the development of hydrogen transport. If it is not adequate, whether it will consider deploying additional resources for establishing a dedicated fund to assist in promoting hydrogen transport, as well as researching and developing hydrogen fuel cell vehicles jointly with the mainland cities of the Greater Bay Area so as to accelerate the pace of decarbonization of green transport in Hong Kong. If so, of the details, if not, the reasons for that. Secretary for Environment and Ecology. Mr. President, to align with the national dual carbon targets, the Hong Kong SAR strives to achieve carbon neutrality before 2050 and reduce the total carbon emissions from the 2005 level by half before 2035. The Hong Kong SAR government announced the Hong Kong Roadmap on Popularization of Electric Vehicles, Clean Air Plan for Hong Kong 2035, and Hong Kong's Climate Action Plan 2050 successively in March, June, and October 2021. It is a global trend to promote development of new energy transport to reduce carbon emissions from the transport sector. The above-mentioned blueprints and roadmap covered policy directions and future targets in various areas promoting the adoption of new energy transport technologies so as to guide Hong Kong towards zero vehicular emissions before 2050. The process of converting hydrogen energy into mechanical electrical energy does not emit greenhouse gases or any other pollutant. If combined with the use of green hydrogen produced by renewable energy, it is possible to meet with the benchmark of emitting no greenhouse gas or other air pollutants from the production to use. Further studies are required to explore ways to reduce the production and transportation costs of green hydrogen, as well as the loss of energy in the process. At present, hydrogen fuel cell or HFC vehicles are still at an early stage of development. Resources are mainly invested in research, development, operational trials, and supporting facilities worldwide. The Chief Executive's 2022 policy address stated that to progressively commence trials of HFC double-deckers and heavy vehicles in 2023 and formulate the long-term strategies for the application of hydrogen energy in road transport by 2025. To keep pace with the development trend of hydrogen fuel adoption, the Hong Kong SAR government set up the Interdepartmental Working Group on Using Hydrogen as Fuel, or the Working Group, in 2022 to coordinate preparation of bureaus and departments for using hydrogen as fuel locally with a view to encouraging local adoption of hydrogen energy. The working group comprises the Bureau, the Transport and Logistics Bureau, Development Bureau, Security Bureau, Environmental Protection Department, Electrical and Mechanical Services Department, Fire Services Department, Transport Department, Marine Department, Planning Department, Lands Department, Buildings Department, and Architectural Services Department. The first key task of the working group is to progressively commence the trials of HFC double-deckers and heavy vehicles in phases, taking local circumstances into account. The working group will review and assess applications of trial projects and advise on aspects such as safety and planning in order to aid the trade to commence the trial early. Its tasks also include conducting risk assessments of hydrogen refueling stations, the arrangements of hydrogen supply, and HFC vehicles on road, as well as reviewing the relevant regulations, standards, technical guidelines of different places so as to formulate an operational safety framework for using hydrogen fuel in the sector locally in the long run. The working group has given agreement in principle to the first batch of 3 applications of trial projects, including trials for setting up a hydrogen refueling facility as a bus depot, 1 HFC double-decker, and a hydrogen extraction facility at the plant of the Hong Kong and China Gas Company. In addition, there's a plan to test HFC heavy vehicles for refuse collection or street cleansing. We expect the trial of the first HFC double-decker can commence within this year and that of heavy vehicles in next year. In consultation with the Transport and Logistics Bureau and the EMSD, I would like to reply to the question raised by Mr. Chan as follows. 1. There is heavy traffic on the roads of Hong Kong. Vehicles are often required to ply through tunnels in crowded places. This, coupled with the dense urban settings, we have to be cautious in exploring the application of hydrogen fuel transport technologies to ensure public safety, particularly given that the technologies are still developing. The government will make use of the interim standards used in the trials of HFC vehicles, as well as data and field experience gathered in the trials, to formulate an operational safety framework for the use of hydrogen fuel in the transport sector locally in the long run. This includes amending the current Gas Safety Ordinance (Cap 51), which regulates liquefied petroleum gas vehicles, to cover hydrogen fuel, with a view to effectively regulating HFC vehicles' hydrogen fuel supply chain, the safety of HFC vehicle mechanics and repair workshops. In the process, the EMSD has appointed hydrogen fuel consultants to start specialized studies in the end of November 2022. The consultants will tap into the views of various stakeholders to formulate technical guidelines related to hydrogen fuel systems, refilling stations, and quantitative risk assessment. The consultants will also review the HFC vehicle trials and explore the future regulatory framework for using hydrogen as fuel. The government plans to appoint another consultant in the third quarter of 2023 to examine the details of legislative amendments and conduct a business impact assessment. Our target is to commence preparation in 2024 for introducing the proposed legislative amendments into LegCo in 2025. 2. The working group is liaising closely with the applicants of the trial projects and other stakeholders to examine the feasibility of providing hydrogen refueling facilities at different locations. This includes exploring transforming existing petrol filling stations to hydrogen refilling stations, or allowing the provision of different vehicle fuels in one station. The trial of the first hydrogen refilling station will commence this year, together with the trial of HFC double-decker. Furthermore, development of new energy vehicles in the mainland will, to some extent, affect Hong Kong's cross-boundary transport trade. Apart from HFC vehicles, will not exclude the possibility of adopting other green technologies in the future, especially electric vehicles, of which the technologies are advancing rapidly. We've begun to explore ways to provide sufficient electricity charging and hydrogen refilling facilities in areas adjacent to boundary control points so as to support the future adoption of electric or HFC goods vehicles by the cross-boundary transport trade. 3. To assist the trade in commencing trials for hydrogen fuel transport technologies, the government has earmarked $200 million under the New Energy Transport Fund for subsidizing the cost of trial projects. They include the procurement, construction, renting of HFC vehicles, establishment of hydrogen refilling facilities, operating costs, such as expenses of hydrogen fuel. The funding earmarked is sufficient to subsidize trials for different types of vehicles, including double-deckers, heavy goods vehicles, heavy vehicles for refuse collection, or street cleansing. The government will take into account the experiences and research and development results of our country, including cities in the Greater Bay Area and other cities overseas, to consider how to adjust Hong Kong's pace in promoting adoption of HFC vehicles. We will also closely monitor the development of other new energy transport technologies, keeping pace with the global development to work out a feasible strategy to promote green transport and carbon emission reduction in Hong Kong. Our targets by 2025 are to announce a roadmap for the promotion of electric public transport and commercial vehicles, as well as formulate long-term strategies for the use of hydrogen energy in land transport so as to help guide Hong Kong towards zero vehicle emissions before 2050. Mr. Chen Xiu-hong. Thank you, Mr. President. Promoting green transport and developing hydrogen energy transport is the global trend. I'm glad to see that the government is finally giving the go-ahead to developing green and hydrogen energy. In its reply, the government has set out a legislative timetable. It is expected that the legislative amendments can be introduced into the Council in 2025. I hope that the government can speed things up and work on that as quickly as possible. However, third part of my question has not been answered. That is whether R&D can be taken forward jointly with the GBA cities so as to promote the use of hydrogen and green energy transport. According to the reply, the government will take into account the R&D outcome of and experiences of other countries and cities in the Greater Bay Area. We need to align our strategy with industrial development in the mainland. We do not have the prerequisites to act on our own. We need to adopt the GBA mindset. My question is whether the Interdepartmental Working Group on using hydrogen as a fuel will proactively take forward the setting up of a working group with the Greater Bay Area cities so as to study the use of hydrogen energy and the development of hydrogen energy industry. We closely follow the country's development, and we agree with Mr. Chen in the sense that we will continue to step up liaison, exchange, and cooperation with the cities in the Greater Bay Area so as to grasp opportunities and complement each other's strengths. Together with the governments in the Greater Bay Area cities, the Hong Kong SAR has been discussing, for example, the application of hydrogen energy vehicles and new energy transport in the region or in the area. For example, we mentioned in the reply the study of setting up hydrogen refueling facility and electricity charging facilities at the BCPs. We also work with the relevant units in Beijing in exploring the different standards and regulations on hydrogen fuel cell vehicles. We've also been in touch with the relevant manufacturers to explore the suitable models to be imported into Hong Kong. We do have a number of funds apart from the New Energy Transport Fund, for example. We also have the Low Carbon or Green Research Fund. We also subsidize projects relating to hydrogen energy. Meanwhile, we also consider different collaboration opportunities. As for the working group, in collaboration with the Greater Bay Area cities, we need to consider the terms of reference and the composition. We do keep all options open in working within the existing framework or outside the framework so as to step up liaison and improve our work. Mr. Stanley Lee. Hydrogen energy transport very much depends on the government's action to remove policy obstacles. And on top of that, incentives should be provided to promote its development. Are there any targets apart from achieving zero vehicular emissions before 2050? Is there a time frame in relation to achieving the target of the number of HFC vehicles registered as per the total number of vehicles registered in Hong Kong? We strive to remove obstacles in the framework, and in the process, we encourage applicants to liaise with the relevant departments to take forward trial projects. In my reply, I refer to the interim standards, and on the basis of this as well as the data, we will draw up the regulatory framework in the future. As for subsidies, incentives, I mentioned the New Energy Transport Fund in my reply. We subsidize the trial projects involving HFC double-deckers and heavy vehicles. In relation to the low carbon green research fund, we also subsidize projects in relation to hydrogen fuel cell and storage facilities so as to form a good foundation for the development in this regard. And under the ECF, we also subsidize some research projects relating to the use of hydrogen as energy, such as developing hydrogen energy and the ingredients required for the production of hydrogen energy. The technologies are evolving rapidly. We are keeping pace with the latest development, and meanwhile, we'd like to leverage on the market's capacity. You ask about a target for the number of HFC vehicles. I think that we're still at an early stage, but we will keep in view the developments and consider setting a target. Mr. Gary Chen. The transport sector has been discussing the use of hydrogen energy as fuel for many years. Now, I've heard about the Interdepartmental Working Group on using hydrogen as fuel for a number of years. And according to the administration, the proposed legislative amendments will be introduced into LegCo in 2025. That means by the time the framework is drawn up, it will be 2026-27, and we're working at snail pace. My question for the Secretary is, in the process of formulating our policy and legal framework, can reference be made to our neighboring cities such as Shenzhen? We have similar urban density setting with similar size of population in the city. Can we make reference to their framework so that we don't need to waste time on drawing up our own and expedite the development of hydrogen energy? Secretary. Thank you, Mr. President. As I said, we've made reference to the developments in the mainland and other countries. We've also made reference to the relevant standards. Apart from the mainland and overseas experience, we also engage a consultant to conduct a study. The Interdepartmental Working Group has approved certain projects, and on this basis, we can then collect data and consolidate the experience for the purpose of formulating a legal framework in the long run. The EMSD has commenced the consultancy study, and we are now discussing with stakeholders on the quantitative risk assessments on hydrogen refueling stations, hydrogen supply, so as to formulate standards and guidelines. We'll be looking at the standards and also the regulations for the use of hydrogen fuel cell vehicles in the future. We are going to amend the gas safety ordinance as part of our preparation so as to support the development of HFC vehicles in Hong Kong. Mr. Holden Chow. Mr. President, I'm happy to learn from the main reply of the administration that the government will explore the setting up of hydrogen filling stations near BCPs. In Tuen Mun, Yuen Long North districts, I think priority should be given to these locations when it comes to the setting up of refilling stations. In fact, in Guangdong province, earlier it has been announced that they will install 300 additional hydrogen refilling stations. Will the government make reference to the Guangdong experience? Say for areas close to the BCPs, Yuen Long, Tuen Mun North District, will the government come up with a target as to the number of hydrogen refilling stations to be set up so as to promote the use of HFC vehicles? Secretary. Now about setting up electric charges and HFC refilling stations, we have begun the study and we are liaising with stakeholders. In due course, we will be looking into the options as to where they should be set up. We've been receiving views, and this will help us decide on the number of stations to be set up. Dr. Lo Wai Kwok. Mr. President, earlier, some members and myself went on a visit of a hydrogen extraction facility at a plant of Hong Kong and China Gas Company. This is not a trial of HFC vehicles. Instead, it is about using gas pipelines to transmit hydrogen in Hong Kong. The gas company has a vast network covering the entire territory. This may form a prerequisite for the promotion of HFC vehicles in Hong Kong or hydrogen energy in Hong Kong. I'd like to ask the Secretary if there is any follow-up action. The Interdepartmental Working Group has recently given an agreement in principle for this trial project of a hydrogen extraction facility. At the moment, the gas pipelines can transmit gas of containing up to 50% of hydrogen. We're looking at the cost of extracting hydrogen in the process, and this can help reduce the need for hydrogen-carrying vehicles to ply in the streets of Hong Kong. In the short term, hydrogen can be transmitted to the refilling facilities so that in the short term we'll be able to boost the supply of hydrogen energy. We'll consider the member's suggestion.
Next question, Mr. Leung. President, it's been reported that given the double blow of seasonal influenza and novel coronavirus, the waiting time at the A&E departments has reached well over 8 hours for days on end, with average daily attendance at 6,000, and the bed occupancy rate of medical wards has exceeded 100% on average. While the hospital authority has appealed to the members of the public with respiratory tract infections to seek medical treatment at general patient clinics or private clinics, it's been learned that they are also full. In this connection, will government inform this council, one, whether it knows the average daily consultation quota of GOPCs, and whether the quotas have been increased to cope with the double blow of flu surge and the novel coronavirus since the 1st of last month. 2, whether it knows the daily numbers of persons admitted to hospitals due to flu infections and novel coronavirus infections, as well as the bed occupancy rates of various private hospitals in the past 3 weeks. And 3, as it is learned that HA has opened additional wards in the North Lantau Hospital, Hong Kong Infection Control Center, to receive patients infected with novel coronavirus, whether such wards will receive patients infected with flu viruses, and whether the authorities have any other measures to cope with the surge of flu. Under Secretary for Health, President, the winter surge of flu in Hong Kong generally occurred during January to March or April in the past. However, the flu activity level has remained low for the past 3 years due to territory-wide anti-pandemic measures. With the lifting of mask-wearing requirements since March, the surveillance data revealed that Hong Kong only entered flu season in early April this year. The flu activity level had been on steady rise since then and reached its peak in the end of April and has started to subside recently. Concurrently, the number of cases of coronavirus disease or COVID-19 was increasing and currently remains high, resulting in a recent peak of relevant infectious diseases. In terms of the sewage surveillance, laboratory surveillance, it shows that the COVID situation has reached its peak, and the R number has dropped back to 1. The government has been adopting multiple measures in response to upper respiratory tract infections such as flu. In addition, we've also been summarizing experiences periodically having regard to the development of COVID so as to sustain our anti-pandemic efforts in every aspect. At the current stage, we manage COVID as a type of URTI with anti-epidemic measures focusing on the protection of high-risk groups. With concerted efforts, the protection and treatment capacity of Hong Kong's healthcare system has been significantly enhanced, among which the public hospitals have optimized their contingency plans. Recently, most of the infected citizens, especially those vaccinated for flu or COVID, are mild cases. Symptomatic citizens may directly attend medical consultations at private doctors or clinics or the GOPCs under the HA. Visiting A&E departments or public hospitals is not necessary. In fact, vaccination is one of the most effective means to prevent flu or COVID and their complications, as well as reduce hospitalization and death. Flu and COVID-19 vaccines can also be co-administered. All persons aged 6 months or above, except those with known contraindications, are recommended to receive flu shots for personal protection. We appeal to members of the public, not least the elderly and the children, to get vaccinated against flu and receive appropriate doses of COVID vaccine as soon as possible. In consultation with the DH and HA, my reply to the question is as follows. At present, the service of GOPCs under the HA are primarily used by elderly, low-income persons, and chronic patients. Patients are divided into two major categories: chronic disease patients with stable conditions such as diabetes and hypertension, and also have episodic cases with relatively mild symptoms such as cold, sore throat, and gastroenteritis. Patients with episodic illnesses can make appointment for consultation within the following 24 hours through the telephone appointment system of the GOPCs or the Book GOPC function in the HA Go one-stop mobile app. In addition, people with COVID may also make appointment through the Book COVID function in the HA Go. To meet service needs, the GOPCs offer about 20,000 quotas each day on the weekdays, some of which are reserved for episodic illnesses, including flu. Some also reserved for COVID patients. The HA has uploaded to the GOPC's website the average number of consultation quota for the preceding 4 weeks by district, so the people would have an overview of the quotas in various clinics. The HA will continue to monitor closely the situation and allocate quota as necessary to ensure the patients receive appropriate treatment. Question 2 and 3. As for hospitalization, the current situation is similar to that in previous flu surges. The provisional figures of weekly numbers of persons with COVID or flu admitted to hospital over the past 3 weeks are listed in the annex. In brief, as I've mentioned earlier, the weekly number of persons admitted to hospital with diagnosis as flu had gradually decreased from about 700 in late April to less than 300 in early May. The weekly number of COVID patients admitted to hospitals had gradually increased from about 1,300 in late April to more than 2,000 in early May. Fortunately, they are mild cases. The HA has been closely monitoring the flu surges and making preparation for arrangement of facilities and manpower, including deploying temporary beds, enhancing gatekeeping to reduce unnecessary admissions, strengthening ward rounds, arranging patients for discharge, and transferring to private hospital for treatment. The HA will also mobilize facilities and resources to cope with increasing service demands. In view of the recent rise of flu and COVID, the Hong Kong Infection Control Center of North Lantau Hospital opened additional wards on the 10th of May 2023, mainly for admitting COVID patients and other patients such as those with flu. The government will continue to monitor the latest situation and risks of COVID and flu and other infectious diseases to make sure that the prevention and treatment capacity can meet the evolving healthcare needs. with emphasis on protecting high-risk groups and safeguarding public health. Mr. Leung. President, according to experts, the mRNA second valent vaccine is effective, but for XBB subvariants, we have to use some specific vaccines. There are some pharmaceutical companies that are developing these kind of vaccines. Some can cover XBB subvariant. Some of them have become available in the mainland. They have been improved for being used. Is the administration liaising with the mainland for the procurement of such vaccine? Is the government recommending the public to receive such COVID vaccines on a yearly basis? Mr. Leung, you've raised so many questions. Undersecretary, please. Thank you, President. Thank you very much, Mr. Leung. Regarding the COVID vaccine, we do have an expert committee to look at the efficacy of the vaccines and also the side effects. They will be discussing what sort of vaccines are to be imported. As to whether COVID vaccines will become a regular arrangement, the expert committee is still in discussion. Once a decision is made, announcement will be made. Reverend Peter Kuhn, President. According to the blueprint for primary health care, the district health center will be enhanced. Now, my question is, will the administration be considering making available 24-hour GOPC service at the district health center in order to meet the demand that will be rising? Undersecretary, thanks very much, Reverend Peter Kuhn. The DHC is an important part of the primary health care. The DHC's role is playing the role of consultation. It can consolidate information from different sources, and people will be able to get access to the relevant information if they need. And in the DHCs at the present moment, there is no medical consultation. And the DHCs are the district, part of the district network. And in the DHCs, whether there will be any medical consultation, we still have to discuss this, because this is running counter to the original intent of setting up the DHCs in the first place. As to the outpatient clinic, whether it should be 24-hour, this is something that should be discussed. We have to consider the efficiency. We have to consider the urgency on the part of the patients. If patients are so urgent that they need emergency medical attention, the first port of call would be the A&E department. Now, for episodic illnesses of flu, that they can be catered for at the general outpatient clinics without the necessity for 24-hour. Whether the hours should be extended, this can be explored. Mr. Su Chong-wing. President, a moment ago, the Undersecretary said that starting from April, the number of COVID cases has seen an upsurge, and it is remaining at a high level. In the light of experience, we understand that raising public vigilance would be an important measure to guard against COVID and flu. From the government's figures, the government has not disclosed these infection figures, and people are not as vigilant as they should be. Now, for the figures not to be disclosed, is it the case that the government feels that the COVID is not presenting a threat anymore, or are there any other reasons? Undersecretary, thanks very much, Mr. So. In March, we have lifted the mask mandate, and all the social distancing measures have been lifted on a gradual basis. And we are treating COVID as a type of upper respiratory tract infection. So it is no different from the seasonal flu surge. And we are making available the information to the public, although we don't hold any press conferences anymore. At the CHP website, we do have the information available, and anyone who's interested can browse the web for the latest situation. Thank you. Mr. Kissen-Young, President, the Undersecretary said a moment ago that in terms of flu and COVID, they are at a high level. And from the members of the public, I learned that it is difficult to get a quota from GOPC. It is even difficult to get a quota from the private practitioners. During the fifth wave, the government has designated hospitals or designated clinics to look after the patients, for triaging the patients. Now, we are facing the double whammy of flu and COVID, and they are at a pretty high level. Are we going to be reopening the designated clinics to alleviate the problem of medical consultation? Undersecretary, thanks very much for the question. As regards the designated clinics, it was a targeted measure during the pandemic. Now, when we have the serious pandemic, we would create the designated clinics. But for upper respiratory tract infection, we don't normally have the designated clinics. The 70 or GOPCs would be looking after the patients in this category. We're not having any designated clinics for this purpose. In theory, we should increase the number of quota for the episodic illnesses. But I must emphasize one point, that whether it be COVID or flu, there is always a way for prevention. And the best prevention is getting vaccinated. And this can make the symptoms milder, and the number of consultations can be reduced. There are many cases that are of a mild nature, and people can sort the matter out by taking paracetamol, for instance. So in terms of flu, if we can do a good job in prevention, it would be really good, and we encourage members of the public to get the flu shot to enhance their immunity, to minimize the chances of getting infected with COVID or flu. Mr. Lim Kong, President, the rebound of COVID has not reached its peak. The mainland has already approved the monoclonal pills for COVID for use. Will the government be importing these two kinds of special drugs for COVID? Undersecretary, well, we have seen the peak of COVID. The R number has dropped back to 1, and I'm sure that the number of COVID cases will decline. The member mentioned the two special drugs. Now, they have to be registered in Hong Kong first. Now, we have the procedure to procure new drugs to be brought into Hong Kong. I'm sure that through this channel, we can give them some consideration. We have to look at this on the basis of whether there is a need for that. And the experts will have to examine the potential new drugs before there will be any importation. We do have a proper channel for this to be done. Dr. Chow Man Kwong, President, thank you very much, Undersecretary, for encouraging the public to get the shot. I did ask the administration whether the vaccination centers will be reopened for people to get the shot for a fee, for instance, in order to minimize the burden on the healthcare system. The Secretary said that the government is protecting the high-risk groups, and for other people, they will have to fend for themselves. The infected cases have increased according to the healthcare sector, and Tamiflu, second valent, and many of them are really hitting the expiry date. Will the government be setting up the vaccination center for people to get the COVID booster by paying a fee? Undersecretary, thanks very much for the question, and thank you for your support for vaccination. Now, for public hospitals, they are there to serve the members of the public, in particular the vulnerable people, and not least the elderly. The fee-paying vaccination at public hospital, I must say that the private practitioners and GOPC doctors, most of them are in the private sector. Only 30% of the doctors are in the HA. So it is more convenient for people to get the COVID shot at the private practitioners. So we don't have any intention to create any clinic for fee-paying vaccination.
Question 3, the Honourable Chan Hock-Foong. President, it is learned that the government will allocate resources to the organization of weekend bazaars in collaboration with local groups in different districts. This year is to foster diversified local economic activities. In this connection, will the government inform this council, 1, whether it will compile an operating menu for weekend bazaars to publish information on suitable sites in various districts for leasing to operators of weekend bazaars, if so, of the details, 2. Given that there are views that the operation mode of Zibo barbecue stores in Jibo city of Shandong province is of valuable reference to Hong Kong, whether the government will, by drawing reference from the experience of Jibo City, incorporate elements of low spending and no ripping off of customers into weekend bazaars so that they can stimulate their local economy. And 3, whether it will draw reference from the experience of organizing gourmet marketplaces, such as simplifying the requirements for applying for temporary food factory licenses and including the element of gourmet to attract members of the public and tourists to visit weekend bazaars, thereby building Hong Kong as a visitor-friendly city where tourists feel at home. Secretary for Environment and Ecology, President. President, bazaars generally refer to venues set up on a temporary basis for buying and selling goods within a specified time period. The purpose of organizing bazaars varies. Some are for promoting local economy and tourism, some for providing opportunities to the grassroots and young people to start short-term businesses, while some for celebrating festival events. They may take different forms to serve their respective purposes. The government adopts an open attitude towards bazaars organized by organizations. When suitable sites are identified by interested organizations, relevant bureaus and departments will render facilitation so long as the bazaar proposals do not compromise the principles of maintaining public order, public safety and environmental, etc., and are supported by local communities. In recent years, various organizations have organized bazaars of different forms, and relevant government departments have also organized or supported the organizations of bazaars in relation to their respective policy objectives, such as the Lunar New Year Fairs and Farm Fest. In the 2022 policy address, the Chief Executive announced that the Home Affairs Department, HAD, and the Food and Environmental Hygiene Department, FEHD, will each organize 5 weekend bazaars to foster diversified local economic activities. In addition, the Financial Secretary announced in his 2023-24 budget speech the launch of the Happy Hong Kong campaign, which would feature the organization of several gourmet marketplaces across the territory to be coordinated by the Home and Youth Affairs Bureau, HYAB, to enable public and tourists to enjoy local and overseas gourmet food. On the questions raised by Mr. Chan Hock-Foong after consulting the HYAB and CSTB, we would like to reply as follows. 1. In order to facilitate organizations, individuals who are interested in organizing a bazaar to have an easier grasp of the relevant procedures and process involved, relevant policy bureaus and departments are currently updating the resource handbook for bazaar application to provide information on how to find suitable venues and apply for the use or lease of venues under the Housing Authority, Housing Department, Leisure and Cultural Services Department, and Lands Department, including the relevant venue restrictions, as well as inquiring and contact points, etc. The licenses and or approval required for organizing different forms of bazaars and the relevant application methods, how to assess the impact of the event on the local communities, and the procedures for consulting them as needed. As for venues, relevant departments are currently reviewing their respective venues with a view to identifying suitable locations for interested organizations, individuals to apply for organizing bazaars on specific dates. 2. The HYAB and HAD held 5 weekend bazaars markets last year and 3 Happy Hong Kong gourmet marketplaces this year without charging rent from the organizers. Admission tickets were distributed for free, and various offers were provided to the visiting public. The FHD will hold 5 weekend bazaars starting from this Thursday, May the 25th, adopting similar operating modes. It will not collect rent from the organizers or admission fees from public. At the same time, basic venue facilities and promotional assistance will be provided to stores. We hope that the above will allow the stores to operate at a lower cost and encourage them to give back to the community. 3. The FHD will draw on the experience of the Happy Hong Kong gourmet marketplaces coordinated by the HYAB and HAD and incorporate gourmet food element in the 3 weekend bazaars to be held from the 25th of May to June. The 3 bazaars will have good food stores to attract more public and visitors to visit and spend. As for the remaining 2 weekend bazaars to be held later, the FHD is also actively discussing with co-organizers for the setup of cooked food stores there. If heating up warming of pre-cooked food is involved at a temporary store during a public function, such as a bazaar, the store owner needs to apply for a temporary food license, factory license from FHD, which will issue the concerned license when the applicant meets the specified requirements. The department has been providing assistance and support to temporary food factory license applicants in relation to organizing bazaars. For example, it provides one-stop service to applicants by referring the application information to relevant departments such as the Fire Services Department for processing in parallel, so that applicants do not have to make the same applications to multiple departments, and the processing time for applications can be shortened. At present, the department usually completes the application process within 12 working days. So long as it does not affect food safety, environmental hygiene, and the safety of the public at the venue, the department will exercise the greatest flexibility in processing the temporary food factory licenses. When necessary, the department will explain the licensing requirements in detail to the event organizers and store owners to facilitate an accurate understanding of the relevant information, early planning of the class of businesses they will operate, and compliance with the license conditions. In the process of updating the handbook, the FHD will streamline procedures, such as refining the application forms for bazaar stores. Thank you, President. Mr. Chan Hock-Fong. Thank you, President. The HYAB has organized the gourmet marketplaces under Happy Hong Kong. This is most welcomed by the public. In the first sentence in the reply, it says that bazaars generally refer to venues set up on a temporary basis for buying and selling goods within a specified time period. That is the policy. But when it comes to implementation, there are a lot of problems with the details. Many district organizations would like to support the policy, so they are applying for government and venues to organize bazaars. But then the government departments do not allow them to buy and sell goods and collect money or cash at the venues. So how can bazaars be organized? Will you be issuing guidelines to the frontline departments and staff on how to process applications from district organizations to buy and sell goods at the relevant venues? Thank you. Secretary, thank you, President. Like I mentioned, we are updating the resource handbook, and in the process of doing so, we will be talking to the LCSD Lands Department and the Housing Department on the concern raised by members about rental of the venues. Cap 132B of Hong Kong law says that generally buying and selling of goods is prohibited unless there is prior approval from the relevant department. The government department has indeed approved for buying and selling of goods at bazaars. And we will be looking at the specific time period, and we'll make sure that the public order and the use of the venue will not be compromised, and a balance has to be struck. So when we review the guidelines, the government departments are now looking at identifying venues for bazaars to be held. These departments include the LCSD and the Housing Department. And going forward, when the guidelines have been compiled and the venues are ready, we will make an announcement and report the same to you. Ms. Eunice Yong, thank you, President. On bazaars and weekend bazaars, I'm very disappointed on the initiatives on this front. I think this is a failure on our part. We talk about Happy Hong Kong campaign. We want to attract more people to Hong Kong. But at the same time, what is happening in Hong Kong during the evening? Well, Mr. Chan referred to the Zibo market in Shantung. I've talked to those in the tourism trade yesterday. How come that we don't have the proper financial policies and the policies to organize night bazaars? Whether it's the EEB and the other departments, they're trying to help people in their application process. Maybe I will give you a 1 year or 2 year license or whatever. And also the mobile, the food vans. Well, you spent $2 million, but how can people stay afloat with that kind of policy? So how can we organize night bazaars and day bazaars? There should be a complete set or proper set of policies and a sort of one-stop service to facilitate the holding of bazaars. What policies do you have, Secretary? Like what we said in our reply, when individuals and organizations wish to organize bazaars, we do have a proper mechanism to take things forward. We make sure that they meet with the safety requirements, they meet with food safety requirements and environmental hygiene requirements. And if they can identify suitable locations and if they garner support from the community, we will facilitate them in organizing bazaars. So hence we are updating the handbook, and later on we will be compiling a list of suitable locations for bazaars. An announcement will be made shortly. Like I said, the HYAB and the HAD have organized 5 weekend bazaars in the past, and going forward, the FEHD from May to July will organize 5 other weekend bazaars, and the FS also announced the launch of the Hong Kong Happy Gourmet Marketplaces, and 3 sessions have already been held. And these are very much welcomed by the public, and in future, whether it's the public or the government organizing such bazaars, we would do as much as we can to facilitate the organization of bazaars. Mr. Stephen Ho, thank you. I agree with what Mr. Chan Hop Fung said. So if we don't cooperate or collaborate with the HAD, well, the organizers are not allowed to collect money on the venue. So there is a good example. Well, for Farm Fest, well, there can be a collection of cash, but that is because we organize the event together with the AFCD. In the 3rd paragraph of the reply, that's about temporary food factory license. And well, that covers only heating up and warming of pre-cooked food. So all you can do is heating up and warming of pre-cooked food. In other words, when we talk about good food, we talk about fresh provisions. So can we bake fresh bread for members of the public. No, you're not allowed to do that. Well, unless you are one of the 10 major charities bodies in Hong Kong. So can you take reference from our suggestion? Can you delegate authority to the frontline officers? And also there should be a review of your food safety standards. I'm not asking that to be lowered. I'm just asking that you give more flexibility. So I don't think it suffices to just allow heating up and warming of pre-cooked food. Thank you. President, Secretary, well, you asked several questions. First, about organizing bazaars, selling and buying of goods is involved, and transaction in cash is a concern. Well, in the past, cash transactions has taken place in a number of bazaars, and say in housing estates under the HD, whether cash transaction is allowed. We have talked to the HD where possible cash transactions are also allowed. Now, when we review the guidelines in the handbook, we set out more clearly what is and is not allowed. And then second, about the temporary food factory license. The member mentioned about heating up of pre-cooked food. Now, when we look at the Happy Hong Kong campaign going on, there are waffles and so on, which involve, or suffles, which involve heating up or warming. Now, we will be looking at the specific situation as long as, while the hygiene is not compromised based on the actual circumstances, cooking can be allowed. Well, of course, it depends also on the food involved, whether it belongs to something that is allowed. But then if it is open air and there is no good support facility, then maybe cooking is not allowed. But going forward, in our handbook, we'll set things out more clearly. The member suggested that the government departments review the situation. We will do that. And in future, through the handbook, we would tell people clearly the results of the review. Mr. Scott Lang, thank you. If bazaars are to be organized, well, if they are going to be popular, we should offer cheap goods. We should not just depend on tourists as visitors, but also the local people. And the local people know what they need. So we should adopt a bottom-up approach, and district organizations should come forth with the suitable locations to organize bazaars. But then the Undersecretary said that it is still the government which chooses or picks the suitable locations. And also not to mention about the limitations in the policies and government regulations. Well, let's talk about Shenzhen and also Bao'an district in Yamtian. Well, it started with a number of food stores taking the initiative to organize a bazaar. And then afterwards, the government did some facilitation. So will the government consider setting up a central office to try to collect views from the district organizations and adopt a bottom-up approach so that more bazaars can be held in Hong Kong? Thank you, President. All along, the policy is this. Well, that is set out in the handbook. We support a bottom-up approach. Apart from the government organizing bazaars, we welcome district organizations and individuals to take the initiative to host bazaars. Like I said, it is not the government picking the locations. The community bodies and individuals can identify suitable locations, and then they can come forth and make the application. And we'll try to facilitate as much as possible. And in the process, we've heard views that when they try to rent government venues, they bump into difficulties. So hence, we are talking to government departments. We will ask them what locations and what times we suit them, and we will try to ask the government departments to help out. And then we will also announce such suitable locations. The member also mentioned about a platform. setting up a platform. Now, when the applicant comes forth to apply for different licenses, the policy bureaus and the departments, including the FEHD, will help them. Well, please appreciate that bazaars serve as a platform, and different policy bureaus and departments have different policy objectives. Some people would like to help with poverty alleviation. Some are promoting youth development and the culture. Some are for organizing festive celebration events. So the bazaars are a neutral platform. Now, as long as the district organizations come forth with proposals of bazaars, they can come forth and make an application in accordance with established procedures. And we'll try to facilitate the process. Mr. Hu Chow, I would like to understand something about the what is said in paragraph 3 on temporary food factory license. Well, many members have spoken, and many stakeholders would like to come forth and apply for bazaars to be hosted. Say, for example, for various reasons, you are still processing certain applications, and some applications have been rejected. So maybe for those who have been rejected, give them another opportunity to make an application. And in the long run, we would like to see more stakeholders participating in bazaar hosting. And I think that will help you to take forward the organizing of more bazaars in Hong Kong. So will you, under the mechanism, give people a second chance to make an application? President? The government is reviewing the handbook. In the past, we've had views from the community that they haven't been able to book a suitable venue. It's not that somebody is using it, and maybe they can't do it this weekend. They can try the next weekend. Well, the gist of the problem is that the government departments should make public the venues that can be applied by organizations at what time. So in the communication mechanism, more should be done. We've had the members' views, so we will identify suitable locations, and if demand outstrips supply, we will look at how we would allocate suitable venues to different bazaar organizers.
Question 4. President, the Smoking Public Health Amendment Ordinance 2021, which took effect on the 30th of April 2022, is enforced by the Tobacco and Alcohol Control Office, or TACO, of the Department of Health. The ordinance prohibits the import, promotion, manufacture, sale, or possession for commercial purposes of alternative smoking products, or ASPs. In this connection, will the government inform this council, since the ordinance commenced operation, first, of the respective case counts involving the import, promotion, manufacture, sale, and possession for commercial purposes of ASPs detected by TACO, together with a number of successful prosecutions and the penalties imposed by the court set out in the table, whether it has evaluated the success of TACO's enforcement efforts. Second, of the details of TACO's work on curbing the online sale and promotion of ASPs, and whether it has evaluated the success of such work. And third, of the number of spot checks proactively done by TACO in the market, the number of cases involving the sale of ASPs found during such spot checks, together with the quantity and value of the product seized, and the number of details of other similar cases referred by other law enforcement agencies to TACO for follow-up actions. Secretary for Health. Thank you, President. I thank the member for his question. There are 3 parts in Mr. Lai's questions, and here's our consolidated reply. The Tobacco and Alcohol Control Office, it used to be the Tobacco Control Office. It was set up in 2011. This is the principal enforcement agency under the Smoking Public Health Ordinance. It is tasked with enforcement of the statutory requirements about the no smoking areas, restrictions on the sale of tobacco products, and the prohibition on tobacco advertisement and promotion. TACO also acts as a principal enforcement agency of the Fixed Penalty Smoking Offences Ordinance Cap 600. In 2022, when this amendment ordinance took effect, we wanted to better cope with the growing workload on tobacco control. So TACO hired more staff members to investigate smoking-related offenses. Now, there are roughly 171 frontline enforcement officers. From January to December last year, TACO conducted in total more than 35,150 inspections and issued 6,296 fixed penalty notices for smoking offenses. Under the Smoking Public Health Amendment Ordinance 2021, which took effect on the 30th of April last year, no person may import, promote, manufacture, sell, or possess for commercial purposes alternative smoking products or ASPs, and they include electronic smoking product, heated tobacco product, and herbal cigarettes. Now, since the new law took effect, TACO and the Customs and Excise Department worked closely and remained closely in touch. TACO's duty includes general inspection, law enforcement, prosecution, complaint handling, and verification of ASPs. For the Customs, they are tasked with intercepting illegally imported ASPs in passengers, cargoes, and parcels. So they work on whatever that's imported when it comes to ASPs. For the intercepted cases, they will be referred to TACO for follow-up actions. After the new law took effect, TACO's enforcement priority is combating the retail outlets of ASPs in the market and also to get rid of the face-to-face channels of ASP sale out there. Before the new law took effect, TACO had conducted large-scale inspections. They got a list of over 200 ASP retail outlets at that time. We have kept an eye on the list. After the new law took effect, TACO has conducted over 670 inspections at those outlets. No breach has been found. Now, on import cases, from April 30th last year to March 31st this year, TACO received in total 934 referrals from the Customs and also issued 131 summonses to offenders. Among them, 41 cases resulted in convictions. The fines ranged between $2,000 to $6,000. For the remaining cases, 202 cases either occurred within the grace period, that is the first 3 months after the new law took effect, or were cases involving passengers' voluntary declarations of the prohibited items to the Customs, and then there was disposal. So no prosecution followed. For another 254 cases, investigation showed no evidence for follow-up actions. We also consulted the Department of Justice, or DOJ, for legal advice. We found insufficient evidence for further prosecution. Now, for the remaining 347 cases, they're still being looked at. Most of them, we are about to issue the summonses. On in-town enforcement, TACO investigates complaints and referrals from other departments and takes corresponding actions. This includes covert inspections, test purchases, and also joint operations with other law enforcement agencies, that is, joint operations. Now, from April 30th last year to March 31st this year, TACO received in total 518 complaints and referrals on suspected sale or possession for commercial purposes of ASPs. 15 summonses were issued to offenders. These include 2 convictions involving possession for commercial purposes. The highest penalty is 2 months of jail. 234 cases were investigated, and then we also consulted the DOJ. We found not enough evidence for prosecution. For these cases, TACO seized 20,450 ASPs valued at over $180,000. For the remaining 276 cases, they're still being processed. TACO has also assigned designated staff to regularly conduct online surveillance and follow-up of complaints in respect of the online sale of ASPs. When we come across online sale, TACO staff will try to do test purchase and then follow up and investigate the cases. TACO will also reach out to the relevant bodies to remove the illegal online content. From April 30th last year to March 31st this year, more than 670 pages or accounts of social media platforms or local websites were removed. The crackdown on physical retail outlets has worked. ASPs have seen a shift to online sale instead. TACO will strengthen the monitoring and follow-up of online sale of ASPs and will continue to work with the customs in combating the illegal import of ASPs, in particular cross-border online sale. The figures of the Department of Health Enforcement in relation to ASPs can be found in the annex. Indeed, TACO now faces certain challenges in enforcing the ban on ASPs due to the limitations from the prevailing legislation. For example, officers find the ASPs and they have to adduce the evidence. They have to show the products are possessed for commercial purposes, and there's also the inability to trace the consignee on the relevant shipping documents. The new law has been in place for over a year. The public has had a reasonable period to handle the ASPs bought before the law took effect, and there is currently no way to acquire ASPs legally. The government will explore ways to further strengthen and tighten the relevant legislation, including considering a total ban on the possession of ASPs to reduce smoking prevalence. Next month, the government will also launch a consultation paper to gauge public views on this matter. Thank you, President. Mr. Lai Tong-kwok. President, the Secretary's reply shows that enforcement by TACO is really not effective based on what they found in the market. Now, they have 171 officers, and they issued only 6,296 summonses each year. That means on a day-per-day basis, that's 1.23 summonses per day. And that is simply not cost-effective. President, there are people selling e-cigarettes on social media. They have an entire industry of it. You can find them everywhere. I'm not sure what kind of action has been taken on that. And then in the streets, people can be seen vaping. I don't see why the Secretary is still saying in the main reply that the efforts are working. The government vowed to ban e-cigarettes, but the enforcement is ineffective with poor results. Let's look at the customs. In fighting smuggled cigarettes, they are doing very well. But the relevant statutes only empower the customs to intercept the cigarettes at the boundary control points. Even when they're intercepted, the cases go to the TACO. Will the Secretary consider proposing something just like what you have with the customs and police on clamping down on drugs? This means getting all law enforcement agencies to work together in fighting what is under Section 15DA of the ordinance. That is the offenses related to the sale of e-cigarettes, and step up the penalties. Secretary. I thank the member for his question. Currently, this is what the law says. If you have e-cigarettes for commercial purposes, that's against the law. The law enforcement agencies will take action. But if you're just vaping on the street, that's not against the law. Nothing in the law says you cannot do vaping on the street. in our tobacco control strategy, that is indeed a loophole. So our target is that in our strategy in the future, we want to do something about this. We want to have some form of controls, even for possession. I thank Mr. Lai for his suggestion on getting the police, the customs, and TACO to work together in enforcement. We will go back and consider this matter. We will have a discussion within our colleagues and see whether this can work. Dr. David Lam. Dr. David Lam. Thank you, President. I thank Mr. Lai for his question. Just then, the Secretary told us roughly 670 websites, local websites, were removed. What about non-local websites? Is there a way for TACO to deal with those websites? Dr. David Lam, you have already put your question over to the Secretary. President, I thank the member for his question. For overseas websites, we don't have the power to deal with those websites. Mr. Kwok Wai-Kang. Thank you, President. The main reply from the government says this. TACO has information on over 200 retail outlets for ASPs. 670 inspections were done. No issues were found. But then, for other government departments, they came across cases, 518 cases. They found ASPs, suspected sale of ASPs or for use for commercial purposes. So the crux of the matter is, for TACO, is it doing its job? Why has it failed to find those ASPs? And how come other departments found those ASPs and referred the cases to TACO? If the ASP is if the TACOs are missing the mark, then it may well happen that they fail to find anything online. Thank you, President. Other departments refer cases to TACO. Examples include, say, someone hands out a leaflet on the street about ASPs. These people are not selling the ASPs. We have talked to the DOJ about this. We don't have enough evidence, so it would be hard to bring prosecutions. Now, there are outlets selling ASPs. They sell to known customers they know well only. So we don't have enough evidence in those cases. Dr. Dennis Lam. Mr. Dennis Lam. Thank you, President. The main reply says this. In 2022, from January to December, 35,000 or so inspections were done. That's more than 1,400 inspections per month or so. For frontline enforcement officers, there are only 171 of them. But that's just the tobacco control. We're leaving out alcohol control. For the 171 officers, do you have enough people deal with the smoking problem? Will there be more manpower to deal with tobacco control? Thank you, President. TACO works on alcohol and also smoking. The work involves not just control, but also education. So tobacco control takes not just enforcement. Indeed, we have just 171 officers. We have quite a number of vacancies, 200 or so vacancies. We are getting hiring difficulties to get people to work at TACO. We will work harder in hiring to get more officers to take part in the enforcement. Thank you, President. Mr. Dominic Lee. Just then, the government told us they had a hard time securing the evidence. So only 15 summonses were issued. But then Mr. Lai Tong-kwok was saying, online, they have an entire industry of ASP sales. It's easy to buy them online. Has Has the government tried sting operations? You can find the culprit and the evidence. In that case, you cannot say you don't have the evidence. Thank you, President. Indeed, we have done sting operations. In those cases, the outlets sell to customers already known to them only. So for new customers, they will have a hard time buying the ASPs. So sting operations don't really work well. Tobacco control requires many measures, and we're not just looking at selling for commercial purposes. In the future, we're looking to expand the scope so possession may be covered. Just like controlling chronic illnesses, you need a range of measures instead of relying on one measure to achieve the goal. Mr. Peter Hsu. Thank you, President. Now, your colleagues may have told you about the problems with sting operations. So the sellers only sell to regulars. Then why are they still putting out the ads online if they have regulars? If they already have all the regulars, they don't need ads. They have the ads online because they want new customers. You cannot catch them because you have probably exposed yourself. Your officers have already given themselves away by all kinds of cues. You have to make sure you actually pose like a real customer in sting operations. TACO may have given you all the reasons, but you have to reconsider it because some of their arguments simply don't work. You need to get involved in the process or get a different team to manage the TACO team instead of just letting TACO make all the decisions. Would that be done? Secretary. Thank you, President. I thank Mr. Hsu for his comments. I think he agrees that smoking is harmful to health and people shouldn't do vaping. I thank the support shown by Mr. Peter Hsu. Now, on sting operations, indeed, we can review our approach. If I go to do the sting operation, I doubt they will sell the ASPs to me. We will talk to our colleagues to see what options we can take. But first of all, I do thank Mr. Hsu for his support.
Question 5. Mr. Adrian Ho. Thank you, President. To enable the recovery and development of Hong Kong's tourism industry, the government has launched the Hello Hong Kong Global Promotional Campaign, and the Hong Kong Tourism Board, TB, has also rolled out promotional activities to attract visitors. In this connection, will the government inform this council? 1. Given that the aforesaid campaign includes giving away to visitors over 6 months about 500,000 air tickets purchased in advance by the Airport Authority Hong Kong, AA, from several local airlines, and distributing Hong Kong goodies visitors consumption vouchers to 1 million visitors so as to attract them to visit and spend money here. Whether the government has set targets for the effectiveness of such activities as the basis for such activities. 2. Whether prior to conducting global publicity activities to promote Hong Kong, the authorities have established publicity targets, including countries and regions as well as age groups of visitors in order to formulate publicity strategies, and whether the authorities will organize activities highlighting the unique culture and characteristics of Hong Kong with a view to building Hong Kong's tourism brand and selling points as well as telling stories of Hong Kong well. If so, of the details of the activities. Thank you. Secretary for Culture, Sports and Tourism. President. Apologies. In respect of the question raised by the Honourable Adrian Ho, having consulted the Commerce and Economic Development Bureau (CEDB), Constitutional and Mainland Affairs Bureau (CMAB), Transport and Logistics Bureau (TLB), and Information Services Department (ISD), the consolidated reply is as follows. A. According to the information provided by the TLB, the Airport Authority AA purchased around 500,000 air tickets from 3 local carriers in 2020 to support the aviation industry, which was hard hit by the epidemic. To complement the government's Hello Hong Kong global promotional campaign launched in February this year, AA launched the World of Winners ticket giveaway campaign in March to give away these tickets through the three carriers, the travel trade and public organizations, to increase passenger throughput, speed up airlines recovery, as well as boosting the business of up and downstream services. Winners of the free tickets also receive special offers on hotel accommodation, shopping and entertainment, etc. The Hong Kong Tourism Board TB has been supporting the promotion. The campaign will last for 6 months. So far, about 200,000 air tickets have been given away. The AA expects that the campaign will bring more than 1.5 million visitors to Hong Kong. Riding on the launch of the Hello Hong Kong campaign, the TB also launched promotional activities to welcome visitors, including distributing Hong Kong goodies visitor consumption vouchers for dining and retail outlets, attractions, or transport to 1 million visitors through TB's Discover Hong Kong e-platform. As of mid-May, the vouchers have been distributed to more than 760,000 visitors. The TB has been promoting Hong Kong as a tourist destination, leveraging on its uniqueness such as Victoria Harbour, city life, the natural scenery, traditional culture, global gourmet, as well as culture, arts and sports mega events for different visitors. Attracting high value-adding visitors is our major target. In addition to mega events, the TB will also step up efforts to attract meetings, incentive travels, conventions and exhibitions, MICE events of various scales and types. With the launch of Hello Hong Kong, the TB and government departments have sent out welcoming messages to the world to promote Hong Kong to attract visitors. The TB expects that short-haul markets such as the mainland and Southeast Asia will resume faster than long-haul ones. So the TB first targets short-haul markets in promotion by inviting the travel trade, the media and influencers in the mainland to visit Hong Kong in depth, bringing CCTV famous news anchors to Hong Kong to present the city, and inviting popular mainland reality TV shows to present Hong Kong's local gourmet, TV drama, and new attractions. Besides, the TB has organized a number of mega field trips for the trade in Southeast Asia to promote new products of Hong Kong. The TB also invites stars and directors from Korea, Thailand, and the Philippines to film in Hong Kong and promote the city. This year, the TB plans to invite over 1,000 people from the trade, media, film stars, influencers, and superfans to visit Hong Kong to generate positive reviews. At the same time, the TB plans to lead the trade to participate in more than 20 tourism exhibitions and MICE-related events in the mainland and overseas this year. Meanwhile, Hong Kong Economic and Trade Offices, ETOs, maintain close liaison with the international community to promote the government's major policies, Hong Kong cultural and creative industries, organize arts and cultural activities, and use visits of senior government officials to promote Hong Kong as Asia's emerging arts and cultural hub, a quality tourist destination, and Asia's world city. Besides, mainland offices of the government arrange senior government officials to attend promotional activities, give speeches and media interviews to enhance promotion during official visits. Mainland offices will continue to make connections, use online and offline platforms to promote Hong Kong's advantages and opportunities. The ISD aims to promote Hong Kong's advantages, potential, and opportunities to overseas countries and the mainland, showcasing Hong Kong's vibrancy and attractiveness as Asia's world city. The ISD has also stepped up promotion and publicity in major markets, in particular the Middle East and ASEAN countries, to tie in with the government's policies to attract enterprises investment. Target audience include business and political leaders, investors, entrepreneurs, professionals, and young talents. Cultural, sports, and tourism mega events will provide visitors with diverse and rich experiences and attract visitors. In 2023 to 24, mega events include the Hong Kong International Dragon Boat Races, Harbour Chill Carnival, Hong Kong Cyclothon, Hong Kong Wine and Dine Festival, Hong Kong Winterfest, Art Basel Hong Kong, Hong Kong Sevens, Hong Kong Pop Culture Festival 2023, Hong Kong New Year Countdown celebrations, and Hong Kong Chinese New Year celebrations next year. The TB will also expand the Hong Kong neighborhoods promotions, injecting new elements into Old Town Central, Sham Shui Po, and West Kowloon to attract visitors with local culture. In addition, it will continue with the pilot scheme for characteristics local tourism event to provide funding for events showcasing local characteristics. The Leisure and Cultural Services Department is organizing the Hong Kong Week in Bangkok, Thailand from October to November this year to feature the unique East-Meets-West art and cultural ambience of Hong Kong. In-depth and personalized travel experience is the trend. With a variety of cultural, sports, and mega events, Hong Kong will continue to attract visitors from the world. We believe that the number of visitors will continue to climb this year, which will benefit the tourism, retail, catering, business, exhibitions, and other sectors. Thank you. Mr. Ho. Thank you, President. I also would like to thank the Secretary for his reply. Apart from promoting Hong Kong, the service industry and the service quality, the image are equally important. Very often, frontline workers gives the first impression to visitors. There are some press reports making adverse coverage of the trade. Have you talked to the trade to encourage frontline practitioners to provide quality service and to provide in order to forge favorable conditions for the revival of the tourism industry and the aviation industry? Secretary, we do agree that for those working at the forefront in the service industry, they should provide quality service. The Travel Industry Authority has organized training courses to enhance the quality of practitioners. And there are also courses for tourist guides and practitioners in the tourism industry to help them provide good quality of service. But unfortunately, there are always an occasion or two that cast a shadow over the quality of our service. We do our best to promote Hong Kong's image, but there is always a fly in the ointment. We do our work well. We will aim to promote to every sectors in Hong Kong to get them to put the best foot forward. At the same time, we will promote Hong Kong well outside Hong Kong, and we will promote our culture, our service quality, and our hospitality. Within Hong Kong, we will promote Hong Kong so that we can rebuild our image as a hospitable city where you will find good service. Mr. Tanya Heng, good morning. Thank you. Most of the visitors coming to Hong Kong don't just shop like they did before. They want to have a more in-depth experience. Hong Kong's name as a shopping paradise is eclipsed, but we have to build Hong Kong into a paradise for good experiences. I would like to ask, would you work on eco-tourism, cultural tourism, and use them as selling points to enhance visitors' experience? Secretary, I fully agree to members' suggestions. In the past, people talk about Hong Kong as a shopping paradise. Still, to this day, shopping is an attraction. In the many surveys done by the Tourism Board, we found that visitors look for more in-depth experience. They want more personalized services. They look for tourism. They look for experiences relating to culture and arts. That's why I said that more visitors are looking for personalized experience. Hong Kong offers you many different things. We can provide diverse experiences to our visitors. Well, if you visited the Tourism Board's website, perhaps in the future we can give you more information to legislators. The TB doesn't just talk about shopping or food. The focus is also on our heritage, culture, art, green tourism, special festivals. There is plenty of publicity in this regard. We also promote our theme parks. We want to tell different visitors that there is always something for you in Hong Kong. Mr. Perry Yiu. Thank you, President. Of course, we have to promote Hong Kong well to attract visitors to come here. This is crucial to the revival of our tourism industry. In the Secretary's main reply, he's already said that starting from February, a lot of work has been put into attracting inbound visitors, and we have seen the figures. But what about within Hong Kong? Does the government have any plans to promote quality service and customer is always right? You need to advocate professionalism in the service industry so that everyone in Hong Kong will work together to rebuild Hong Kong as a friendly city, as a city of hospitality. Secretary, after the opening of the borders, our focus has been on external publicity because we need to tell our major markets that Hong Kong has reopened and visitors are most welcome. The border was fully opened in February, so the first 3 months our focus was on external publicity. Our work internally on practitioners has never stopped. Well, through the Travel Industry Authority, as I said, that they have provided seminars and training. We're all working together to boost the development of the tourism industry. We see there are more and more visitors coming to Hong Kong. We'll talk to the Tourism Board about local large-scale publicity. Practitioners in the tourism industry come across visitors a lot, but many visitors come here on their own. They don't join tours, and they will just wander about. They ask passers-by for directions. They visit local shops. So I think it's down to personal etiquette, culture, and the spirit to help. In this regard, we will do our best to promote these good qualities. Mr. Edward Wong, number of members have talked about development of our tourism industry. They talked about quality of service and hospitality. We have a manpower shortage, which in turn affected our economic recovery, including the tourism industry. You see that housekeeping can't recruit enough people and restaurants can't hire enough people. I would like to ask whether they have any ways to address these issues so that we can provide better services. Secretary. Regarding manpower shortage, especially the front of house manpower shortage, I am sure that different sectors have told the government about this. We are conducting studies. Many different areas and levels are involved before we can find a solution. We are working at full steam. We hope that within a very short time we'll be able to come up with solutions to address the problem. Mr. Benson Look, thank you. In the main reply, it says that to publicize Hong Kong's art and culture, much effort has been spent on it. They said they will use influencers to help. I noticed that there are some influencers talking about the Cheung Chau Bun Festival. There were supposed to be 3 huge mountains of buns that is 45 meters high, but instead we only see 3 giant pictures. And it was said that the organizers tried to increase the payment, the price by 3-4 times, but still, because of lack of manpower, the supplier could not provide the 3 giant mountains of buns. That's regrettable. The Bun Festival, the parade, after suspension of 3 years, there is a resumption. Well, can we use real buns instead of pictures? Can we give the real experience to visitors? Can we have the 3 giant mountains of buns? Secretary, of course, we support local organizations to organize these attractive events. And this event is unique to our culture, and it has significance. Of course, different difficulties were encountered. And as we've seen, that for the event you mentioned about, the organizers encounter difficulties to get the mountain of buns constructed. And there aren't many people who are equipped to do the job. And I learned that it's now technically not feasible. Can the government find people to do it? I'm afraid not. We're talking about the same group of people who have the technical knowledge to construct the mountain of buns. We hope that, this next year we may be able to get it done. We'll continue to liaise with the organizer to see what more we can help.
Last question seeking oral reply, Ms. Lam So-wai. Thank you, President. According to the report of the Program for International Student Assessment 2018 published by the OECD, the prevalence of Hong Kong students being bullied at school is as high as 29.3%. Moreover, with students becoming increasingly reliant on the internet for learning, cyberbullying incidents have also increased. In this connection, will the government inform this council, first of all, of the respective number of requests for assistance, complaints, and reports about school bullying received by the authorities since January 2020, whether they have studied the underlying causes for the occurrence of such cases and formulated corresponding plans such as strengthening investigation punishment, setting up a dedicated 24-hour reporting hotline, as well as stepping up efforts in holding teachers and school authorities accountable. If so, of the details, if not the reasons for that. Second, focusing specifically on cyberbullying, whether the government will, in response to the call of society, consider afresh the establishment of a commissioner for online safety for teenagers to follow up on cases of cyberbullying in collaboration with the school liaison officers of the police, if so, the details, if not the reasons for that. And thirdly, given that some jurisdictions such as Singapore, the United Kingdom, and the United States have made cyberbullying a criminal offense, whether the government will enact the relevant legislation in the light of the worsening situation of cyberbullying locally. If so, of the details, if not the new measures in place to address the problem of cyberbullying and prevent young people from becoming the victims of cyberbullying. Thank you, President. Secretary for Education. President, all along the government has been adopting a zero-tolerance policy on bullying in schools. The Education Bureau has provided schools with clear guidelines to facilitate them to adopt the whole-school approach in formulating and implementing school-based anti-bullying policies, as well as handling school bullying incidents in an appropriate manner. We also nurture students' positive values, including respect for others, as well as inclusion and friendship through the curricular learning and teaching resources, diversified activities, and teacher training. The EDB also collaborates with different government departments to cultivate a harmonious and caring school environment. With regard to a study on bullying among students in the report of the Program for International Student Assessment 2018, we noted that the findings were mainly based on students' perception. And, as stated in the report, may be affected by cultural and social norms in different regions, as well as students' ability in distinguishing bullying. When compared with their counterparts in other regions, a higher proportion of students in Hong Kong indicated that other students made fun of them. This may include innocent jokes among peers. Therefore, only with a thorough understanding and careful analysis can we find the right remedies to the problem. Our reply to Ms. Lam So-Wai's question is as follows. According to the information collected from the EDB's annual questionnaire survey on guidance and discipline cases in public sector, primary and secondary schools, the number of student cases handled by schools related to school bullying in the past 3 school years was about 380 on average per year. In fact, schools have all been responsible for maintaining a harmonious environment in schools and handling incidents of bullying. With reference to the School Administration Guide, guidelines on teachers' professional conduct, and related circulars issued by the EDB, schools are required to formulate school-based anti-bullying policies and handle school bullying incidents properly with education, guidance, and protection of their students. Schools would refer to relevant guidelines of EDB for immediate intervention, mediation, in-depth investigation, and follow-up, and to provide appropriate guidance for the students involved. For cases of a more serious nature, students are required to report to the EB. If child maltreatment or illegal act is involved, schools should consult the SWD or report to the police for immediate assistance. Schools have all along been handling bullying incidents properly and explaining the incidents to parents in accordance with school-based policies. Parents and other people may also seek assistance from the EDB as necessary. From 2020 to 2022, the EDB received a total of 35 requests for assistance, complaints, and reports in relation to school bullying. And we have followed up and handled these cases. The occurrence of school bullying can often be attributed to factors such as the personalities and social skills of the students involved, as well as the awareness towards bullying and tolerance. To resolve the problem, we must start with value education. As such, the EDB has encouraged schools to build a caring school culture, continuously organize programs and activities on students' growth to develop students' positive values and good moral character, and launched the resources packages on prevention of school bullying and promoted the Harmonious School No Bullying campaign with a view to help schools further strengthen their anti-bullying work. In respect of cyberbullying, we have provided schools with the Information Literacy for Hong Kong Students Learning Framework, teacher training, information kits, and video series to support them in undertaking relevant education. We have also cooperated with other government departments and NGOs to arrange student activities and parents' talks to teach students not to initiate and participate in cyberbullying. An NGO has been commissioned to provide for students, parents, and teachers of all primary and secondary schools in Hong Kong one-stop telephone and online support and counseling services to help them deal with problems including cyberbullying. We believe that with the efforts of different stakeholders and cooperation between various sectors in the community, we can build a more harmonious and caring school environment where our students can grow up healthily. The Hong Kong Police Force attach great importance to the problem of school and cyberbullying and have been actively adopting a multi-agency approach to closely liaise with the young people by working with stakeholders such as schools, parents, and NGOs through the school liaison officers in various police districts. The police have also organized crime prevention talks and diversified youth activities in various districts to raise law-abiding awareness of youngsters. A large-scale educational publicity campaign, child protection campaign, was launched by the police in 2021 and 2022 to promote, amongst other things, the messages of preventing school and cyberbullying. The police also arranged for mobile publicity vehicles to visit schools to provide virtual reality scenarios on bullying for young people to experience the harm of bullying. There were also anti-bullying animations to remind children and adolescents that school bullying may involve illegal acts. At the same time, it shows them where they could seek help. Art workshops for children were also organized to remind children to say no to bullying and encourage them to help victims of bullying. The police plan to organize the child protection campaign again in 2023. The police have been striving to strengthen the liaison and cooperation with primary and secondary schools. The EDB and the SWT through the Police School Liaison Program to enhance the effectiveness and efficiency in tackling juvenile delinquency. Through interdepartmental and cross-sector cooperation, the police established a good relationship with students, teachers, and parents to try instill a sense of discipline and positive values in students. In 2022, the school liaison officers of the police paid more than 10,700 visits to primary and secondary schools and organized over 1,400 school talks. In addition, through online social platforms and the one-stop child protection web application launched last year, continue to disseminate latest information on anti-crime and related legislation to the general public and our youth to enhance anti-crime awareness in the community. The Internet is not an unreal world that is beyond the law. As far as the existing legislation in Hong Kong is concerned, most of the laws enacted to prevent crimes in the real world are applicable to the online world. Any bullying activity, whether cyber or not, are governed by relevant legislation if they involve criminal offenses. If the bullying incident involves a criminal offense such as criminal intimidation or blackmail, the police will follow up and investigate. In view of the potential for information and technology, the computer and the Internet may be exploited to carry out criminal activities. A subcommittee under the Law Reform Commission has initiated a study on cybercrime to review existing legislation and other relevant measures, and at the same time examine relevant developments in other jurisdictions and recommend possible law reforms in accordance with the findings. The government will pay close attention to the progress of the LRC study. Thank you, President. Ms. Lam Soy. Thank you, President. First of all, I'd like to thank the Secretary for your response. Well, any bullying act is one too many. A child who has to go through bullying, it will have a long-term impact on his or her health. In the first part of the reply, it seems that in the past 3 school years, only about 380 cases on average per year were related to school bullying. But then towards the end of the reply, there were around 35 cases in the year 2022. I want to know why is there such a huge discrepancy in number? Well, on the 380 cases per year, we are talking about the cases dealt with in accordance with the school guidelines. So we do have a whole school approach and a school-based anti-bullying policy that deals with school bullying. As for the 35 cases, after schools have handled the bullying-related cases, the persons involved and other different stakeholders such as parents and teachers, when they're dissatisfied with the outcome, will come up to us to request for assistance. The 35 number is actually similar to that of previous years. Thank you. Ms. Carmen Can. President, other than education, legislation can also help us to stop cyberbullying. And as I see that the LRC has initiated a study on cybercrime, I have actually said before that there should actually be more recommendations made on crime outside of Hong Kong, such as cybercrime. It should be formulated into legislation to ensure that crimes outside of Hong Kong can also be handled, because any crime that is not within the jurisdiction of Hong Kong, such as doxing, can also be handled. I want to know how the administration will handle that. Who will take this question? Under Secretary for Security. Thank you, President. Well, on crimes outside of our jurisdiction, if we can better protect our young people, this should be put into consideration. In recent years, we have seen child porn acts that should be subject to our handling as well. Mr. Chu Kwok Kang. Well, actually, we don't know whether cyberbullying is considered a crime or not, because we don't know how it could be defined. It could actually be indecent use of computer. I want to know, for cyberbullying, have you actually, through the school liaison office, approached the police, and that and that there's an SP's description, Secretary, for any serious crimes, the school will need to approach the police, whether it be an online or offline crime. So the police will still take the case. It's up to the seriousness of the case and the seriousness of the bullying. Under Secretary for Security, when the bullying actually causes physical harm, then or loss of property, then and if the criminal is under 18, and usually we would just give an SP's discretion instead of prosecuting the person. Mr. Zhu Kwok Hung. Well, I've worked in schools before, and I've been a counseling officer, and I see that actually these counselors before did not have to take a professional course on that. I want to know whether the Secretary will require new counselors or discipline officers to take a professional course on counseling, so that they can actually act in a more professional manner in the dealing of such cases. Secretary. President, the EDB has always been encouraging teachers in continuing education and have been providing workshops, training, and lectures for teachers to help them raise awareness in bullying and to teach them how to handle such cases. On Mr. Chu's recommendation that teachers should take up such courses, we have always been encouraging teachers to do that. We provide 102 hours of continuing education for primary and secondary school teachers. So for counseling teachers, we do encourage them to take up such courses, and we also arrange for 48 hours of extra training, including management and leadership courses, so that the whole school can also participate in such training. We see that about 20% of the teachers in subsidized primary and secondary school teachers have completed such training in the year 2021. For those who join in our training, we're talking about 2,100 teachers or counselors or discipline officers from schools. In the future, we will continue to step up a professional support in this regard. Ms. Nixie Lam. Thank you, President. I am happy to hear that there should be mediation and immediate intervention for bullying. Well, I have a friend, a parent whose child is suffering from depression because of bullying. The school, as a gatekeeper, should actually enhance their responsibility and to make it clear in the following up and reporting of bullying cases. Would the administration consider requiring schools to set up a anti-bullying task force for teachers, parents, and counselors, and even cooperating with the police on that, so that they would know how to provide immediate support? Secretary, thank you. We have clear guidelines that the schools should adopt a zero-tolerance approach. Any school bullying, discrimination, or violence in any forms could not be tolerated and must adopt the whole school approach in formulating and implementing school-based anti-bullying policies. So this has been made clear in the school administration guide and the guidelines on teachers' professional conduct. Schools must immediately intervene, mediate, and handle school bullying actively and seriously, and to provide appropriate guidance and education for the teachers. And they must also review their handling mechanism. Professionals from the EDB would also visit the schools to review the implementation of the anti-bullying policies and its implementation, and to provide support and advice. We would also deal with any issues that the schools may encounter. Stakeholders such as parents or teachers who are dissatisfied with the handling can approach the EDB directly, and we will follow up with each case seriously. So when Ms. Lam asked why there are only about 35 requests for assistance out of 380 cases per year, this is because the stakeholders are not happy with the school in its handling of the cases. Dr. Johnny Ng. President, earlier in the University of Hong Kong found that actually the digital literacy can help students better their behavior. So would there more activities and events be organized to support students? Secretary, we know that the most important part of school bullying is the students' tolerance and their digital literacy. Therefore, we have actually set up a framework on the information literacy so that students would understand cyberbullying and that the negative impact it may involve and the consequences of those who involve themselves in bullying. And they must also use the digital or use the cyber web in an appropriate manner. We have been working with the police and the teachers groups, and to work together also with the OGCIO on enhancing digital literacy. And we have also been providing support for parents so that parents can also support their children at home to use information technology in a more disciplined manner. We hope students can also self-learn, and we have actually set up some programs to enhance knowledge on cybersecurity. And we have also commissioned NGOs to set up telephone support lines. Thank you.
Government bills. This Council resumes the second reading debate on the Road Traffic Amendment Autonomous Vehicles Bill 2022. Mr. Frankie Yik, Chairman of the Bills Committee, will first address the Council on the committee's report. Mr. Frankie Yik. Mr. President, as Chairman of the Bills Committee on Road Traffic Amendment Autonomous Vehicles Bill 2022, I deliver this report to the Council. The bill seeks to amend the Road Traffic Ordinance CAP 374 to introduce a flexible regulatory regime to facilitate the research, trial, and application of autonomous vehicles or AVs in Hong Kong. The Bills Committee has held 2 meetings with the administration to examine the bill and invited written submissions from the public. Members generally support amending the ordinance to provide for the definition, pilot use, pilot regulation, and code of practice for AVs. Members also note that the bill empowers the Secretary to make the pilot regulation and change the effect of some of the existing provisions. Expressing concern that the development progress of AVs in Hong Kong is lagging behind the mainland cities like Shanghai and Shenzhen, some members consider that the administration should draw on the experience of these cities in the development of autonomous driving technology and actively engage in more exchanges with the local governments and relevant organizations, especially in promoting the development of vehicle-to-everything V2X technology, so as to further facilitate autonomous driving and V2X connectivity in the Greater Bay Area. Given that AV trials are currently conducted within designated sites or areas, some members consider that the trials are too restrictive and does not allow for comprehensive testing of AVs in terms of different road conditions, weather conditions, interaction with other vehicles, etc. Some members suggest that the government should set up designated areas, such as in the northern metropolis under planning, for the wider testing and application of autonomous driving technology in small areas on an early pilot implementation basis, and finalize the relevant details in the planning of the areas concerned. In response to members' views, the administration has pointed out that the government has been promoting the development of autonomous driving technology through various measures and providing funding support for relevant research projects through the Innovation Technology Fund and the Smart Transport Fund. The government will continue to keep in view the latest development of the industry and maintain close communication and cooperation with the mainland to achieve V2X connectivity with the mainland. As for setting up designated areas for conducting AV trials, the government will actively consider the suggestion. The proposed Section 138 of the bill empowers the Secretary to regulate the carrying out of AV schemes on a pilot basis by making the pilot regulation. Under the proposed Section 143, the pilot regulation may provide for matters such as the insurance relating to AVs, the maintenance of data, and handling of accidents. A member engaged in the insurance industry has pointed out that if an AV is to be tested or used on roads, the AV concerned must have a valid third-party risks insurance policy to provide protection against personal injury or property damage that may arise out of the use of the AV. As the relevant data on the use of AVs on roads are still not available for reference, the consideration of risk factors of AVs will be very different from that of conventional vehicles. However, the administration has not yet communicated with the industry on the issue of underwriting third-party risks insurance policies, which is a cause of concern to the industry. With reference to overseas legislation, the legal advisor to the Bills Committee has inquired with the administration about why the insurance arrangements in respect of AV trials are not provided for the bill. Members have inquired whether the data collected from relevant AV schemes can be used commercially in order to encourage more investors to participate in the research and development of the technologies, as well as the reporting and handling of accidents that may arise from AV systems. The administration has explained that the existing vehicle registration and licensing system will equally apply to AVs. On this premise, the existing legal liability of registered owners and licensees stipulated under various ordinances, including the requirement to purchase insurance for licensed vehicles, will also apply in the case of AVs. The proposed Section 143D of the bill also provides that the pilot regulation may provide for the protection of third parties against risks of personal injury or property damage arising out of the use of AVs. In addition, as the requirement for vehicle data recording is relatively technical, the administration considers it more appropriate to set out the provisions in the pilot regulation. The administration has also pointed out that before implementing the insurance-related matters in the pilot regulation, it will certainly communicate fully with the relevant trades to enable them to understand the relevant details of AV schemes so as to allay their concerns. On members' suggestion, the government has met with the Hong Kong Federation of Insurers and representatives of the automobile sector and the public light buses trades in February 2023 to introduce in detail the contents of the bill and the relevant insurance arrangements, and has further consulted the trades in this regard. As regards the data collected from AVs, the Transport Department will ensure that the data and records of AVs are properly maintained by the pilot participants in accordance with the requirements of the pilot regulation to be made in the future. The Transport Department will continue to discuss with the Technical Advisory Committee on the application of autonomous vehicle technologies in Hong Kong on how to make wider use of the data of AVs to promote the development of the relevant technologies. As for the reporting and investigation of accidents involving AVs, the pilot regulation will clearly set out the relevant requirements, and the Transport Department will give top priority to ensuring safety when vetting and approving applications for pilot licenses. In response to members' inquiry on how to enhance the safety of AVs when they are being used on roads, the administration has advised that the Transport Department will require the display of a unique identification on an AV to enable other road users to clearly identify the vehicle concerned as an AV. In drawing up the identification requirements, the Transport Department will consult the police to ensure that the identification can effectively assist the police in law enforcement. Relevant conditions will also be set according to the unique situation of individual trial and use of the AVs to ensure the safety of other road users. Members are gravely concerned that autonomous driving technology will reach the level of highly automated driving or even fully automated driving. That means levels 4 and 5 of driving automation, such that the backup operator only takes control of the vehicle if necessary, or one operator takes control of multiple vehicles at the same time, or multiple operators take control of one or more vehicles on a shift or rotation basis. Members have inquired how the legal liabilities can be determined and how the relevant law enforcement agencies can effectively enforce the law in the event of an incident or an accident involving an AV. The administration has explained that although the mode of operating and driving an AV is different from that of a conventional vehicle, the definition of driver in Section 2 of the Road Traffic Ordinance Cap 374 still applies to the operator of an AV who is inside or near an AV or at the remote control room. When operating an AV, these persons should also bear the same legal liability as the existing driver under the relevant ordinances. To prepare for the future scenario where an AV may not require a human operator at all, The proposed Section 141, subsection 1 of the bill provides that the pilot regulation may provide for how a reference to a driver in any provision of any ordinance is to be interpreted for an AV. On law enforcement, the administration plans to require as a condition of the issuance of a pilot license that the pilot proprietor submit the information of the designated backup operator for each of the AV for vetting. It also plans to require, when making the pilot regulation, that each pilot AV be equipped with a journey recorder with detailed records of relevant journey data, operation records, and video footages. The pilot proprietor will also be required to provide such records upon request by the Commissioner or any authorized persons. In the event of an incident, the law enforcement agencies may use these records to trace the cause of the incident and determine the liability. Members note that the proposed new Section 142 bracket 1, 142 bracket 3, and 146 bracket 1 in the bill seek to empower the Secretary to, by means of the pilot regulation, exempt a pilot matter from any legislative provision, disapply a legal requirement in relation to a pilot matter, or enable the application of a provision in relation to a pilot matter with modifications, collectively referred to as disapplication provisions. Members have inquired about the justifications for conferring the relevant powers and the reasons for proposing to empower the Commissioner to, by administrative means, make an application or disapplication notice which may disapply the provisions and would not be subject to the scrutiny of LegCo. The administration has explained that AV technology is rapidly evolving, and yet there is no universal standard governing the use of AVs at this stage, and it is not practicable to codify all the detailed technical and operational requirements into statute law. It is therefore necessary to introduce into the bill the power for the Secretary and the Commissioner under different circumstances to disapply legislative provisions in order to provide a flexible regulatory regime and to facilitate attaining the object of researching into, testing, and evaluating AV technology. The proposed new sections contain clear parameters on the Commissioner's exercise of such power, including that the Commissioner needs to ensure that the disapplication of a traffic provision will not undermine the safety of the pilot matter. The administration foresees that most disapplications made by the Commissioner would be relevant to highly technical and case-specific matters. In response to a question on how to assist the public in knowing that the Commissioner has made a disapplication notice and in understanding and complying with the amendments in such notice, the administration has advised that the proposed Section 149 of the bill provides that a disapplication notice made by the Commissioner in relation to the relevant disapplication must be published on the website of the Transport Department. As regards issues relating to the future testing and application of AVs, the administration will consolidate the relevant information and progress of work, including the implementation of these applications, and report to the LegCo panel on transport as appropriate. Members have no objection to the technical and drafting amendments to the bill proposed by the administration. The administration or the Bills Committee will not be moving any amendment to the bill. Mr. President, I'd like to offer my views on the bill. In 2017, we started the trial of autonomous vehicles in Hong Kong. However, the trials only took place after obtaining a moving permit. The trial did not allow the AVs to run on the roads of Hong Kong, so the potential is limited. In order to develop Hong Kong into a smart city, we need to formulate a policy framework with laws and regulations supporting the development. The Liberal Party supports this bill to introduce a regulatory regime for autonomous vehicles. The code of practice will be promulgated such that different classes of autonomous vehicles will be allowed to conduct trials on the roads of Hong Kong so as to prepare for the wider use in the future. Nowadays, instead of having mechanical components, cars or vehicles are run on electricity. This is the global trend, and many cities around the world are conducting autonomous driving technologies. According to a report, 53 cities in the world are now developing autonomous vehicle driving technology. In Singapore, back in 2015, they started conducting trials on the use of AVs relating to taxis and other kinds of public transport. In South Korea, in Seoul of South Korea, and California in the United States, AVs are already allowed to carry passengers with reward on a limited scale. In the mainland, the development is very rapid. Last year in Shenzhen, the legal framework was put in place in relation to the regulation of smart and autonomous vehicles. Under this framework, driverless vehicles are allowed to take passengers on board within the designated area. And there are also regulations relating to the legal liability in the event of incidents or accidents. We really need to catch up. In order to allow the trial of different classes of AVs, the administration has proposed the introduction of a pilot scheme. The applicant will have to apply for an AV certificate for each of the AV under a pilot scheme, and also a pilot license for the whole scheme. For vehicles to be rented or to carry passengers with reward, the relevant documents will also have to be applied for. This is a reasonable arrangement. However, the government should make sure that for passengers carrying vehicles for reward, they should be licensed so as to combat the abuse of the system in which some vehicles will be illegally used for carrying passengers for reward. For conventional vehicles, legal liability is to be borne by the driver on board the vehicle. For AVs, however, the operators will be held liable. He may be outside of the vehicle, and in the event of an accident, multiple vehicles or up to 100 vehicles may be involved. Does it mean that the operator concerned will be liable for the 100 vehicles in the event of an accident? What happens if the system is disrupted by a hacker? In the event of these incidents, does it mean that there will be insurance coverage before claims are made by the manufacturers and the relevant parties? If the legal liability is not defined clearly, drivers may be or operators may be sent to prison, and the interests of victims may be at stake. The government should clarify the legal responsibilities concerned, because otherwise this will hamper the development of commercial AVs. The Liberal Party supports the development of autonomous driving technologies. According to the Transport Department statistics, the major cause of traffic accidents is human errors, such as fatigue of drivers, inattentive driving. Autonomous driving depends on technologies. So fatigue, inattentive driving can be addressed. There are also other safety devices on board the AVs that can help eradicate human errors and reduce traffic accidents. This can also help lower insurance premiums. According to overseas experience, with the rapid development of AV technologies, the level of safety has been enhanced, and insurers will have a drop in their income from premiums. AVs also rely on the operation of computing systems. AVs can make use of big data so as to avoid detours and choosing the best route to go by, and this can help address traffic congestion and improve traffic management. We're now at the teething stage of AV technologies. Many drivers are keen on popularization of AV technologies. With a drop in the city's birth rate, we have a shrinking workforce. The unemployment rate is now standing at 3%. We have a full employment situation. There is a manpower crunch in different industries. We are short of cooks, drivers, and in fact, in the private sector, we now see the use of robots in restaurants and in delivery services. We should expedite the development of AV technologies to address manpower shortage. We also need supporting measures and facilities for the development of AVs, such as a stable communication network to support vehicle-to-everything technology, or V2X, and also infrastructure facilities, pedestrian facilities. They should be properly designed to dovetail with AV technologies so as to enhance transport efficiency and safety. With integration with the mainland, these AVs may also run across the boundary in the mainland. We must not neglect the development of V2X technology and connectivity with the mainland. For AVs on trial on the roads of Hong Kong, they should be properly labeled so as to allow identification by other road users so that they may stay vigilant. Under the pilot scheme, the Commissioner can, by administrative means, vet the applications on a case-by-case basis. And there are also a limited number of PLB licenses. In order to facilitate the implementation of a pilot scheme for the trial of AVs, the Commissioner can approve more PLB licenses for the trial of AVs. According to the administration, the Commissioner will consult the trade before granting the licenses. I urge the administration to be cautious because the PLB trade is now facing a lot of difficulties. If more licenses are granted for AV PLBs, and if these AV PLBs are allowed to carry passengers with a reward, this will hamper the interests of the PLB trade. They will be in dire straits. It is believed at the moment that close to 200 PLBs are now facing a hardship. They don't have income. They're short of drivers. The government should be cautious. Apart from public light buses, we also need to consider other forms of public transport. Even if there is not a limited number of licenses under the framework, the administration should still be cautious in granting licenses, such that these AV trials will not cause disruption to the balance of the industry. I support the resumption of the second reading of the bill.
Mr. Chan Pui-Lang. Thank you, Madam Deputy. I speak in support of the Road Traffic Amendment Autonomous Vehicles Bill 2022. AVs is the world trend, and different countries in the world are conducting different trials. Several years ago, the government released the Hong Kong Smart City Blueprint and also the Smart Mobility Roadmap, suggesting that AV trials should be conducted in Hong Kong. And for Smart City Blueprint 2.0 also mentions that we should develop V2X so that we can have more trials on AVs in Hong Kong roads. Although Hong Kong has a roadmap, but then Hong Kong's regulations are hampering the development of AVs. Right now, if we want to operate AVs on any roads, we must have the movement permits first, and the Commissioner of Transport must approve for such operations, and he may impose additional conditions. But the MPs comes with restrictions because it is issued under the Road Traffic Registration and Licensing of Vehicles Regulations, which is Cap 37, and this regulation aims at regulating conventional vehicles and not AVs, and also qualified drivers must operate the vehicles. So that hampers the trials of AVs in Hong Kong. Recently, the AV technology has developed in leaps and bounds, and many cities in the mainland are carrying out trials on AVs. We must remove barriers for trials on AVs. We must allow AVs to be tried on Hong Kong roads so that we can gather sufficient data to test the feasibility and the viability of software. And we must try out these AVs so that we can really have more AVs on the road used in Hong Kong. While it brings a lot of benefits to Hong Kong, we strive to achieve carbon neutrality by 2050, and in 2035, we aim to reduce by half our carbon emissions. Now, the AVs can reduce greenhouse emission. Then we can transform ourselves into a green society. We can reduce carbon emissions. And also, we are lacking commercial drivers, and the drivers are aging. According to the TD's statistics, those aged over 70, the drivers over aged 70 has increased by 80% in 5 years. And aged drivers can easily develop fatigue, undermining road safety. In the past 2 years, taxi drivers aged over 70 have been involved in over 410 accidents. And AVs can enhance road safety and reduce car accidents caused by man-made errors. In an aging society in Hong Kong, AVs can ease the labor shortage and provide more convenient transport for Hong Kong people. Madam Deputy, I agree to the amendment this time, and that is there should be a regulatory regime for AVs use, specified use and trials, so that AVs can be more extensively used in Hong Kong. I'd also raise several points of concern and suggestions. First, in relation to insurance for AVs, whether it's conventional vehicles or AVs, there are certain risks, and insurance is indispensable. But then AVs are still something new, and the risk considerations, underwriting considerations are different from those of conventional vehicles. Right now, the insurance sector doesn't have any detailed information to make an assessment, so we might not be able to shoulder the very great risks. And when AVs are tested and they are being put into commercial use, in the event of an accident, the insurance sector will not be able to ascertain their liability. Now, we're conducting just small trials of AVs in Hong Kong. The government must talk immediately to the insurance sector to understand our suggestions and try to share whatever data it has with the sector so that the sector can make early preparation and provide for insurance coverage for AVs. Second point of concern about connectivity or compatibility between Hong Kong and the mainland. And that has to do with the actual use of AVs. It might sound distant, but then as we integrate more into the GBA, well, this will be the trend, and that is there will be AVs coming to Hong Kong from the mainland and vice versa. And in July, there will be northbound vehicles going to the GBA. Will AVs do the same in the future? And this has to do with the regulations on both sides. And this is an issue that we should face up to. I suggest the administration should consider cross-boundary AV regulations and also the compatibility of regulations between the two places so that we can connect ourselves with the GBA. Now, we are lagging behind in the development of AVs from the mainland and the international world. I hope that the amendment will provide a very good environment for testing and trials of AVs. I so speak. Dr. Lo Wai Kwok. Madam Deputy, AVs means vehicles retrofitted with autonomous systems, so there is no need for a natural driver to run it. These are new transport modes. It can help reduce car accidents arising from human errors. It can enhance road safety, optimize the use of limited road space. Different countries, including cities in the mainland, are actively conducting technology research, and they are also conducting road tests. But Hong Kong is still at the beginning stage. In 12 December 2020, the smart City Blueprint 2.0 was issued, and also mentioned about vehicle to everything technology and the relevant development. And a vision has been set for AV's trial on roads. Right now, the AVs are governed by the CAP 374 and the subsidiary legislation under it. It governs mainly conventional vehicles, and it assumes that at any time there should be a natural person on the vehicle. Since 2017, the Transport Department has been issuing movement permits in accordance with the Road Traffic Registration and Licensing of Vehicles Regulations CAP 374 to facilitate AV trials. But then these were issued only to license, which are not licensed and not normally used on roads. To further meet the needs of the development of AVs in Hong Kong, Hong Kong must move ahead with the times and come up with the regulatory mechanism or framework as soon as possible to dovetail with the fast developing AV technology. We must promote the test and use of AVs in an orderly and safe manner. I must declare that I am a board member of the AA Hong Kong, and within the Hong Kong airport, there are different types of automatic vehicles running. And very soon, there will be AVs taking passengers from the Hong Kong boundary crossing facilities to the airport, and hopefully the service will be extended to the new Tung Chung town center. The bill aims to amend the road traffic ordinance to facilitate the use and trials of AVs in Hong Kong. There should be a flexible framework, and we should also be testing the technology concerned. It will also empower the Secretary for Transport and Logistics to make certain regulations. The AVs, the administration rather, will introduce a regulatory framework for use of AVs, and the bill sets out that any individuals or organizations who would like to test and use AVs in Hong Kong should do it in a pilot scheme, and a pilot license should be obtained, and every vehicle will be issued with an AV certificate, and the STL is empowered to make a pilot regulation to govern AVs. And the pilot regulation is a piece of subsidiary legislation, and that will be subject to a negative vetting process. And the Commissioner for Transport is also empowered to issue or compile code of practice, and it will also be issuing on the website of the TED this application notices to allow greater flexibility for trial and use of AV so that they will not be subject to existing regulations. The bill was introduced to the electoral on the 14th of December 2022, and a Bills Committee was set up. I'm a member of the Bills Committee, and the BC supports the amendment of the regulation so that a regulatory or pragmatic regulatory mechanism be drawn up. Since 2017, we started the trial of AVs, and in 2019, a $100 million Smart Transport Fund has been established to support the development of new vehicles, and the approved projects include the trial and use of AVs and V2X technology. But while we are lagging behind Shenzhen and Shanghai in terms of our AV technology, for these other cities, they are actually having AVs carrying passengers, and tests are going on. And members note that the administration has taken reference from Canada, Australia, Singapore, and their relevant regulations, but it doesn't say categorically that the mainland regulations have been taken into account. I'm very concerned about this. I believe that we should collaborate and exchange with the mainland when it comes to AV development. In the GBA, where we should promote together the VT2X and AV technology in the GBA together with mainland cities. Now, for the backup operator, may only operate of the AV when needed, and maybe one backup operator will be operating multiple vehicles, and also multiple backup operators may be operating many AVs on a shift or rotation basis. So in case of accidents, how should liabilities be ascertained? The administration said that the AVs will operate in a way different than that of conventional vehicles, but those operating AVs should also shoulder liabilities similar to those under the conventional vehicle scenario. And the bill also sets that the pilot regulation also says that the interpretation can be made to the definition driver. And the STL will be empowered to enact or make interpreted provisions and to disapply certain legal provisions in certain scenarios. And the Commission for Transport is also empowered to issue application notices on pilot matter. The administration explained that since AV technology develops in leaps and bounds, it is difficult to codify all the details in statute law. So through such empowerment arrangements, then a flexible regulatory mechanism can be put in place, and that can facilitate the study and trial of AVs and to help assess the use of the AV technology. I think this is a pragmatic and balanced approach. And the Bills Committee doesn't object to the resumption of second reading debate here. And we notice that the Secretary will move amendments in the reading to respond to members' questions. And that clarification will be made to the C of T's power to make this application notices. Now we are trying to come up with a flexible regulatory regime. I think this is an important stride that we're making. And going forward, the government should adopt a multi-pronged approach and be mindful about the latest trends in AV technology and try to promote the further use of trial and of technology in AV, and a clear roadmap should be drawn up. And the INT fund and the Smart Transport Fund should be mobilized to support research and development into AV technology. We should strengthen our collaboration with the mainland authorities, including 5G technology, big data analytics, and V2X technology, and other laws and regulations and standards in relation to AVs. We should strive to connect ourselves with the mainland in terms of V2X technology and AV technology. I so submit.
Mr. Lam Chun Sing, thank you, Madam Deputy. I'd like to speak on the Road Traffic Amendment Autonomous Vehicles Bill 2022. There are views that this bill has come by too late. Last year in Chongqing, Wuhan, in August, the first batch of autonomous driving licenses were issued for AVs to provide commercial passenger carrying services in the country. In Shenzhen last year, the relevant framework was also promulgated to regulate autonomous vehicles in the city. I acknowledge the government's effort in tabling this bill. This is a milestone for popularization of smart transport in Hong Kong. This bill provides a framework. Many members during the deliberations of the bill asked about the details of the bill. For example, the legal liability of the operators in a specific setting, and also the requirements for the personnel involved, such as training and repair and maintenance. These questions have not been answered by the administration. The administration agreed to introduce a code of practice to address these issues. I hope that this can be done as soon as possible to promote the development of AV technologies in Hong Kong. The bill empowers the Secretary to make pilot regulation on AVs. including providing definition on the word driver of an AV. Specifically, the Commissioner is empowered by administrative means to issue these application notices. This is a technical point. But I do hope that when the Commissioner exercises his power, he can first consult the trade or listen to the views of panel members when he makes a report on a regular basis. For example, at the moment, under the law, only 4,350 PLB licenses are issued. In the future, if the Commissioner issues more PLB licenses for AVs to provide this service, will this cause an impact on the PLB trade? Will it be possible to strike a balance? When exercising his power, the Commissioner should liaise closely with the trade. Another point is, for AV operator or driver inside near the AV or at the control room, when the AV is in operation, he should also be held liable in the event of accidents. According to the Employees' Compensation Ordinance, when there is an accident, the employee, that is the operator, can be compensated. But the employer should also, as far as practicable, ensure occupational safety of an employee under the same piece of legislation. Now, this ordinance covers the majority of workplaces except this scenario under the Road Traffic Ordinance, and that is the driver's seat. Now, in relation to the OSH display regulation, it does not cover the situation of a control room of an AV. In other words, in the future, this AV operator may not be protected under the occupational safety and health legislation. The scenario has changed. The driver no longer sits inside the AV. Instead, he operates via a control room, and his job type is similar to a clerk in an office. So he deserves protection under the OSH legislation. But it is peculiar at the moment as this AV operator is not safeguarded by the OSH legislation. The government should review the situation. The government plans to introduce the use of an autonomous transportation system for the airport city link. Now, AV technologies is a global trend, but we're not sure about the pace of development. In the long term, there may be a lesser demand on transportation manpower. The government should conduct a manpower projection for the trade in the long term so as to help strike a balance between technological advancement and helping workers upgrade and transform the skills. Professor William Wong. Autonomous vehicles is nothing new. Yet Hong Kong is lagging behind in this area. Our country is a strong nation when it comes to car manufacturing. AVs have been put to extensive use. In Shenzhen, AVs can run on a commercial passenger carrying basis. In Guangzhou, there are AV buses running on the roads with high level of safety. And in the demonstration zone of another city, some AVs have been running on the roads for more than a year. There are also AV trials being conducted in Hong Kong, mostly in the restricted area of the airport. We have forklift trucks, we have other kinds of autonomous vehicles. Last week, an autonomous bus started running within the area. It runs round the clock to carry employees within the area. The other more well-known trial is the autonomous bus running in Science Park. Again, these buses carry employees within the park. Through this bill, the government has formulated a framework for the trial and application of AVs on a pilot basis. It is not a comprehensive legislation allowing the use of AVs, whereas in Shenzhen, last year, the Shenzhen Special Economic Zone smart vehicle regulation was promulgated. From trial, use, management, registration of AVs, there are detailed provisions on these things. There are also provisions on the handling of accidents. This all-encompassing legislation can help drive the development of AVs as well as the relevant industries. The Hong Kong SAR government has the Innovation Technology Fund and the Smart Transport Fund. These two funds provide funding support to research projects. Apart from funding support, however, we need to allow trials to take place in more places, in particular in the commercialization and trial process. The I&T Cooperation Zone in Lok Ma Chau Loop will be commissioned in phases starting 2024. There will be a flexible use of the sites therein. For example, in San Tin Technopole, direct land grants may be given to tech companies. The government should take a proactive approach so as to attract more top-notch enterprises to come and develop AVs. We are an international city. We are at the best strategic location of connectivity with the mainland. This can help facilitate the flow of capital. We can also help raise funds for these companies. These are advantages that we enjoy and which we can use to attract top-notch enterprises. Next, if we want to allow extensive use of AVs, we need to improve the V2X technology so that AVs can collect data from big data, such as traffic condition, as well as data allowing vehicles to gauge the distance with the vehicles in front and behind. The V2X technology at the moment is at its early stage of development in Hong Kong. S3 has started a 9-month trial from the Science Park to Sha Tin Town Centre, covering 14 kilometers in length. The government should promote the development of V2X technology. The Transport Development also plans to publish the latest blueprint by 2025. I hope that in this blueprint, the government will attach sufficient importance to the development of V2X. Consideration should be given to aligning our standards with those in the GBA cities. There should be more communication and liaison with the relevant authorities and organizations to enhance connectivity in the Greater Bay Area. Madam Deputy, if this bill is passed today, it will turn a new chapter for the development of AVs in Hong Kong. However, the government should make a joint effort with the trade so as to sustain the development of AVs so that in the end of the day we can create an industrial chain and bring new impetus for development in Hong Kong. I support the bill.
Mr. Tony J. Thank you, Madam Deputy. Madam Deputy, I rise to speak in support of the Road Traffic Amendment Autonomous Vehicles Bill 2022. This is to provide for a regulatory framework for autonomous driving and autonomous vehicle for these to be rolled out in Hong Kong. And this will allow the autonomous vehicles to be running on the road and to safeguard the safety of the road users. Should accident happen, there will be proper criminal and civil liabilities. Talking about autonomous driving, we think of the replacement of human drivers. In fact, many motorists would agree that the car parks are so narrow in Hong Kong, and it would be difficult for a parked vehicle for the doors to be opened. In fact, many new vehicles are fitted with the formula for autonomous driving, and parking will not present any problems. However, under the existing legislation, the vehicles in Hong Kong must be manned by a human being. Even for such safety or safe technology, we are not able to benefit from it. As Hong Kong's population is aging, autonomous driving would be of assistance to the elderly drivers, and it is a safeguard against accidents. For those who are in poor physical condition but would still like to get behind the wheels and go out and about, this kind of autonomous driving would certainly be helpful to them. So it is providing safeguard for public safety. It is also helping people with their mobility. I think it is some time for us to introduce autonomous vehicles in Hong Kong. In fact, in many parts of the world, like many cities in the mainland, have already developed autonomous driving to a really sophisticated level. We must be aware that given the road conditions and the driving habits in Hong Kong, it is different from other parts of the world. So when we introduce the technology and the vehicles, we have to conduct road tests to make sure that the autonomous driving technology would be fitted, would be suited to Hong Kong. And we are concerned about the safety. We have to make sure that the systems will be too sophisticated, like when the vehicles are approaching the tunnel portal because of the safety reason. The vehicles might be stopping there for safety's sake, and this will in turn cause congestion. The government departments responsible for vetting this technology would set too much store by safety, and they are throwing obstacles in the testing and use of the technology. And they would insist on repeated tests that have already been undertaken in other parts of the world, and this is really impeding the progress of the introduction of autonomous vehicles in Hong Kong. So I, like other members, am in support of this legislation, and I am really hopeful for this technology. The legislation should not be too rigid so that we can respond to the evolvement of the autonomous driving technology. And in the bill, it provides for a regulatory framework, and all the details are not specified, and they're left to the Secretary and the Commissioner for Transport to decide and to approve, and this is filling us with concerns. Now, what is of concern to us is that the Secretary and the Commissioner would be, like previous officials, attached too much on to safety and resist innovation. They are just there to monitor the development. They should also become the facilitator, because otherwise we'll be behind the curves and we will not be able to benefit the members of the public. The innovation in technology is really lagging behind. The government adopts the mentality that the less they do, the less they do wrong. In fact, there are a lot of technology in the mainland, and there is very much a resistance to that because of this mentality. After 40 years of reform and opening up, the technological development in the mainland has reached really high level in many respects. And many Western countries, led by the US, are impeding the technological development in the mainland, and the production and R&D are being impeded. Hong Kong has returned to the mainland, to the motherland for so many years, but still we see people like the air crew that is documented in the news. People tend to think that the mainland products are of a lower grade than those in other parts of the world. In fact, the tests on the autonomous vehicles cover many vehicles that are manufactured in the mainland. In formulating the regulatory framework, the government has taken reference from the US, Australia, and Singapore. They haven't taken into account the regulation and the standards in the mainland. According to the administration, there is a difference between the regulatory system between Hong Kong and the mainland. And in formulating the regulation and in issuing the certificate, the government said that they would make reference to the mainland standards. And the test experiences in Hong Kong would be taken into account, and there would be no repeat tests that would be required. And there would be a promotion of V2X connectivity between Hong Kong and the GBA. I hope the government will be true to their words instead of saying one thing and does another. I hope that after the third reading, we would soon be able to enjoy the benefit of autonomous parking, and that would remove the worry that the car doors cannot be opened after a car is parked in the car park. With these words, I support the second and third reading and also all the CSAs of the bill. Mr. Yim Kong, Madam Deputy, as a member of the Bills Committee, I am very concerned about the development of autonomous driving. Autonomous driving is the new trend in the world, and this would effectively minimize traffic accidents arising from human errors. This will also improve mobility, and this is part and parcel of a smart city. The legislation for autonomous driving would facilitate the development there. There are 6 countries, including the US, Germany, Japan, the mainland, Singapore, Australia, that have already introduced legislation for autonomous vehicles. In August 2020, the first autonomous vehicle legislation has been put in place. In Shenzhen, they have put in place the autonomous driving legislation, and they have formulated the registration, the liability for traffic accidents, and so on. All these have been put in place. In July 2022, the State Council has introduced the 14th five-year plan regarding autonomous driving. They have introduced the study on V2X connectivity and also all the regulations in this regard. They are looking into the safety, the safe regulation, and also the repair and maintenance technology. In the mainland, autonomous driving legislation has been on the agenda. In this bill, we have adopted a lot of views of the trade, and this is positive development in the way of autonomous driving. There are loose ends to be tied up, and the legislation has to be evolving with the times. And I'd like to state my concerns here. First, we should adopt the Beidou navigation system. This is the mainland technology. This is a really sophisticated technology. In particular, when it comes to autonomous driving, this would become the trend of the GBA development. The positioning system should be on the basis of the Beidou positioning system. And we should also adopt the mainland-based cloud system. Second, we have to clear up the liability in relation to accidents arising from autonomous driving. And all the producers, the suppliers, their liability should be clarified, and that would enable us to pursue the liability in relation to insurance. For semi-autonomous and autonomous vehicles, I think we have to make sure that should accidents happen, who should be held responsible for them. Third, we should have regulation regarding the public safety. The government should put in place a regulation to regulate autonomous driving and also the storage and the use of recorded data. Fourth, for autonomous vehicles, there should be clear identification. There should be clear sound identification system. In order to assuage public concerns about autonomous driving, the autonomous vehicles should be given an easily identifiable number plate and also sound system so that people would be able to make a timely response. Fifth, for autonomous vehicles, there should be a clear regulation regarding cross-boundary vehicles. The cross-boundary travel of autonomous vehicles is something that we should bear in mind in future. We have to consider all the regulation regarding autonomous vehicles being used across the boundary. This would be part of the smart city development in the GBA. 6, for certain zones like the airport and the container terminal, we have to bear in mind the safety. There should be automation of the port and the airport in the use of autonomous driving. With these words, I support the bill.
Mr. Shang Hailong. Thank you, Madam Deputy. First declaration of interest. I am a consultant of an AI company. We take part in a number of trials concerning AI and AVs. So I speak in support of the amendment bill so that the administration can take forward the development of AVs in a flexible manner. Earlier on, I was also a member of the Bills Committee, and I believe other colleagues have also talked about the details of our exchange with the administration. I will not repeat those. I believe that everyone agreed that through the development of AV technology, we can have fewer drivers who are oftentimes stuck in very small compartment. We can also enhance road safety, reduce the number of accidents. We can also facilitate the development of AVs in the future. Now, the administration's paper focuses on overseas examples. I hope that more attention can be paid to what's happening in mainland cities and how their trial with AVs go. So I'm going to talk about the subject from a commercial perspective. I hope that the administration should focus on how it should issue commercial AV vehicles. I believe that we should leverage on market forces to bring AVs actually to the public roads. Now, I know that the government has issued commercial taxi and commercial truck vehicles. I have a few suggestions for the administration. First, when vetting projects, I believe that the administration should approve projects involving a fleet instead of a single vehicle, because a fleet will be conducive to the development of AV development in Hong Kong, and more data can be collected that way. So the government should accord priority to projects involving fleets. And then we should also step up public education. We should invite members of the public to be passengers on AVs. So at least there should be trials on 5 locations in Hong Kong. Suitable locations include the airport, Hong Kong Zhuhai-Macau Bridge, and the Science Park, TMHK, West Kowloon Cultural District, Tai Kung, etc. I hope that we should leverage the advantages under one country, two systems principle and try out the different projects, and we should ascertain the liabilities of the different parties in the team. Say, so for L3, the liability of how the liability is assigned differs between the mainland and overseas countries. So I hope that the government can make breakthroughs in this area. Should we be just holding the operator accountable only? That will not be conducive to the development of the technology. I think we should try to break new grounds in that area, and that is also instrumental in putting wider use of AVs in Hong Kong. I so submit in support of the bill.
If not, I now call upon the Secretary for Transport and Logistics to reply, then the debate will come to a close. Secretary. Madam Deputy, I sincerely thank Mr. Frankie Yik, Chairman of the Bills Committee, and other members of the committee, as well as the Electrical Secretariat, for their hard work and support, which enable the Road Traffic Amendment Autonomous Vehicles Bill 2022 to be scrutinized smoothly and expeditiously. I also like to thank members who have spoken for their valuable comments, which will be considered. As the global technological development enters a new era, autonomous vehicles, or AV technology, has seen rapid development in recent years and is being tested on the road around the world. The AV technology can not only enhance road safety and make the best use of limited road space, but also reduce the number of accidents caused by human error. The government has been promoting smart mobility and is committed to resorting to innovation and technology to bring about safer, greener, efficient, and more convenient mobility experience to the public. In the Hong Kong Smart City Blueprint 2.0, published in December 2020, one of the initiatives is to tie in with the vehicle to everything and AV technology to set a vision of testing and using AVs on Hong Kong roads. To enable testing and use of AVs on Hong Kong roads for the carriage of passengers and also for mass transit, while safeguarding road safety, the bill seeks to amend the Road Traffic Ordinance to empower the Secretary for Transport and Logistics to make subsidiary legislation, i.e. the pilot regulation, to put in place a regulatory regime for the testing and use of AVs. The government has made reference to the mainland experiences and that of other regions in proposing the bill. The regulatory framework will be in line with national and international standards. In the course of the scrutiny, members of the trade generally supported the government's proposal to provide a more flexible regulatory framework for AVs. They also expressed valuable comments on the standards and long-term development of the regulatory framework of AV technology. Members' main concerns are twofold. First, the approval of pilot license and the AV certificate, and two, the legal liability and insurance issues. First of all, regarding the license and certificate, under the bill, the AV owners must apply to the TD for a pilot license and an AV certificate for each autonomous vehicle. Once approval is given, the applicant can register the vehicle and obtain a license. Like ordinary motor vehicles, AVs will be subject to the Road Traffic Ordinance and its subsidiary legislation. In addition, the proposed pilot regulation will clearly stipulate the requirements like the renewal, variation, suspension, or cancellation of the pilot license and certificate. If an AV is used to carry passengers for reward, the relevant passenger service license is required. It has to be registered under the corresponding class of vehicle. In considering the application, the TD would have regard to the impact on public transport, like the route, the fare, the landscape of the trade, and also the members of the public. In relation to the second point about liability and insurance, as the existing vehicle registration and licensing system will apply equally to AVs, the liability and the registered owner and the licensee, including the requirement for insurance, will also apply to the AVs. The proposed pilot regulation will also stipulate the requirements like insurance policies, repair or maintenance, etc. For example, it will require the installation of a data recording device. If accidents occur, the relevant data can facilitate investigation and shed light on the responsibilities concerned. In response to members' suggestion, the government has met the Hong Kong Federation of Insurers and the Automobile and Light Bus Trades to brief them on the bill and the insurance arrangements, and to further consult them on their views. The industry is generally supportive of the bill. The government will maintain liaison with the trade and make available all the relevant data for their reference. Having regard to members' views on the pilot regulation, we intend to set the commencement date of the pilot regulation after the negative vetting period in order to allow members sufficient time to scrutinize the pilot regulation. Madam Deputy, under the proposed framework, we will draw on more experience in the testing and use of AVs in Hong Kong and continue to maintain communication with the trade. We will also closely monitor the autonomous driving technologies and regulatory industry to make sure that the regulatory framework keeps pace with the times. We will also closely monitor the development in the mainland and discuss with the mainland the cross-boundary autonomous vehicles. Many of the vehicles are manufactured and developed by the mainland. We consulted the Transport Panel in July 2022 and received general support from members. The proposals in the bill have taken into account the views of members and the trade. I urge members to support the bill and the technical and textual amendments that I move later on, so that the government can implement the new regulatory framework for AVs as soon as possible and remove the barriers to the long-term development of AV technology and allow AVs to be extensively tested and used on Hong Kong roads. It will provide greater impetus to the development of smart city in Hong Kong. President So, I speak.
I now put the question to you that the Road Traffic Amendment Autonomous Vehicles Bill 2022 be read the second time. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Road Traffic Amendment Autonomous Vehicles Bill 2022. This council now becomes a committee of the whole council to consider the Road Traffic Amendment Autonomous Vehicles Bill 2022. Members may refer to the appendix to the script for the debate and voting arrangements for the bill. Members have been informed that the committee will conduct a joint debate on the clauses and amendments. I now propose the question to you that the following clauses stand part of the bill. Clauses 1 to 7. The Secretary for Transport and Logistics will move amendments which seek to amend clauses 5. Members may refer to the appendix to the script for details of the amendments. Members may now proceed to a joint debate on the clauses and amendments. I will first call upon the Secretary for Transport and Logistics to speak, but he is not required to move the amendments at this stage. Then I will call upon members to speak. Upon the conclusion of the joint debate, the committee will first vote on the clauses with no amendments standing part of the bill, and then vote on the amendments. Secretary for Transport and Logistics. Madam Deputy, I now move the government's CSA to make the provisions clearer for the regulatory regime for the AV. We have taken on board the members' views at the BC. We are proposing the technical and textual amendments as follows. First, in Section 132, to amend the definition of AV equipment to include whether or not to cover the remote control of an AV by AV equipment. Second, so that the Chinese version can align with the English version, we suggest that in Section 132, Part 15 and 4 subdivision, in clauses in sections 146, 147, 148, we suggest that 改變效力公告 instead of 不適用條文公告 as the Chinese translation of this application provision. And we also would like to redefine the meaning of interpretation. And in sections 141, 16, and 7, we will substitute 作釋義 for 詮釋 as the corresponding Chinese verb for interpreted in the proposed sections. In the proposed 141, interpreted provision means a provision containing a reference to a driver that is interpreted by the Secretary. To prevent misunderstanding of other aspects of the provision being interpreted, we propose that in relation to section 141, bracket 7, subject provision, 關涉條文 will substitute for interpreted provision, 經轉譯, and substitute 該提述 for 該條文 in the Chinese text of the definition 5 to make it clearer that the fine at level 4 and imprisonment for 2 years referred in the proposed section 145 in the bill are the maximum penalties under the pilot regulation. We propose deleting everything after fine in that section and substitute not exceeding level 4 and imprisonment and not exceeding 2 years imprisonment. 6, to make it clearer that a application notice made by the Commissioner for Transport may only be made in relation to a particular case, we propose in section 146, bracket 5, delete may be made in relation to any particular case and substitute may only be made in relation to a particular case. Madam Deputy, the proposed amendments are only technical amendments. We have incorporated views of members in the Bills Committee, and there is no change to the intent of the bill. We have consulted the CSAs. We have consulted the BC on the CSAs, and the BC has no objection to the above members. I urge members to pass the CSA to make the amendments much clearer. Any member wishing to speak? If not, then we will first vote on clauses without any change. I now put the question to you that the clauses with no amendment are set out in the appendix to the script part of the bill. With those in favor, please raise hands. Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed.
表決修正案。
We now vote on the amendments. The Secretary for Transport and Logistics, you may move your amendments. Chairman, I move the amendments set out in the appendix to the script. I propose the question to you that the Secretary's amendments be passed. I now put the question to you as stated. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the amendment passed. Clause 5 as amended. I now put the question to you that the clauses as amended, just read out by the clerk, stand part of the bill. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. All the proceedings on the Road Traffic Amendment Autonomous Vehicles Bill 2022 have been concluded in Committee of the Whole Council. Council now resumes. Secretary for Transport and Logistics. Madam Deputy, I now report to the Council that the Road Traffic Amendment Autonomous Vehicles Bill 2022 has been passed by Committee of the Whole Council with amendments. I move the motion that this Council adopts the report. And I propose the question to you that the Secretary's motion be passed. In accordance with the rules of procedure, this motion shall be voted on without amendment or debate. And I'll put the question to you as stated. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Third reading, Road Traffic Amendment Autonomous Vehicles Bill 2022. Secretary for Transport and Logistics. Mr. President, I move that the Road Traffic Amendment Autonomous Vehicles Bill 2022 be read the third time and do pass. And I propose the question to you that the Road Traffic Amendment Autonomous Vehicles Bill 2022 be read the third time and do pass. Does any member wish to speak? I now put the question to you as stated. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Road Traffic Amendment Autonomous Vehicles Bill 2022.
Government motion. Two proposed resolutions moved by the Chief Secretary for Administration. First motion, proposed resolution under the Criminal Procedure Ordinance, and second motion, proposed resolution under the Coroner's Ordinance. Members have been informed that as the two motions seek to increase the maximum allowances payable to the ordinary witnesses, professional witnesses, and expert witnesses in criminal proceedings and coroner's inquests, this Council will proceed to a joint debate on the two motions. Then they will be voted on one by one. The joint debate now begins. Members who wish to speak, please press the Request to Speak button. I now call upon the Chief Secretary to speak on the two motions and move the first motion. Chief Secretary. Madam Deputy, I move that the first resolution standing in my name on the agenda be passed to seek the approval of the Legislative Council for the Criminal Procedure Witnesses Allowance Amendment Rules 2023 made by the Criminal Procedures Rules Committee under Section 9B of the Criminal Procedure Ordinance. I will also shortly be moving the second resolution standing in my name be passed to seek the approval of the Legislative Council for the Coroner's Witnesses Allowances Amendment Rules 2023 made by the Chief Justice under Section 54 of the Coroner's Ordinance. At present, the maximum allowance payable to ordinary witnesses in criminal proceedings and coroner's inquests is $615 for each day of attendance or $305 for attendings not exceeding 4 hours. The maximum allowance for professional and expert witnesses is higher at $3,210 for each day of attendance or $1,600 for attendance not exceeding 4 hours. Under the adjustment mechanism approved by the Finance Committee of the Legislative Council, changes to the rate of allowance for ordinary witnesses would be made in accordance with the movements in the overall median monthly employment earnings of employees in Hong Kong, while those for professional and expert witnesses would be made in accordance with the changes in the midpoint salary of a government medical and health officer. The Finance Committee has also delegated the authority to approve the relevant adjustments to the Secretary for Financial Services and the Treasury. The existing rates of allowances has been effective since August 2021, set based on the biennial review conducted in 2020. The Judiciary Administration reviewed the rates of allowances in 2022. Taking into account the movements in the overall MMEE between the third quarter of 2020 and the third quarter of 2022, the midpoint salary of a government medical and health officer between April 2020 and April 2022, the JA proposed and the SFST approved increases in the maximum rate of allowance for ordinary witnesses from $615 to $655 for each day of attendance, and from $305 to $325 for attendance not exceeding 4 hours. For professional and expert witnesses, the maximum rate of allowance will be increased from $3,210 to $3,290 for each day of attendance, and from $1,600 to $1,640 for attendance not exceeding 4 hours. These adjustments aim to maintain the real value of the rates of allowances to minimize any financial loss suffered by members of the public testifying as witnesses in courts. I invite members to approve the two resolutions to implement the new rates of allowances. Thank you. I now propose the question to you that the Chief Secretary's first motion be passed. Does any member wish to speak? If not, we now vote on the Chief Secretary's first motion. I put the question to you that the Chief Secretary's first motion be passed. Will those in favour please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Chief Secretary, you may move your second motion. Madam Deputy, I move that my second motion as printed on the agenda be passed. I propose the question to you that the Chief Secretary's second motion be passed. I now put the question to you as stated. Will those in favour please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed.
Members' motion on the period for amending subsidiary legislation. A proposed resolution moved under the Interpretation in General Clauses Ordinance to extend the period for amending 3 items of subsidiary legislation relating to noise control ordinance, which were laid on the table of this Council on May 3rd, 2023. I now call upon Mr. Dennis Leung to move the motion. Madam Deputy, I move that the motion as printed in the agenda be passed. I propose the question to you that Mr. Dennis Leung's motion be passed. I now put a question to you as stated. With those in favour, please raise their hands. Those against? I think the question is agreed by a majority of each of the 2 groups of members present, that is those returned by EC and those returned by FC and GCs. I declare the motion passed. Members' motion with no legislative effect. Dr. Johnny Ng will move a motion on stepping up the promotion of Geron technology to enhance the quality of life of the silver-haired group and tackle population aging. 5 members will move amendments to the motion. This council will proceed to a joint debate on the motion and the amendments. Later, I will first call upon Dr. Johnny Ng to speak and move the motion. Then I will call upon Mr. Tony J, Mr. Yim Kong, Mr. Shanghai Long, Mr. Bill Tang and Mr. Ma Fong Kwok to speak in sequence, but they may not move the amendments at this stage. The joint debate now begins. Members who wish to speak, please press the request to speak button, and I'll call upon Dr. Johnny Ng to speak and move the motion. Madam Deputy, I move the motion as printed on the agenda be passed. In his July 1st speech, President Xi made 4 points, and one of them is to address people's concerns and difficulties, and the elderly people should be well looked after. According to Census and Statistics Department, we have 1.25 billion people over 60, 20% of the overall population, and the senior population will increase in 2030, 30%, 2.58%, and 3 in 10 will be senior citizens. The elderly care will be important. I am concerned about INT. I am also concerned about the applicability of INT on the ground. Geron Tech is playing a significant role in this day and age, but this is not being extensively used. The senior citizens do not get better quality of life, and we have seen elderly people dropping dead at home without being aware. About 10 days ago, there was an 86-year-old father who suffered a heart attack and a 59-year-old daughter who looked after the father also perished. And there was a senior citizen who died for 8 months at home in Sha Tin, and all we found was just the skeleton. It really depresses me why we are seeing this in Hong Kong. Geron Tech can help old people lead a better life, and we will avoid these kind of incidences. About 200,000 people, senior citizens, are using the Peace Link. I think the government should provide these kind of services for more senior citizens. We have more Geron Tech products. I know that there is a smart watch that can track the movement of the senior citizens. It can also allow communication and monitor the health condition. Geron Tech can enhance the elderly care, alleviate the manpower shortage for the senior citizens, and we can also encourage aging in place, and senior citizens can enjoy better living condition. The day-to-day life will certainly be upgraded. Their social life, their mental health will also be improved. The burden on society and the carers will also be minimized. And we can rise to the challenges of aging population. The promotion of Geron Tech can also promote the development of INT. There are 100 partnership or startups in the HKSTP that are developing and promoting the Geron Tech products in the market. The government is emphasizing aging in place and long-term care for the senior citizens. The government is minded to develop Geron Tech, but the policies seem to be rather fragmented. The government is not taking a leading role to coordinate the development, and there is very much a silo mentality in this area. We're not pulling in the same direction. We're not going far enough to create the right climate for the development of Geron Tech. In 2018, the government set up the INT fund for application. The 1 billion fund, 470 million has been earmarked, not even half. Why is it that the fund is not used up to the desirable level? It shows that there is a long way to go in Geron Tech. The INT Fund for Application in Elderly and Rehabilitation Care mainly covered the NGOs subsidized by the government, but well over half of the RCHEs are private homes. They fall outside the scope of the fund. So well over half of the residents in the old folks' homes are not covered. In September, in the 8th tranche of application, the government has relaxed the criteria to cover 500 private care homes, but still the supply, the demand outstrips supply. There are 90% of senior citizens who are living at home, and they do not get any subsidy from the government to procure the Gerontech. The SAL government should review the level of funding under the fund, and more subsidies should be offered to benefit all the old folks in Hong Kong. I understand that in Q3 this year, the government is going to be increasing the number of people benefiting from the community care service, but the level of subsidy is really insufficient. And there is a lack of coordination. The R&D institutions, universities, and the government are operating in silos, and they tend to suffer from a lack of funding and cannot commercialize the R&D outcomes. Many people from the trade told me that they may get the government funding, but the support is limited. After they've used up the funding, they cannot go anywhere. Like the vital sign sensor and the bed rest detector. There are many products, but we lack the platform, and we're not installing these in the care homes. The government may be supporting the care homes in this regard, but there is a lack of expertise in maintaining and operating these systems, and these systems are lying idle, and they're not being used to their full potential. Gerontech is benefiting society. It also involves the medical and health service. We need to have the coordination of various departments before we can achieve an extensive application. The government should set up a Gerontech committee, jointly headed up by the LHB and the Health Bureau, in order to break down all the barriers. The government should also enhance the awareness on the part of the staff. The government should understand the needs of the stakeholders. So there has to be a regular survey and studies on the needs. It should be the elderly-oriented, so that the Gerontech products can find a way into the homes. We should also have Gerontech ambassadors who will be getting into the community to help the elderly folks to procure and use the Gerontech products, and that would help them to achieve aging in place. To popularize Gerontech, publicity is a must, and also nurture R&D talents. I've heard from the frontline welfare workers that many of the frontline workers are not well up in Gerontech products, and repair and maintenance is also a problem. But the government should create more courses at tertiary institutions on Gerontech, and there should also be an accreditation system for this. Many senior citizens tend to retire in the GPA. The 1 hour living circle is really convenient. The government can enhance and step up cooperation and collaboration with the GPA and extend the applicability of Gerontech to the GPA and the homes in the GPA, so that the Gerontech products can be exported outside of Hong Kong. There are many suppliers that are serving the GPA, but they are not familiar with the rules and regulations in the GPA. The government can offer some assistance. All in all, Gerontech represents the way to go to tackle the aging population. In the long run, we can help the senior folks to live out their twilight years in dignity, and this will also minimize the financial burden on the community. During his when he was running for office, Mr. John Lee also visited these facilities. I hope the government will improve Jordan Tech and do more in this regard. I must make a declaration. I have made investment in different I&T products. With these words, I conclude my speech.
I
now propose the question to you, that is that Dr. John Eaton's motion be passed. Mr. Tony Chair. Thank you, Madam Deputy. Madam Deputy, I am concerned about the problem of aging in Hong Kong in relation to the aging population and the aging building stock. In particular, for the latter, I've made a number of recommendations which have been accepted by the government. For example, the mandatory window and building inspection scheme, subsidy schemes for building owners to revamp their lifts and communal facilities. To tackle the aging population, I also put forward a number of recommendations during my 2 terms of office here. Before COVID-19, there was already an alarming sign of the shrinking workforce against an aging population. I asked the administration to formulate a population policy and draw up an action plan to tackle the problem. The last term of government did not pay heed to my suggestion. Now it's too late. The original motion is on stepping up promotion of German technology. I am in all support of that. But I've also made an amendment. In terms of building designs and urban planning, we need to make complementary arrangements so as to improve the quality of life of the Silverhead Group. Mr. Ma Fong Kwok referred to facilities such as exoskeleton and electrical wheelchairs. Now, if the design of the doors in a flat is so narrow that it won't be able to accommodate the exoskeleton or the wheelchairs. Now, years ago, I worked with some experts on promoting adaptive design for elderly residents. I put forward a written submission to promote aging in place and the relevant building designs. 6 policy bureaus are involved. As a result, because of a lack of coordination, nobody followed up on these suggestions. Earlier, we witnessed a spate of tragedies involving elderly couples passing away at home and elderly people passing away at home without being discovered until months later. As mentioned by the other member, the deceased actually turned into the body of the deceased actually turned into the skeleton before it was discovered. Dying alone is a phenomenon shared by many countries, especially in Japan. Even in South Korea, in recent years, there has been a concern. This is the result of an aging population, increase in divorce rate, and alienation in the neighborhood. We share these common traits in Hong Kong. And recently, because of emigration, many elderly parents are left behind. And in South Korea and Japan, their governments have formulated dedicated policies to tackle these issues. However, in Hong Kong, it seems that the government is not facing squarely this issue, not to mention formulating policies. We have been placing emphasis on health care and residential care services for the elderly. And we have not attached sufficient importance to aging in place and aging in the community, not to mention safeguarding the physical and mental health of elderly. The original motion refers to the use of German technology to monitor the health of elderly and help them build a social network. All these are beneficial for our elderly population. However, we need to encourage our elders to get out more often. We need to work on the design of their home as well as public transport and the roads. In the past, we installed handrails and ramps under the Universal Accessibility Program. However, in order to safeguard the health of our elderly, we need to attach more importance to building design so that they enjoy mental well-being and see their quality of life improved. I support the original motion and the various amendments. Mr. Yim Kong. Thank you, Madam Deputy. I thank Dr. Johnny Ng for moving this motion on stepping up the promotion of germ technology to enhance the quality of life of the Silverhead Group and tackle population aging. These are issues that we need to face up to in order to take forward high-quality development in Hong Kong in the future. We attach importance to our paying filial duty and showing respect for our elderly. This is the core value of the Chinese traditional virtues. President Xi, in the 1st of July key address, expressed his hope for the government to earnestly address people's concern and difficulties in daily life so that they can live in bigger flats, they can receive better education, and for elderly, they can have better care in their twilight years. These are the clear expectations on our government to enhance governance efficiency. We have an aging population. The situation is getting worse. Whilst cultivating the good atmosphere of cherishing the traditional values of honoring, respecting, and providing for the elderly, we also need to improve our care for the elderly so that this generation who has contributed a lot to the success of Hong Kong can enjoy fruitful retirement life. As technology advances, we have the prerequisite to improve care for the elderly. Dovetailing with the 14th Five-Year Plan strategy, we can use the Greater Bay Area as a hinterland so as to improve care for the elderly. I have the following suggestions. First, we should make full use of the big data analytics. We should make a joint effort with the Greater Bay Area to build a database which can provide real-time data for aging in the Greater Bay Area so that our elderly people can make an informed choice of their retirement life in the Greater Bay Area. We also need to step up effort in promoting germ technology and the relevant industrial developments. We should make use of robots and other technologies to lower the cost of elderly care and to foster industrial developments. Number 3, we should make good use of artificial intelligence and other smart technologies to foster the favorable environment for aging in place, to enhance the quality of life of elderly so that we can address the problem of problems brought about by isolated elderly and promote their well-being. Point number 4, we should encourage our elderly to make use of the internet. There should be training courses for them. The administration should also take a proactive approach in communicating with the service providers so as to build a platform for the elderly. We should encourage our elderly population to learn photography so that through social media platforms they can share their day-to-day life and joy with us so that we can create an elderly-friendly society. I support Dr. Johnny Ng's motion and the amendments moved by members. I urge members to support my amendment. Mr. Shao Hailong. Thank you, Madam Deputy. I need to thank first and foremost Dr. Johnny Ng for moving the original motion. We have a rapidly aging population in Hong Kong. The dependency ratio increased from 198 in 2014 to 303 in 2022. to this record high since 1969. It is expected that elderly population will account for 30% of the total by 2037. It is also envisaged that the relevant expenditures will also be on the rise. There will be a great pressure on the public coffers. There is a need to promote German technology so that we can turn this crisis into an opportunity for us. German technology can help alleviate the pressure on the care sector. It can also instill impetus in the industrial development. I support Dr. Johnny Ng's original motion and the amendments by other members. Aging in place is the trend. German technology plays a very vital role in elderly care, but there is a lack of understanding in general. For example, there is an anti-collision garment designed in its early days. It was only used in the sports sector. Now it's been promoted to the elderly care sector. There are also automatic cleaning fabric currently used by the hotel industry. It has not yet been promoted to the elderly care sector. This leaves more to be decided. I urge the government to step up publicity on German technology. The government should invite NGOs to help mount publicity campaigns. For example, there is an elderly simulation center that provides a simulated environment to promote active health management, tackling aging and other preventive measures. In order to narrow the digital gap, we need to enhance the elderly's digital literacy to help cultivate digital confidence in them so that we can better prepare for the aging population. The community care service voucher or healthcare voucher for the elderly should be revamped. It's not innovative because at the moment the vouchers cannot be used to procure gerontech products. They can be used to procure preventive health and healthcare services, but they have a limited choice. For example, only walking aids and spectacles can be purchased, and this can only be done upon referral by healthcare professionals. There are so many gerontech products available, such as a health monitoring system, fall detection, anti-wandering device, so on and so forth. We're at the teething stage when it comes to gerontech development. Another category should be set up under the I&T Fund for application in elderly and rehab care to allow elderly people to extensively purchase gerontech products so that they can feel how technology can help them enhance the quality of life. And meanwhile, we can also provide more opportunities for the sector. German technology spans across different disciplines. We need cross-disciplinary collaboration between the government as well as different NGOs. I need to say a few words on behalf of the Hong Kong Jockey Club. In 2016, the Hong Kong Jockey Club put forward a health monitoring program so that the health data of elderly are collected for the purpose of improving the health. And in collaboration with the Chinese University of Hong Kong, the Hong Kong Jockey Club also works with a number of NGOs. The e-health stations are set up in over 80 RCHEs to conduct surveys, health surveys on over 10,000 elderly residents. This is one of the handful of examples of collaboration between government departments and NGOs. The government should promote cross-disciplinary collaboration. I so submit. I urge members to support my amendment.
Mr. Bill Tang. Thank you, Madam Deputy. I thank Dr. John Ng for moving the motion. Dr. Ng is from the tech industry And I think it is really good for him to show concern for the elderly. Now we have Mr. Chris Sun here, the Secretary for Labour and Welfare, and he's leading the team. I'd like to say a little bit about the care for the elderly. There may not be a lot of tech elements there. That the Shui Chun O estate tragedy is a typical example. And from the news, this elderly singleton died in his flat, and he's been there for 7 to 8 months before the tragedy was uncovered. I've been serving the Shui Chun O estate for 2 years. I feel very strongly about it. As you all know, this is a rather huge housing estate. 15% of the units are for singletons. There are more and more singleton units because of the QPS system. The younger you are, the lower points were awarded. So for these single person unit, most of them are senior folks. So how can we introduce Gerontech to these senior folks' homes? This is dear and near to my heart. And the Gerontech introduced the NGOs and to care homes, no problem. It's all a question of the resources. We do have the system there. Gerontech introduced to the homes, individual singletons' homes. It is another dimension that we should bear in mind. I am particularly concerned about the elderly singletons. I think we should do more on these two scores in terms of technology. Can we introduce the fall detection sensor that when someone falls, they may still be conscious, and we can offer immediate rescue. That if the elder singleton in Shui Chun O estate died because of lack of immediate rescue, we would be really, really concerned. That we are talking about an elderly singleton who's going to come to his rescue. The Peace Link has been around for 20, 30 years, and this is based on the landline. Many of the senior citizens are not using the landlines, and they are just using the mobile phones. And I know that there is the add-on service for the mobile devices, but the SWT is not offering any subsidy there. Now, what they are subsidizing is the Peace Link that is tied to the landline. It is only the system that would enjoy some subvention. For the single senior citizens who are singletons in private housing, they do not get this kind of assistance. So it would be a good idea for the senior citizens to have a device, by press a button, the management office and the emergency system will be alerted. Second, fall detection. Now, this is already happening in care homes and the hospital. The Shui Chun O estate tragedy highlighted the issue. Now, this is a rather good idea. In the toilets, perhaps a device can be installed. Say, for instance, if nobody enters the toilet within 24 hours, then something must be amiss. And the senior citizens, why is it that he never enters the toilet for 24 hours? Something must be amiss. The issue is really urgent. How can we offer immediate rescue and assistance to the senior singletons? And this is an issue that admits of no delays. And I hope that these kind of detection devices can be introduced to these homes and to offer immediate help. Mr. Ma Fung Kwok. Madam Deputy, aging population is not an issue peculiar in Hong Kong. the world over and the mainland are identifying solutions to tackle the problem. This is an issue facing the whole world. I thank Dr. John Ng for moving this motion to introduce Gerontech to improve the quality of life for the silver-haired group, and we should really introduce the hardware facilities. We should aim to have collaboration with the GBA. I'm all in support of all these proposals. My amendment seeks to make sure that the Gerontech should be people-based. We have to make sure that the silver hair group will enjoy their twilight years in dignity. Madam Deputy, prevention is always better than cure. If the Gerontech can be used to monitor the health condition so that people will not only seek medical attention when they are seriously ill, and we can also use the hardware to assist our daily life. The e-health, the HA Go, are the apps for the patients, and these are platforms for making appointments, and there is no platform for the senior citizens to monitor their own health. So I am proposing that the self-health monitoring system be put in place. We may need to have the hardware, and we should take advantage of the facilities that would assist mobility, like exoskeleton and electric wheelchairs. In March and during the flower show, I've seen a lot of senior citizens are using these kind of facilities that are out and about, and they're having a good time. In the media, we get to learn about the tragedies involving senior singletons. So I think we should have an elder-friendly platform for the senior citizens, and this would enable us to monitor the situation. And we should encourage the elderly to be volunteers to look after their fellow senior citizens. They're helping themselves as well as helping others. And the retirees will be able to live a fulfilling life without becoming a burden on their family. Gerontech can certainly play a significant role. We're basically talking about hardware like robotics. Robotics can help the bedridden senior citizens to get in and out of bed. And if we do not introduce other products, we may not be able to extensively use the Gerontech. In Japan, where Gerontech is extensively used, they said that robots can be good companions. ChatGPT will be more extensively used, but the senior citizens still need companion. If we just rely on the robotics to look after senior citizens, what quality of life are we talking about? So in order to enhance the quality of life and allow the senior folks to live out the years, the twilight years in dignity, we do need to have all the corresponding measures. We should give better care to the senior citizens. This is what President Xi emphasized in his speech on July 1st. The new administration should be proactive enough to address people's concerns and difficulties, in particular the old people. I urge the administration to put in place flexible retirement policy. But this is very much a discretionary practice. In Singapore, they have formulated the right policy. In 2022, the retirement age has been raised from 62 to 63, and the rehiring age will be from 67 to 68. In a way, this can address the aging population and the lack of labor in the workforce. I think we should fully utilize the wisdom of the elderly folks and let them live a fulfilling life. I support the motion, and hope the members will also support my amendment.
Secretary for Labour and Welfare, Madam Deputy, first I'd like to thank Dr. Johnny Ng for moving the motion and Mr. Tony Chair, Mr. Eric Yim, Mr. Shanghai Long, Mr. Bill Tang, and Mr. Ma Fong Kwok for moving amendments, so that we can exchange our views here in the chamber on how to promote gerund technology to tackle population aging. I would now like to brief members on the government's efforts in promoting and applying gerund tech. And then, after members have spoken, I will make a consolidated response. Undoubtedly, technology products help improve the elderly's quality of life and reduce the burden and stress of carers and care staff. So the government is committed to promoting the use of innovative technology in service organizations and facilitating exchanges between the technology sector and users. In December 2018, the government approved a $1 billion fund for setting up the Innovation and Technology Fund for Application in Elderly and Rehabilitation Care, INT Fund, to subsidize eligible elderly and rehabilitation service units to procure, rent, or try out technology products. The fund also covers elderly training for staff and also maintenance of products. To date, grants totaling over $520 million have been approved, subsidizing about 1,600 elderly and rehabilitation service units to procure or rent over 13,000 technology products. The types of products that more organizations applied for include ultra-low hospital bed, equipment and assessment tools for occupational therapy, physiotherapy, and speech therapy, tilt-in-space and height-adjustable shower chair, companion robot, and smart anti-wandering system. The Multi-Welfare Services Complex in the Kutong North New Development Area will commence service in the third quarter of this year. There are 7 residential care homes for the elderly and 2 residential care homes for persons with disabilities there. While the government takes this opportunity to install a number of gerund tech facilities and products for these homes, including contactless vital sign monitoring systems with alarms for bed exit and fall detection, intelligence robots for conducting scheduled room patrols and supporting virtual visits. To facilitate the use of smart systems in the complex, the Architectural Services Department has provided additional infrastructure facilities, including additional power supply, mobile telecom facilities, plant room, and 5G mobile telecom systems. The main entrance of the complex is also fitted with a temperature monitoring system and facial recognition system in support of the anti-wandering system there. The SWD and the ITIB will continue to explore the use of more gerund tech products in suitable elderly homes. Since 2017, the government has hosted the annual Gerund Tech and Innovation Expo ComSummit under the sponsorship of the INT Fund. Not only does the expo enable the public to know more about gerund tech products and solutions, it also promotes the adoption of gerund tech by the local elderly and rehabilitation services industry, contributing to the launch of a number of services and projects. So far, close to 1,000 exhibitors have displayed over 7,500 gerund products and applications from Hong Kong and around the world, attracting close to 200,000 visitors. To foster exchanges and collaboration between Hong Kong and Shenzhen in the area of gerund tech, we have accepted the invitation of the Shenzhen Civil Affairs Bureau to be a consultant to the GBA International Elderly Health Industry Expo, and we will also encourage Hong Kong enterprises and service organizations to take part in the expo. The Social Innovation and Entrepreneurship Development Fund, SIE Fund, set up by the government, engaged an intermediary in January 2021 to design and operate an inclusive one-stop gerund tech platform. It promotes the development and application of gerund tech by linking with different stakeholders on the supply and demand sides and enhancing synergy by way of engagement, cross-sector partnership, and collaboration. The platform provides services like experience sharing, allowing suppliers to receive direct feedback from users, as well as product testing and support services. On top of popularizing gerontech, the government has been active in promoting digital inclusion and assisting the elderly to learn and adopt digital technology products and services. The Office of the Government Chief Information Officer, OGO, has since 2014 been organizing the ICT outreach program for the elderly, whereby NGOs will visit the elderly across the territory and organize different activities for the elderly to experience digital living and encourage them to use more digital technology. Since the end of 2021, service organizations under the outreach program have staged mobile service stations in areas frequented by the elderly in a pilot scheme to promote digital inclusion in the community. Since 2019, the OGO has organized the Enriched ICT Training Program for the elderly to provide free advanced digital training courses for elderly with basic knowledge about digital technology. Upon completion of the courses, the elderly participants can be teaching assistants to help their peers in using digital technology products and services. The OGO has also launched the Elderly IT Learning Portal, allowing the elderly to learn digital skills based on their own needs and interests. Moreover, the SIE Fund has funded over 50 projects which leverage technology to improve the elderly's living. Examples include the robotic gloves, which help enhance home rehabilitation training for stroke patients, and establishment of an online soft meal ordering and delivery platform. Hopefully, more elderly can be encouraged to adopt digital technology to improve their quality of life. In October 2021, the fund funded 4 projects which promoted intergenerational digital inclusion and encourage young people to assist the elderly in learning and using digital technology. The projects have benefited over 3,700 elderly. Madam Deputy, I and the Undersecretary for Innovation, Technology and Industry will carefully listen to members' speeches and will respond to their views in my concluding remarks. Thank you.
Dr. Chairman Kwong, Madam Deputy, there is some declining fertility, and there is some emigration, and for those above the age of 65, 30% in 2001, it's going up to 15% in 2022, and in 2023, it's going to be taking up 1/3 of the population. If this passive population policy persists, then it's going to be getting worse. How can we live up to the presidency's words that the senior citizens will enjoy better support? In March, in terms of the waiting time for public hospitals, I've raised a written question to the Secretary for Health. The public hospitals are under tremendous pressure, and the waiting time and the wastage of doctors, these are really offering no optimistic prospect. Cataract, diabetes, and osteoporosis, all these problems are suffering a long delay. All the specialist waiting time, it can be as many as 1 year. And there is a wastage problem with the healthcare workers, with the aging population hitting the peak. If we leave it to the DH or the Health Bureau to tackle the problem alone, I'm sure that the healthcare system is going to be creaking. The gerontech will help the old folks and also alleviate the burden on the carers. In terms of awareness and extensive use, it leaves a lot to be desired. I support Dr. Ng's motion and order amendments and urge the administration to come up with a blueprint there. We have a lot of catching up to do in order to embrace gerontech. In Japan, they are developing gerontech pretty fast, and there are a lot of success stories. In the 14th Five-Year Plan, it states that Hong Kong is developed into an INT hub we have the Northern Metropolis, and the INT sector will enjoy the golden era. And it's a high time we developed the Gerontech. I think the Northern Metropolis offers a pretty good opportunity for us to promote aging at home, and we should have the homes for the elderly. We should have and the North Metropolis developed into a good place for the elderly. The elderly people should be able to live in dignity. There should be 5-story care home facilities so that the senior citizens can live closer to their family members, and also to minimize the manpower needs. In Northern Metropolis, we can invite the 8 universities and 14 self-financing institutions to take part in the Gerontech R&D and to expand the silver-haired market. Of note is that in the neighboring jurisdictions, they are facing the aging population. We should develop the Northern Metropolis into a new base for the extensive adoption of Gerontech. This would certainly benefit us a lot. In Singapore, they have 2022 plan. In 2030, those above the age of 65 will reach 28%. In the mainland in Taiwan, the same situation persists. We should develop Gerontech and export the Gerontech products to other parts of the world as well. We need to have the funding. We have the annuity, the reverse mortgage products should be fully utilized. And at the present moment, we can choose one of them for tax declaration purposes. I think there should be more tax incentive for people to have a tax deduction of up to $60,000. And that would enable us to prepare us better for the aging population. Thank you.
Ms. Elizabeth Kwok, thank you, Madam Deputy. I'd like to thank Dr. Jenny Ng for moving the motion on stepping up the promotion of Gerontech to enhance the quality of life of the silver-haired group, and the amendments moved by other members. I support all these. Madam Deputy, the aging population in Hong Kong is serious, according to CNS Department's statistics. In 2022, the median age is 44 years old, and those aged over 60 increased by 5% every year. And for the other population groups, their increase is from 4% to 70%. Our annual lifespan is the longest around the world. In 2020, male height is 82.9 and females 88 years old. So we must face up to the aging population problem. On the 1st of July, in his speech, President Xi reminded that we should have better care for people in their twilight years. We must make better use of Gerontech to help us tackle the population aging problem and take care of the elderly. There are relevant funds. These are mainly for the service organizations, but whether it's the carers and those aging at home, the fund is not for them. So there is a pressing need for us to use Gerontech products, especially for elderly Doubleton families and also elderly singletons. They lack support, and they are prone to accidents. Recently, there are different tragedies happening. So, for example, the disabled old lady was living with her aged parents, and they died both at home. And there is also the elderly singleton who died and was discovered only several days later. So we are worried that elderly may die at home without anyone noticing. So these are all tragedies. If the government can provide more support to these at-risk elderly and encourage them to leverage on Gerontech products, then these tragedies may have been prevented. And also there are cases of elderly living in public housing because of the design of the flats. It's difficult to deploy Gerontech. Say, for example, the corridors are too narrow, and there is a sort of a threshold structure to the door and also the bathroom entrance. So the wheelchairs cannot go into the bathroom, and the bathroom is too small, and there are problems with the power supply. So it's difficult to install automatic shower facilities. So in terms of housing design, the government should give more consideration on how we can better leverage on technology, and we should also help modify existing flats for elderly. In the past few years, the government has been working hard to promote Gerantech. In 2018, there is this $1 billion Innovation and Technology Fund for application in elderly and rehab care. So the remaining amount is very big. And in 2023, we also have the Community Care Service Voucher Scheme, which has been extended to cover Gerant-type products. DEB has conducted a survey. 70% of the elderly residents have never heard of Gerant-tech, and 90% of the elderly do not know that they can enjoy services to rent Gerant-tech products. And some elderly misunderstand that these facilities would be very expensive. So price may be a difficult problem. Even if they have the emergency alarm system, yes, they would not like to use it because they want to save on every penny they have. So I hope that the government can extend the scope for the INT fund for application in elderly and rehab care. Apart from subsidizing service organizations, the fund should be applicable to individuals as well. And also the healthcare voucher scheme amount should also be increased so the elderly can use that voucher to buy or rent such Gerant-tech products. There should be more training and workshops and seminars, and I hope that more efforts should be paid to R&D of Gerant-tech so that these Gerant-tech products can actually be used by the elderly. I know that there are quite a range of products which can be used. What matters most is whether the government is doing enough to promote them. I hope the government can leverage on the AI and big data analysis to enhance the quality of life of the silver-haired group so that they can gain a sense of happiness. Mr. Stanley Lee. President, on stepping up the promotion of Gerant-tech to enhance the quality of life of the silver-haired group and tech population aging motion, I support the motion and also the amendments. I think the aging population is getting more serious. According to government statistics, those aged over 65 took up over 20% in the middle of last year. Every 5 persons, there is one elderly. And 6 years later, the percentage will go up to 25%, i.e. 1 in 4 persons. And the average life expectancy, the male is 82.9 years and female 88 years old. So going forward, there will be we can envisage that there are a lot of elderly actually out there. So we must prepare early. And one of the solutions is to leverage on Gerant-tech. So we should leverage on technology to address the needs of the elderly, to help them to lead a independent and comfortable life, and also lessen the burden on the carers. I've been following up on the issue of carers for a long time, and Gerant-tech definitely can help relieve the stress of carers and make life easier for them, so tragedies can be prevented. Gerant-tech covers a wide scope, including health monitoring. So there are wearable devices, and also automation of the household. Smart household devices can be installed, and to enhance the living environment of the elderly, and also we can also use social media to help elderly so that they can socialize. Fourth, the elderly can make use of Gerant-tech to commute and to shop so that they can lead a more independent life. And also for leisure and recreation purpose, we can have a digitalized library, and we can help elderly to lead a rich life culturally. The government has allocated $1 billion to set up the INT fund for application in elderly and rehab care to help subsidize organizations to install the relevant products. The 8th tranche of funding was disbursed last year, and some 2,000 units have benefited. But then there have been reports saying that some hidden elderly leave the home or service units without anyone knowing it. And there was this Shoichuno accident where an elderly person died and his body was discovered days later. In December last year, DAB interviewed 400 household tenants. 70% have never heard of Gerantech, and 80% said that they have their family members who are elderly who need Gerantech products. And also the INT fund that I mentioned, for those aging at place, they cannot apply for the fund. So that means Gerantech is yet to be popularized. Now, the policy is aging at a place with institutional as the care as the backup. So we hope that Gerantech products can be used in the home setting. But then for the INT fund, it subsidizes only major items, say mechanical, hospital beds, and so on. Such devices cannot be easily installed at homes. I urge the administration to allow the fund to be used for procuring or renting household devices, so that those living in home can also make use of the fund. And also there should be special design for property and housing. And actually, I visited a new housing block last week, and there are sensors installed. So if an elderly person hasn't left a home for a long time, there will be a sensor sending out an alarm. So tragedies can be prevented by such facilities. And the Housing Authority can also provide case management services for the elderly. A team comprising professionals and social workers can help the elderly, say, apply for smartphones and so on. And also simple treatment can also be provided to the elderly at home. So all in all, the motion and the amendments can help the popularization of Gerantech. So I speak in support of the motion. Mr. Chen Xiu-hong. President, I speak to thank Dr. Johnny Ng for moving the motion of stepping up the promotion of Gerantech to enhance the quality of life of the silver-haired group and tackle population aging, and the several amendments. There have been tragedies of elderly dying at home, and their bodies were discovered a long time after. And this reflects the loopholes in our elderly policy. We are facing aging population in 2027. 1 in 4 persons will be an elderly. So how do we grapple with the problem? This is something that government must face up to squarely. Now, old people are considered useless oftentimes, and elderly often tell me that because they are rather immobile and they lack the ability to take care of themselves, so it's impossible for them to lead a dignified life. So we must commit the relevant resources, but then elderly people would like to spend their twilight years at home and in a community familiar to them. So we must enhance the ability of the elderly to care for themselves, and we should enhance the support to the carers. This is a key. So if we can make use of Gerantech, we can help the elderly age at home, and we can also help improve the quality of life of the silver-haired group. But then we are developing too slowly in terms of a Gerantech, and the market is very small, and there aren't a lot of incentives to attract overseas companies to establish a presence here. The government has provided funding support for the midstream research of universities, and subsidy is given to various projects. But then the ecology or the ecosystem of the industry has yet to take shape. Startups may have good technologies. They may not be able to understand the problems faced by the elderly and service units, and ultimately their products cannot meet with the elderly's need. And the SIE Fund has engaged in 2020 some NGOs to establish a one-stop exchange platform connecting different stakeholders. That is important to developing a good Gerantang technology or an ecosystem. I think the government should review the performance of the platform as early as possible. Elderly lack knowledge of Gerantang products, and they are worried about using such products. And this is shown in how they commute in the past. Like I said, in terms of the demand and supply and application of Gerantang products, there are difficulties. There are three aspects. There are constraints in the market, the acceptability of the users and affordability of the users, and then we lack the environment for R&D. And thirdly, and there is no connection between the supply and demand side. I think the government should come up with a comprehensive support system and build a healthy Gerantang ecosystem. The government should subsidize academic institutions and the private companies to develop Gerantang products. I think subsidies should be given to users is equally important. In 2018, the government earmarked $1 billion to set up the I&T Fund for application in elderly and rehab care, to subsidize service units to procure and rent the relevant products. And in the third quarter of this year, the community care service voucher will be expanded to cover renting of Gerantang products. But this doesn't go far enough. I agree with what members suggested, that there should be the launching of the Gerantang voucher scheme. We face difficulties in this area, but I believe that if the government join hands with the enterprises and the community to do more, I believe the problems can be resolved. And I look forward to developing a healthy Gerantang ecosystem.
Mr. Lam Chun Sing. Thank you, Mr. President. First, I thank Dr. Johnny Ng for moving this motion. Promoting Gerant technology is one way out to tackle population aging. Gerant technology, however, is not widely promoted in Hong Kong. According to previous surveys, our elderly population did not have sufficient knowledge of Gerant technology. This shows that the government must work harder on promoting Gerant technology. In the past, the government held large-scale Gerant technology exhibitions and summits, but this does not reach out to our elderly. In this year's policy address, it is said that in the fourth quarter, the promotion will be extended to cover Gerant technology products as well. That is for residential care homes. I think we should make good use of, for example, the district health centers. We can make use of the space to showcase Gerantech products. We can collect feedback from users. We can also hold exhibitions for the public to enhance the public's awareness and acceptance of Gerantech products. Apart from elderly people aging in place, the working elderly can also make use of Gerantech. For example, we have aged commercial drivers. After a medical checkup, they may find that they have the 3 prevailing chronic diseases. We can help them monitor blood sugar level by providing them with wearable monitoring devices. The government is planning to tighten the physical examination requirements for older drivers, and we can take this opportunity to promote Gerantech. We can provide subsidies to help them use Gerantech products, because For those working elderly, they perhaps can still afford gerontech products. What about those aging in the community who are out of job? They don't have any income and they may find gerontech unaffordable. In order to take care of elderly people in the community, in the third quarter of this year, the community care service voucher for the elderly will be expanded to cover the rental of assistive technology products. A list of gerontech products will be drawn up. I hope the administration will give full consideration to the physical condition and the living environment of the elderly users so that this list will suit their needs. The Innovation Tech Fund for application in elderly and rehab care only covers elderly and rehab service units. No individual-based applications are allowed. The government should consider extending the fund to cover individual-based applications so that more elderly users can use gerontech products. By way of doing so, we can put gerontech to more extensive use. For eligible elderly persons, we can provide a one-off subsidy for the retrofitting works at home, such as the installation of handrails, shower chairs. Apart from putting in more resources to promote gerontech technology, the government should provide funding support for startups conducting R&D in gerontech technology and also for the introduction of the relevant technology from the Greater Bay Area, along with the training of the relevant personnel. All these are important. The government should work on these areas so as to form a favorable ecosystem for the development of gerontech to help improve the quality of life of our elderly. I so submit. Ms. Chen Haoyan. Thank you, Mr. President. It is common knowledge that the aging population problem in Hong Kong is getting worse. In the coming 30 years, we will reach the peak. In the coming 5 years, according to statistics, the elderly population will be increased to the extent that 1 in every 4 persons in Hong Kong will be an elderly person. And by 2037, the elderly population will constitute 30% of the total. That means altogether 2.5 million elderly people in Hong Kong altogether. Now, this brings about a series of problems such as a shrinking workforce, increasing public spending, and future planning. What is close to the heart of Hong Kong people is healthcare and elderly care. Against a backdrop of a manpower crunch in the healthcare and elderly care sectors, it is imminent that we make a better use of gerontech technology. We've made a start in this regard, but the progress has been very slow. Well, this is a cause of concern. Now let's take a look at what happens in the mainland and in other countries. Perhaps we can draw on their experiences. I believe our government should put in more resources and thoughts into promoting the wider use of gerontech technology so as to provide better care for our elderly. Gerontech technology is a global trend. In another country, that is to say Japan, also facing a very dire issue of aging population. They have started making use of gerontech technology at an early stage. This is part of the welfare policy. Gerontech technology, such as robots, are put to extensive use in care homes so as to provide care for the elderly. They also make use of bed mattresses with monitoring functions to monitor the health of elderly and to help prevent fatigue among care workers whilst providing better care for elderly. There is also this anti-fall or fall detection device and other smart devices at home. In the community, Japan also makes use of smart robots to improve the physical and mental well-being of our elderly. In the mainland, we have similar examples. In the Greater Bay Area, some care homes have adopted gerontech monitoring systems to monitor the health of elderly residents. There are also automated processes to help elderly residents bathe. Even in a confined space of 0.5 by 0.5 meters, a robot can help bathe elderly residents. This can help enhance safety and efficiency. These are examples we can follow. The Hong Kong Council of Social Services set up a gerontech education and rental services center called Age at Home 2 years ago, so that elderly and the family members can have a taste of the advantages and the benefits of gerontech products. This is a very good pilot. This pilot will run for only 4 years, however, and this center is in Sha Tin. Apart from visiting this center in Sha Tin, are there ways for users to be able to rent these products in a more expeditious manner? I think the government should take the lead in holding seminars and put in additional resources to help the center procure gerontech products, so that at different districts, elderly users can rent these assistive products. Resources should be put in to train district care teams, so that the volunteers at the district level can make use of technologies instead of using paper-based methods to record the blood pressure of elderly. We've made a start when it comes to developing geron technology, but this is not sufficient in meeting the demand arising from an aging population. The government should improve healthcare and elderly care policies to improve the quality of life of our elderly, so that we can form an age-friendly society. I so submit. Ms. Eunice Yung. Mr. President, I speak in support of Dr. Johnny Ng's original motion on stepping up the promotion of geron technology to enhance the quality of life of the Silverhead Group and tackle population aging, and other amendments. According to this motion, President Xi Jinping has expressed his hope for Hong Kong to earnestly address people's concerns and difficulties in daily life, including having better care in their twilight years. But the problem of aging population in Hong Kong has become increasingly serious against a backdrop of a manpower squeeze, especially among care workers in residential care homes. We must face squarely this issue, and we must develop geron technology so that we can improve the system for aging in place by say, procuring health monitoring systems for elderly residents at home and for elderly people to enjoy good physical and mental health. There is a lack of holistic planning when it comes to geron technology. It is quite disappointing. A few years ago, we started paying attention to the development of geron technology. In 2018, I commissioned the Legal Research Division of the Legislative Council to conduct research in Denmark, Singapore, Norway, and a number of countries. Very early on, they started to promote geron technology. For example, in Denmark in 2008, the central government took the lead in using geron technology. A fund was set up to provide research and manufacturing support for gerontech products. The fund also covers schools and other institutions. For example, there are monitoring systems. There are also tracking devices and robots for patients with dementia. There are also other products to help promote independence among the elderly people. The 4 projects, having undergone the full trials, have been promoted across the country. There is one project involving an automated toilet to help elderly users to use the facility independently. There is also a feeding mechanism to help elderly users, and there is also another system to help make the elderly residents more independent. In Singapore, there is also a smart assistive device to check the vitals of elderly users for healthcare professionals to take immediate follow-up action if necessary. There is also a tracking and monitoring system The government also encourages healthcare and care home institutions to use technology. So around the world, we see examples of extensive use of germ technology. Hong Kong is lagging behind. Hong Kong is even lagging behind our country. Time is right for us to catch up. In recent years, as far as healthcare and elderly care industries are concerned, we've actively introduced a number of monitoring systems, health management systems, and other smart technologies. They are not extensively used, however. I urge the government to formulate policies to help the industry tackle the issues facing us. The industry now faces a number of problems: lack of funding for the commercialization of R&D outcomes, and lack of funding for conducting trials. A Gerentech platform should be set up for designers, elderly users, manufacturers to exchange ideas. This can help foster commercialization of R&D outcome. We can also make use of the platform as an education tool for family members and the elderly users to know more about Gerentech. Our government should catch up instead of, in terms of healthcare, transportation, we should step up public education to widely promote Gerentech, to promote independence among our elderly, and to alleviate manpower pressure on the care homes, and to promote the physical and mental well-being of our elderly.
Mr. Lee Chen-keung. Thank you, President. As we all know, we see an aging population in Hong Kong. As of the latest figures, we see that we have over 1.52 million of age 60 and above in 2022. So 1 out of every 5 Hong Kong people is an elderly, and the number will continue to rise, and by 2033 there will be 2.58 million. So that means that out of every 10 people there will be 3 elderly people, and that will actually increase the burden on the population. So by 2031 there will be for every 2 people in the workforce will be supporting 1 elderly, and then later it will reduce to 1.4 person supporting 2 people. So these figures not only show that in future more people will be needed to support the elderly, and we see a decreasing number of workforce. Let's not talk about taxes for the moment, because taxes will continue to reduce. I am just afraid that where are we going to find sufficient manpower to look after the elderly? Since there is a shortage, we should enhance our germ technology, because in Hong Kong we are looking at age at home. So with the community services supported by the government, and with germ technology, we can actually help the elderly to provide self-care for themselves, and also to make good use of technology. The 3 years of COVID has actually enhanced the speed of the development of germ technology. HA Go can actually do video calls with the elderly, and elderly, without leaving the safety of their homes, can see a doctor. We can adopt technology to support the elderly aging at home, and this is the trend for the future. Why is it so difficult to popularize germ technology in Hong Kong? Some people have said that there is not enough promotion in germ technology on the side of the government. So can the government, since there are already some district health centers, to set up Gerentech centers in the 18 districts, and to arrange for young volunteers to visit the elderly at their homes and teach them the use of digital technology. As I said earlier, there is a shortage of labor, so we're going to find enough people. We actually do not have concentrated or courses on people. We must actually try to train up professional and passionate people to take care of the elderly, and also to work on germ technology. We must try to motivate and encourage young people to join this sector. For example, to provide professional support in online purchases as well. Well, in the future, more young people will need to take up the taking care of the elderly. Therefore, in their daily lives, they not only act as caretakers, they also might choose to go into the geriatric technology sector. Therefore, the government should provide more opportunities for the young people to be exposed to geriatric technology. For example, to add in such elements in the STEM and STEAM curriculum, and to hold more competitions on geriatric technology so that students can be creative and try to come up with more innovative geriatric products. On July 1st last year, President Xi said that the elderly should have better care in their twilight years. I hope all of you would also put this into consideration. Even if we make geriatric very successful, we have to understand that this is only an assistive technology. It cannot replace the care between people. Therefore, we must try to think of the needs of the elderly at home. We must make more time to spend with them to create an intergenerational harmony. Thank you. Mr. Tang Fei. President, I'd like to speak in support of Dr. Johnny Ng's original motion and the amendments made by other members. Confucius once was asked what filial piety is. And he believed that respecting the elderly and taking care of the elderly, the most difficult part is trying to stay calm and tranquil. But then, if you only provide enough food and clothing, would that be considered as filial piety? What Confucius meant to say is that we must try to take care of both the mental and physical health of the elderly. Because when we take care of the elderly, we must make sure that they are happy, and so we must treat elders as you wish to be treated. So through the development of geriatric technology, we are not looking at the comfort and physical health of the elderly. We also need to be concerned about their mental health. And actually, we see that although geriatric technology can support this, in 2018, 1 billion was actually earmarked for the support of the rental of geriatric products to try to alleviate the burden and pressure on caretakers. And in the first 7 tranches, 4.7 million was approved, funding 1,500 serving units to procure technology products, and that can really relieve the burden of pressure on caretakers. At the same time, according to the SWBIS response on November 23rd of 2022, actually, there are not any data on the number of people using such technology, which means that there's still no big data collected. And so this is a pity that this big data has not been built. Well, at the moment, many of the tech products focus on the physio side. There doesn't seem to be enough attention on mental health. Well, other than the companion robots, it seems that there are not too many products on mental health support. We don't need a lot of complicated technology to help the elderly. Can we actually have organizations to support the elderly to use Web 3.0? or to help them to learn how to use smartphones, smart TVs, and to join online chats so that the elderly can also experience the joys of using digital technology to interact with others, and the elderly can at any time at least online find support. That is already enough. I suggest the government should set up a Geron Technology Task Force, and this has also been suggested by other members. We must try to define the needs of mental and physical health of the elderly, and we must come up with innovation to try to satisfy their needs. We should also have people from the social welfare and also from different sectors and psychologists to also to look into the mental health of the elderly to see what is needed to support their emotions, and then come up with technology to support them. And then we should popularize such tech products so that the elderly can be more happy and our society will thus be more harmonious. I support Dr. Ng's original motion and other amendments made by members. Mr. Chan Pui-la, President, we see an increase of people of over 65. There will be 2.52 million of people over 65 by the year 2030. And then there will be an increase of 30% of elderly people. I'm sure that Geron technology is the way forward for our aging population. At the end of last year, I, together with other G19 members, attended the Geron Tech Summit and Expo. There were over 750 products that can support elderly's life from every different categories to try to relieve the pressure and burden on caretakers. Well, although technology changes by the day, how much of such technology can be applied to the elderly? Well, compared to Japan and Singapore, where there are more Geron Tech products, Hong Kong still lags far behind. Elderly and caretakers do not have high awareness of Geron Tech, and they're unwilling to learn. Some of them are unable to support the high cost, and some of them are not digitally have the literacy to use such products. I think we really must catch up and try to promote popularization of Geron technology. In 2021, when the consumption vouchers was first launched, many elderly people did not have smartphones, nor did they understand how to use online platforms. Many organizations started up courses to teach the elderly. Now, in the third round of consumption vouchers, many of the elderly know how to look for rewards online, and they know how to use smartphones. We should come up with incentives to try to support the elderly to make use of smart technology. Well, although we are moving towards a high age population, most of the people are actually more educated, and so there would be a higher demand for technology. Therefore, this is the best time to promote Geron technology. In 2013, Japan launched a 5-year plan in assistive robots, and in Singapore, there are actually technology to help people to monitor the health at home. And in Denmark, there's also digitalized welfare technology to help the elderly across the country. The administration in Hong Kong must try to review the Geron Tech policy. I'm happy to see in Kwu Tung North in the NDA that the 7 new RCHEs and residential care for the disabled will introduce Geron Tech products. I hope that this can be a model to show other people that RCHEs with Geron Tech can actually enhance the elderly's quality of life. So the INT fund can support this project, and so our CHEs can actually find it affordable to use their own tech products. The government must continue to work on the outreach program and the ICT training program for the elderly to organize activities in different districts so that the elderly can experience digital living. For example, in 171 elderly learning centers, to try to promote their own technology through the care team to popularize their own technology so that the elderly can also experience digital living. I so speak and support Dr. Ng's original motion and other amendments.
Mr. Sunny Tan, President. President, I speak in support of Dr. Johnny Ng's motion on stepping up the promotion of German technology to enhance the quality of life of the silver-haired group and tackle population aging. I also support the other amendment. The government Census and Statistics Department released these figures. In 2069, we will have 3.05 million people over the age of 65 in 2069. That's a large portion. And that will have huge implications for healthcare and many other things in the community. President Xi Jinping urged that we should take a people-centric approach. We need to ensure a sense of security for seniors. In promoting general technology, we can improve their quality of life. We can ease the pressure on carers. That's how we can ensure a sense of security for seniors. We need an ecosystem that's well developed. We need the research and development of German tech, application, promotion. Everything should go hand in hand. That's what we mean by people-centric, and that's how we can improve elderly care on all fronts. First, the R&D of German tech. Now, there is the Social Innovation Enterprise Fund as of March this year. 50 projects using technology to improve seniors' quality of lives have been approved. We have online platforms for ordering soft meals. Now, we also have the LSCM researching various German tech products. They use big data, artificial intelligence to find ways to get in touch with seniors. There are also smart devices that can be modified easily. These products show we have the capability of R&D on German tech. The government should take a stronger lead in this area, coordinate and plan the R&D of German tech products to ensure that all kinds of German tech products can be covered to meet the community's need. And this is how we can improve this ecosystem of German technology. We can be proactive in commissioning universities and also the research institutes to develop German tech products. And we can also make use of the SIE funds platform. And then in the future, Hong Kong Shenzhen Innovation and Technology Park, we can make use of this new innovation center there. Now, on product, I have been calling for a procurement policy to procure locally developed policies, products, and services. We need to drive different departments, public bodies, and organizations to follow the lead. In 2018, $1 billion went into setting up the INT fund for application of technology in elderly and rehabilitation care. The INT fund was there to help eligible service units to procure, rent, and try out technology products. We can step up the work in this area. Now, on promotion and use, we have seen all kinds of German tech products in the market. But people have little idea about these products. So the government should promote these products through a variety of ways, also improve the existing products, provide support, install the equipment for seniors free of charge to ease the financial burden on seniors. Now, we can make use of smart devices for dispensing medicine. This can ensure that seniors take their medicine on time. We can also provide timely reminders, make use of the e-health platform as well. This can mean greater security for seniors, ease the pressure on carers. The government can also make use of the big data to ensure more effective and targeted policies and make use of the applied technology to benefit seniors. I hope the government can also step up collaboration with the rest of the Greater Bay Area. In that way, we can make sure we can help Hong Kong residents locally and those living in the rest of the GBA. You need all different parts to work together in promoting Gerontech. The Labour and Welfare Bureau, Innovation Technology and Industry Bureau, and many other bureaus and departments are involved. I hope the government can come up with a comprehensive policy and strategy, bring together the departments, promote cross-sectoral cooperation. This can ensure better care for seniors, and that can truly resolve people's livelihood issues. I so submit and I support the motions and the amendments. Ms. Lillian Kwok. Thank you, President. I thank Dr. Johnny Ng for his motion on stepping up the promotion of German technology to enhance the quality of life of the silver-haired group and tackle population aging. We know that for those aged over 60, 330,000 require long-term care. They are also solitary seniors, 34,000 or so. In Hong Kong, we have this aging population. Promoting the use of gerontechnology can help meet the needs of seniors and also ease the pressure on carers. With gerontechnology, there will be new breakthroughs for elderly care and aging at home. We can use sensors. This can help provide remote support and support monitoring. That way, we can know how the users are doing. For carers, they have to look out for seniors falling off beds, and they have to keep an eye on how the seniors are doing while they sleep. With the new devices, such as the smart mattresses, they can actually keep track of the user's health. So when the user leaves the bed, an alert goes out. The mattress can also help analyze the sleep situation. Now, there are also vibration-resistant utensils. That way, they can help seniors better look after themselves. There are smart identification technologies, and they can tell between conscious movement and involuntary trembling. And that can offset 85% of the trembling of the hand. With that technology, even when a senior's hand trembles, we can help them with eating. This would mean a lot for those with Parkinson's disease or those with trouble of muscle or motor muscles. That way, the seniors can look after themselves in terms of food consumption. Now, there are also interaction robots. These robots are designed for children and seniors. The robots help them interact and communicate with other people. With technologies like these, we can support those with dementia. This will also provide companionship or company for seniors, and seniors will also have someone to talk to. These are just a few examples, but they do go to show that making good use of technology or gerontechnology can provide more personalized targeted services to seniors and improve their well-being. Promoting gerontechnology is a crucial part and a key part in elderly care in the future. So how do we promote gerontechnology in this area? I have some ideas. First, we need to step up publicity. There are different channels where we can explain the merits of gerontechnology to seniors. We can have all kinds of experience sessions, talks, or scenario-based sessions. We can get seniors involved in the event. That way, they are exposed to different kinds of gerontech product. They can learn about the product. They will see how the products can help them meet different challenges in life. That way, seniors will gradually accept the product and they will be willing to try things out. In the end, we can popularize the product. Second, there has to be regular reviews on the list of gerontech products that you can rent. technology advances in leaps and bounds, and the R&D of products also take into account the needs of seniors. So we should do annual reviews of the list of Gerontech products that can be rented, and also we should also review the success. Third, we need a platform for Gerontech in terms of social interaction. The government needs to work with the tech firms, enhance the interactions. That way, we can encourage R&D in tech firms, and also get the social welfare service units to rent the Gerontech products. That way, we can develop this ecosystem of Geron technology. It's important to create an environment where seniors can age in security. I support the motion and the amendments I so submit. Thank you, President. Professor Chen Ring-Kwong. President, I'm grateful to Dr. Johnny Ng for his motion. I also support the motion and the amendment. With Geron technology, there's R&D, there's technology for seniors. These technology and services can be applied widely to seniors in terms of home safety, social life, among other areas. Seniors will be able to better care for themselves. Hong Kong is confronted with an aging population. We have a serious shortage of carers. We have to make use of technology to ease the pressure on carers and relieve the stress. For this reason, I support making greater use of Geron technology to relieve carers' pressure and improving seniors' well-being. In recent years, the government has taken a range of measures to promote Geron technology in terms of its development and use. For example, there's the Innovation and Technology Fund for Application in Elderly and Rehabilitation Care. Eligible elderly and rehabilitation service units get the funding to procure, rent, or try out technology products. There's also the ICT Elderly Outreach Program to encourage seniors to make greater use of digital technology. But then we had COVID. These measures produced limited success. Last December, the DAB conducted a survey. 71% of the respondents, seniors in public rental housing units, have never heard of Geron technology. There are factors. 76% of the respondents said their products were too pricey. 48% said they were afraid that they would struggle with the product. There are rental services for Geron technology. 89% of the respondents said they had no idea about the rental service. 95% of the respondents, seniors in public rental housing units, said the government's promotion of Geron technology did not go far enough. President, this survey may have given us only part of the picture, but this is enough to show that Geron technology has yet to be popularized, especially among the grassroots. There is a pressing need to promote such technology. We need to use the applied technology to support seniors in their daily lives, and we need to relieve the pressure on carers. To that end, the government can no longer drag its feet. It needs to crack on with the work, make up for lost time. Specifically, the motion and the amendments put forward great ideas. I hope the government can consider them. I also want to make 2 points. First, we need to step up the promotion of Geron technology among the public, especially among the grassroots. We need to spread the word and help them learn how to use it. It's not like seniors are resistant to Geron technology. They just struggle about using the technology. So we need to make good use of care teams. The government can send the care teams to places frequented by seniors, go to the sitting out areas of estates, malls, parks, promote the Geron technology, do demonstration sessions, let seniors try things out. That way, seniors can experience for themselves the benefits of Geron technology. The government should also work with social enterprises, nonprofits, and schools, get more volunteers into districts, show seniors how the technology works. That way you can close the digital divide among the seniors, and that can also build up seniors' digital confidence. Second, we need more funding from the government to help people in need to use digital technology. Some tech products are costly. That something grassroots find unaffordable. So I agree with Mr. Bill Tang's amendment, saying that now for this I&T fund, there should be vouchers for individual applications. That way, we can help those in grassroots buy the gerontech products in need, and this can benefit people. I so submit. Thank you, President.
Mr. Chen Kim-po, we have an aging population. In the coming 20 years, those above the age of 65 will increase. So 1 out of 3 people will be elderly people. This puts pressure and challenges and creates challenges on our society. And of course, we would like to turn to technology to address the difficulties encountered by elderly people so that they can age at home. In the long run, it will alleviate pressure on our various systems. I thank Mr. Ng for moving this motion so that we have a chance to talk about this. Well, in Hong Kong, we have a policy of aging at home as the backbone and supported by residential care. So this means that elderly people will stay at home in a familiar situation. And I support the enhanced use of gerund technology. This will alleviate pressure on residential care homes. At the same time, this will further promote the model of aging at home. This will help with the aging population. In 2018, the government earmarked $1 billion to create the Innovation and Technology Fund for Application in Elderly and Rehabilitation Care. This subsidizes service units to procure technology products for their use. There are many such products for use at home, and this will help elderly people to make it easier for their lives. Say, for example, supporters to help elderly people stand up from the toilet, so that they can use the toilet themselves. There are also sensor mattresses that helps elderly people to turn regularly so that they won't suffer from bed sores. But these products are usually quite pricey, from thousands or tens of thousands of dollars. Not everyone can afford this. I think the government can enhance subsidy in R&D so that the technology can be popularized. This in turn will benefit elderly people. Apart from subsidies to institutions and service units, the scope of application of healthcare vouchers can be expanded so that the vouchers can be used to procure gerund technology product. And we have, from 2017, the Gerund Tech and Innovation Expo Come Summit. It's a large-scale fair. It is also an educational event. This promotes the awareness of gerund tech product. But not many elderly people and their carers can go all the way to Wan Chai to visit the event. I say that there can be regular exhibition of these products in different districts. This will enhance the knowledge of these products, the understanding of these products by elderly people. When elderly people find it easy to use these products, then they won't be as resistant and they will use it. The government should promote the use of gerund technology so that people can make better use of this. This will address the problem of manpower shortage. Aging at home is an important initiative. Elderly people can enjoy a dignified life when they are cared for by their family and when they're staying at home. Mr. Tanya Hang. Thank you, President. I thank Mr. Ng for his motion and the amenders for their amendments. We have an aging population. when it comes to sustainable development of our healthcare as well as retirement protection, we face difficulties. In a lot of countries, they have turned to technology. They advocate smart aging. They want to create an elderly-friendly community, and I'm sure we can learn from these places. When it comes to popularization of gerontech, the government should play a more active role. They need to make preparations for the aging population. They need to support the development of gerontechnology-related industries. Gerontech in Hong Kong is still at an early stage. This is an added product to elderly services. It seems that we haven't given it sufficient importance. The government should give guidance and take a more active role. In terms of industries, the government should put in place policies to encourage R&D and service provision. Gerontechnology can become an industry in the northern metropolis. They should advocate elderly education, R&D of gerontechnology in the northern metropolis. The service can be more professional, and training should be provided to manpower in this regard. In relation to professionals related to elderly services, they can be listed in the talent list. Visas should be given to them to facilitate their entry to Hong Kong. Elderly people should be encouraged to use gerontech products. The cost of gerontech products are quite high. Many people just want to wait before they buy one. The scope of application of the INT fund for gerontechnology should be expanded so that the use and the rental of gerontech products will be easier. The government can also draw reference from overseas experiences. There can be pilot schemes in public housing estates to promote the use of remote control of certain products. Supporting facilities should be put in place to create an elderly-friendly community. For gerontech products to be effective, you need to provide supporting services. Some products can provide health checks, but elderly people will need to have a better understanding of its use, and there should be supporting services so that the products and services can be combined together. In relation to smart products targeting the elderly group, is not popularized. The development of gerontechnology should make technology cater for the needs of elderly people instead of the other way around. So we need cooperation in many different areas. We need in-depth studies to understand the needs of elderly people. And then the government put in place specifications and product standards to make sure that technology can better meet the needs of elderly people. I so speak. Mr. Yu Pak Leung. Thank you, President. I speak to support Mr. Ng's original motion. I also support the amendments. In Hong Kong, we see a long lifespan, but there is low birth rate. We have 1.4 million people who are elderly people. From 2011, the percentage increased from 13.3% to 20% in 2021. And the support rate has increased from 2021 to 117 to 282. That means per 1,000 people in the working population, they support 282 elderly people. With the changes in demographics, there are many different problems. Unfortunately, we saw 2 tragedies in Meifu Sanchun and Soichuno Estate. 3 people died as a result. They are hidden cases, and there's also another case when an elderly people have to support a disabled person. The government needs to make use of a multi-pronged approach to enhance the standard of living for elderly people. The use of gerontech can help elderly people. You can cater to the needs using technology. At the same time, carers can get support as well. In 2018 December, the government earmarked $1 billion to set up the Innovation and Technology Fund for application in elderly and rehabilitation care. It's for the use of service units. And over 400 items are subsidized under the INT fund as well. In November last year, I attended the Gerontech and Innovation Expo Come Summit. I've seen many different projects. I see that the government's working to develop gerontech, but very few people benefit from these initiatives. The scheme mainly focuses on the service units, covering about 60,000 people, 4% of those who are above the age of 60. So only about 10,000 people benefit from this. This coverage is far from enough. The next step is to encourage elderly people to use gerontech product. The government can consider subsidies so that those in need, that is, elderly singletons as well as their carers, will get the help they need. Elderly services policy should be enhanced as well. Mr. Yim Kong, in his amendment, talks about supporting elderly people to retire in the GBA. GBA is a vast area. It's a favorable environment. It's an alternative for Hong Kong people to retire there. This will alleviate pressure on residential care homes in Hong Kong. But there are many restrictions if they want to go to the GBA. Say, for example, social benefits. At the beginning of this month, we talked about subsidizing Hong Kong people to attend consultations in the Shenzhen Hong Kong U Hospital. But new cases, and even if you're elderly and mobility impaired, you will have to travel back to Hong Kong first before you become eligible. So how many elderly people would take the trouble to come back to Hong Kong unless it's a serious operation? Apart from promoting the use of gerontech products, restrictions should be relaxed as well. Say, for example, the use of a healthcare voucher in GBA. If elderly people can receive medical services in GBA using the healthcare voucher, then they don't have to worry about insufficient healthcare support. And if they go to the GBA, they will receive better services.
Mr. Andrew Lam. Thank you, President. I speak in support of Dr. Ng's original motion. We have seen an aging population. By 2030, there would be 30% of our population who are 65 or above. As one important point raised by the CE in its election platform, we must have a harmonious society, and we must also take care of the elderly. Therefore, we must make use of technology to ensure healthy development of people. At the moment, there is still not enough support for the elderly, and we lack the use of technology. This not only increases medical costs, it also affects the medical system, and medical staff face a higher workload and more pressure. We have once visited the Gerontech Education and Rental Service Center in Sha-Tin, and we see a high demand in such use. I think we still face two main issues. The government must try to speed up the development of Geron technology. First of all, to popularize Geron technology, we do not lack resources. 1 billion has already been earmarked to set up the INT fund for application of elderly and rehabilitation care, to support organizations to procure, rent, and try out technology products. But many elderly people do not realize there is such a fund. Even though there has been outreach programs to encourage the elderly to use their own technology, there's still not enough promotion. Most of the money on the fund is used for the procurement, rental, and trying out of technological products, and it does not include promotion work. Secondly, to create or invent more high-tech or advanced Geron technology products, especially in the medical sector. For example, remote medical services and remote health monitoring. These can help us to continue with the age at home policy. Many people hope to age at home, and there is huge demand for this. I once met an elderly person who lives on the 6th floor of an old building, and there's been 20 years since he has left his home because he's unable to take the stairs. There were not enough Gerontech products at that time, and a lack of resources. Today, we are wealthier and we do have more resources to support the elderly. These extreme cases may not exist anymore, but many elderly still need assistance in their daily lives, especially elderly people living alone. How can we provide more support for them and to encourage them to age at home? This is still one of the many challenges we face today. Gerontech can motivate the government to be more innovative, and only by then can we adhere to President Xi's hope to earnestly address people's concerns and difficulties in daily life, so that people will be able to live safely in peace, and then to also to cater to their needs in their daily life. I so submit. Mr. Robert Lee. Thank you, President. I thank and support Dr. Ng's original motion and the amendments made by other members. With aging population, recently more people attach importance to Geron technology, including in rehabilitation and risk management in health, etc. Geron technology can make use of big data, robotics, and new innovative technology to provide better care for the elderly. It can also help carers taking care of the elderly and can reduce the pressure on carers. In order to step up the quality of life of the silver-haired group, I have a few suggestions. First of all, we must enhance education on wealth management after retirement to educate the public to manage their wealth and to add value to retirement via investments. At the same time, the government could enhance the scale of silver bonds to meet the demands of investment needs of the elderly. And the government can, whilst balancing government funds, to encourage voluntary medical contributions so that more people will join voluntary health programs and that they could have more protection post-retirement. Secondly, compared to Hong Kong, actually GBA RCHEs are cheaper and there's actually a better quality of life because there is more space. I agree. I suggest that there should be more cooperation between the mainland and Hong Kong to provide better residential care to the elderly and to provide more opportunities for the elderly to retire on the mainland, such as helping them to reduce making trips back to Hong Kong to visit the doctor for chronically ill patients. We can also lower the threshold for the elderly to live in high quality residential care homes, and through providing more training to nurses and carers to meet the labor shortage. Thirdly, to promote gerontechnology research in the GBA. There should be more cooperation between the mainland and Hong Kong, especially in Shenzhen, where working with universities can help come up with more innovative products. More importantly, to work hand in hand to offer a gerontech ecosystem to meet the needs of the elderly. I so submit, and I'm in support of Dr. Ng's motion. Mr. Chen Han-pan, President, I really am in support of today's motion because stepping up the promotion of gerontechnology to enhance the quality of life of the silver-haired group and tackle population in aging is very important. There are like three elements here: to step up the promotion of gerontechnology and then also to enhance quality of the silver-haired group. Many members have already talked about the promotion of gerontechnology. I would like to touch on enhancing the quality of life of the silver-haired group. We must look into the mental and physical health of the silver-haired group. Many people are happy when they can go out and meet up with their friends, and they can actually go wherever they want to meet up with people and do what they want. This is considered happiness to them. Well, ever since the launch of the $2 transport concession, they have more motivation to go out. We do not actually have a good retirement protection scheme. In recent years, the elderly have become happier. They can enjoy the $2 concession. And now they can actually have a better quality of life post-retirement. Therefore, we see a high life expectancy of the elderly in Hong Kong. In 2006, we still lag behind Japan, but today our life expectancy is higher by Japan by far. Our policy actually works. The elderly in Hong Kong are happy. In recent years, and many people have been discussing the issue of the $2 transport subsidy. We have seen more schemes and concessions. We should not be unfair and think only of the cons of the $2 scheme. But I do not suggest raising it by $1 to $3 because that wouldn't make too much of a difference. Instead, I think we should actually target more important issues. All along, we have rejected the abuse of the use of transport subsidy. Well, some elderly people would just take any bus that comes their way because it's only $2. So, and then they would just get off and get on another one that they need. I don't think this is the ideal way to go forward, that the elderly actually should need to pay a maybe another kind of fare, for example, maybe to just tap their octopus when they go aboard and then tap their elderly card when they get off, much like the light rail system. Some suggest limiting the number of times they can use this concession every day, and some say that there should be a cap each month, but I don't think this is ideal. And I believe that this situation can improve because the elderly actually knows what they should do. German technology and the silver-haired market has still not yet picked up speed. The government should try to make good use of the Gerentech fund to educate the public and not just to make it become a benefit or a concession. Other than benefits, we should make sure that we could create a market, because only by having a market would people be willing to invest and to innovate. I so submit.
Dr. Teck Chi Yuen. Thank you, President. I speak in support of Dr. Johnny Ng's motion. I hope we can work together on German technology in future. President, over the years, we have had large-scale German tech export and also seminars up to international standards. Now, there is the INT fund for application in elderly and rehabilitation care. More than $470 million in grants have been approved. That's roughly half the amount of the $1 billion grant. In Cyberport and elsewhere, we have seen Gerentech projects. Many are viable, and I think those technologies will benefit seniors. But we have yet to see results for Gerentech products, let alone widespread success. So why can't we promote Gerentech product? There are several points. First, lack of coordination across departments. There is the ITIB, they have their own projects, and then the LWB has their own project on tech. And then other departments have their respective own projects. I don't see a coordinated, integrated strategy on promoting Gerentech in Hong Kong. Second, policy is falling behind. Some organizations use technology in dispensing medicine in elderly care homes, but the guidelines for care homes fail to keep pace. There's a set of guidelines, but the Gerentech simply is inconsistent with the guidelines because the guidelines are falling behind. That's what's holding back Gerentech. There are merits about Gerentech. We have a worker shortage. Gerontech is the way out. With Gerontech, we can improve seniors' quality of life. That's how we can protect seniors' health. Seniors will also have an easier time commuting. They will also get better care. But then on the flip side, or rather, when you look at it in a different way, you can minimize risks and better home safety for seniors when you adopt Gerontech. This can help reduce risks, avoid accidents. With an aging population, more seniors living on their own, and then the manpower crunch. We need to implement Gerontech in detail. Now, on implementation, I have some suggestions. For the Innovation, Technology and Industry Bureau, they need to set up a committee on Gerontech development. They can get the LWB and NGOs involved. You need a holistic strategy on how you can use Gerontech for home safety and improving seniors' quality of lives in the next 5 years. Strategies, plans, that's what they should work on. Now, Gerontech is nothing new. Over the past dozen or so years, we have seen new projects. The Labor and Welfare Bureau can review what we already have. What are some good practices, success stories we've had? Put them together. Think of a way to promote Gerontech. Even when something is good, you need to promote it. If some groups fail to take advantage of the tech, that would be a shame. Now, we have district health centers across districts. They come into contact with many seniors. Can we turn these DHCs into centers for education and resources of Gerontechnology? Can we show seniors how the tech works and so that they can make use of it? Now, Gerontech covers care home services and home safety. We need these things to come together to produce better results. I so submit, President. Dr. Frankie Ngan. President, we have an aging population. Care for the elderly is a matter of public interest. We will have a better educated cohort of seniors. We will also have wealthier seniors. They want better quality of life in their retirement. We need Gerontech. This will mean better lives for seniors. This will also help promote aging at home. But then Gerontech remains something new. So there are problems with promotion and application. Some people wonder what Gerontech means. It means this: elderly care, latest technology, they come together to support seniors, to improve seniors' quality of lives, ease the pressure on carers, common products seen, smart devices for dispensing medicine, smartphones, and other devices. There are all kinds of products. Picking the right product, using them, maintenance, everything needs some thinking about. Now, I worked with an NGO in Kowloon East. We set up a booth. Jockey Club A+, Jockey Club agent Home Gerontech Education and Rental Service gave us some devices on loan. Some seniors took an interest in the product, but they had no idea how the tech would work. They have either never heard of it, or they have no idea what kind of products would come in handy. They would worry that the products would be too pricey. On the market, the Gerontech products are handy and they can come in. Then first you have the grab bars for seniors. I've come across this person with foot issues, and then her husband also has mobility impairment. So with this support bars, they can stand up while grasping on it from a sofa. There are rental services for the devices, so that even for those with limited means, they can access the equipment. Gerontech remains to be popularized in Hong Kong. Some people have never heard of them, and there are problems when you want to use it. We are ahead in Gerontech products, but the application has struggled to keep up. This has to do with the fact that the INT fund only applies to the elderly care homes and rehabilitation service units. Without government support, Gerontech products cannot find their way into people's homes. So here are my two suggestions. First, the INT fund should be expanded to cover individuals and care homes. This should apply to persons with disabilities and also special schools. Seniors or children with special education needs should be able to apply for the fund as individuals. That way, Geron technology will be used more extensively. When more people use it, the production costs will go down, the prices will go down too. The policy address says that medical vouchers can be spent on medical voucher on equipment like hearing aids. But then for Gerontech products, they don't need referrals. I hope the government can remove the barriers, let seniors buy or rent Gerontech products with medical vouchers. That way the products can find their way into people's homes. Many seniors live in public housing units. They say that the housing department help install grab bars in their washrooms, but the wait is very long. They hope the government departments can work together, get the housing department to set up task forces, reach out to those in need. The government should provide subsidy and also help install and with the maintenance or help refer the cases to units offering rental of Gerontech products. That way, more seniors in public rental housing can access the products. We have an aging population. We still have a long way to go, and there are problems with implementation. We need to get rid of the barriers, promote the Geron technology, improve seniors' quality of lives, and help them resolve their problems, encourage aging at home, reduce the burden on the community, and so submit. Mr. Gary Chan. Thank you, President. I speak in support of Dr. Johnny Ng's motion about improving the quality of life of the silver-haired group through Geron technology. That way we can tackle population aging. The members have already made many suggestions about Geron technology. I will not go through them one by one. I agree with what they say. To improve seniors' quality of life, we need to go beyond just the technical stuff or technology. It's more than just about resolving the day-to-day issues. Improving their quality of life takes more than that. It also has to do with mental well-being. As we always say, we need to ensure a sense of gain, a sense of happiness for seniors. So how do we get there? There are two things the government can consider on top of the ideas already mentioned by other members. First, for self-occupied properties of seniors, they should be exempted from rates. These seniors have screamed and saved for entire life. Finally, they own their property. But after retirement, they rely on their property. They live there, and they live on their savings. But these properties are subject to rates. Let me give you an example. In Sha Tin, $1,500 in rent. The annual rate is $7,500 per year. It may sound like a modest sum, but if you can waive that, that will be a massive boost for the senior owners. So can we talk to the financial secretary, waive the $7,500 in rates for seniors? That will massively improve seniors' quality of life. That way, the seniors will be more comfortable with spending when they go to, say, a tea house. This is something the government should consider. Second, the $2 scheme for public transport fares. President, this is more than just a welfare measure. The $2 scheme is there to encourage seniors to go out, more social life, meet with their family members. The $2 scheme has allowed seniors to expand the range of people they come into contact with. Say you have a senior who goes to many places, they interact with people, then they are very energetic. In contrast, if they get stuck at home, then they will be more depressed. So the $2 scheme encourages seniors to go out. That contributes to their mental well-being. That can actually save the government spending on their health care. So the $2 scheme is a great measure. Of course, we have also seen many cases of abuse. That's true. But where do you find a public policy that is not abused? The CSSA is prone to abuse. Should we remove the CSSA just because of abuses? We need to plug the loopholes. We need to report the abuses. Now, for the $2 scheme, we should plug the loopholes. That way, the system can be run in a better way, and we can keep the $2 scheme for people. There are also arguments that the $2 scheme is costing $10 billion every year for the government. Is that true? I read this report. From 2012 to 2022, 10 years, the $2 scheme plus the concession fare for persons with disabilities, over 10 years, we spent $9.1 billion. So that's like $900 million per year, not $10 billion per year. This year, the budget reserved $3 billion for seniors $2 scheme. Contrast that with the $10 billion per year claim. That's a huge discrepancy. Seniors can have a good time going out visiting their grandkids. If you take away the $2 scheme, they will be cooped up at home. They are not comfortable about going out, and then they're stuck at home, no longer energetic. And then there will be more work to do on elderly care for the secretary. President, I so submit.
Mr. So Xiong-wing, thank you, President. In the census in 2021, it shows that those above the age of 65, it stands at 1.45 million people, an increase by about 510,000 people. That is a 54% increase. We have an aging population. How can we make use of technology to provide better support services and to provide better quality of life for elderly people? This is an important policy. I agree with Mr. Ng's original motion and the amendments of other members. Hong Kong's situation is special. We have an increasing population of people who need care. We need to put in more for elderly services. By increasing land supply and funding is not realistic. According to a cost estimate, the government cannot be the sole service provider for the elderly and the young. We have a very long waiting time for residential services. We see that we have more and more old people. The dependency rate is increasing too. This in turn put pressure on our health care and elderly services. This will undermine Hong Kong's economic vibrancy. We need to make good use of gerund technology to enable elderly people to live independently in the community so that they don't have to go to homes or stay in hospitals. This will help with the dependency rate. This will address the pressure from an aging population. However, there are many restrictions and limited subsidy by the government. There is lack of support on R&D in gerund technology. registration of products is onerous. We don't have a favorable condition to encourage R&D in germ technology. This in turn affects the affordability of these products. The government should put in place a smart living ecosystem. Infrastructure should be put in place. Smart services using germ technology should get support. Germ tech products that meet the need of Hong Kong people should be supported. There should be more support in terms of subsidy and training. There should be more promotion on the use of germ tech products. The development of germ tech is slow compared to Japan. We are only at a starting point. The general understanding of germ tech is low. There should be dedicated publicity effort in this regard. Promotion should be targeted on elderly people and their family. People should get a better understanding of these products. The government should put in place support and subsidy policies to create incentive to develop these products. Existing products should be adopted to meet local needs. Favorable environment should be created for the trade. I so submit. Ms. Lam So Wai, thank you. I thank Mr. Johnny Ng for moving the motion on stepping up the promotion of germ technology to enhance the quality of life of the Silverhead Group and tackle aging population. By 2050, we are one of the cities with the largest aging population. We are one of the cities with the longest lifespan as well. So there will be an increasing demand for elderly service. Germ technology is getting more and more important. The aging population brings problems such as high admission rate of elderly people, higher demand in residential care home, pressure on carers, unmet needs amongst elderly people and people with disabilities because of lack of support. Germ technology provides the solution. I have some suggestions. First, there are germ tech products available, say for example grab rails, smart devices, cutleries, smart watches. Combining services and technology, you can improve the quality of life of PWDs and elderly people, and this encourages them to stay at home, and this will also alleviate pressure on carers. Currently, these products target the US market and the Japanese market. They are quite pricey and may not be suitable for the local situation. There are some companies who would like to develop their products in Hong Kong, but there is no supporting policies. With supporting policies, then the product affordability can be enhanced. In terms of care homes, manpower is tight. Elderly service is not a popular trade. Not many people want to take up the profession. If care homes can use technology, that they can enhance the quality of life of patients, and it will also take away the pressure of carers, and in turn it will encourage youngsters to join the trade. But with the aging population in the world, there is more and more application of germ technology, say Japan, mainland, Taiwan. We see retirement homes or retirement residential complexes. We see in Mayfu some tragedies involving elderly people who have lost touch with their family. In Shanghai, there is a pilot scheme of an elderly community. Smart technology is used to monitor the activities of elderly people. With the monitoring system, if elderly people are detected not to have left their homes, then alert will be sent to the company. In Thailand and Taiwan, there are also similar communities for elderly people with dementia. This creates a safe environment for people suffering from dementia to move about safely. We can draw reference from this. We can make use of gerontech to improve quality of life. Conversion schemes can be put in place by offering about 10,000 renminbi. There is a list covering many different items, say for example, a conversion in the local premises or procurement of different products. In terms of community elderly care vouchers, they can be made available for procurement of assisted technology. But we don't want elderly people to rent the wrong product. The government should enhance understanding and knowledge of gerontech products. We're going to have district care teams. We can have gerontech ambassadors trained by local communities to serve elderly people. Elderly people can receive guidance to use these products, and in turn, their carers, mostly women, can go out to work. Elderly people have made contributions with most of their lives. We want to provide a good environment for elderly people to live. So I support the amendments and the original motion. Mr. Chen Yong, thank you. Well, our association and the DAB support Mr. Ng's motion on stepping up the promotion of gerontech to enhance quality of life of the silver-haired group and tackle population aging, as well as the amendments. Figures have been provided by other members. We are one of the places with the longest lifespan, and we have an increasing number of elderly people living on their own. Well, we'll all one day become elderly people. If we can make use of technology to improve the quality of their lives and to help their family, it deserves our support. Last time, Mr. Xun took us to the GBA for a visit. We tried out a number of gerontechnology products. The secretary tried a special wheelchair, even though he's able-bodied. Well, even before we become old, we would like to make use of these assistive products when we're tired. Publicity should cover all different areas. We encourage youngsters to learn about STEAM so that they are quite adept in the use of technology. When they go home, they can help their grannies and granddads. It's just like mobile phones. You can ask youngsters to help elderly people to use their phones. And I now find that elderly people make use of, say, video calls to talk to their grandchildren using their phones. Gerontechnology is not just a service. This is also a huge market. This will in turn encourage the use of more R&D businesses. We suggest that the government can make good use of resources by allocating them to NGOs to get elderly people to test use these products. Well, people are resistant if they've never used the product before. Today, we heard there is a case in Wong Tai Sin when an elderly woman going up the escalator got hurt. If technology can be used, perhaps the tragedy would have been avoided. Well, I do think that more effort should be spent in this regard. A few years ago, I've made a similar suggestion in the National People's Congress, that is, to promote smart living among elderly people. We can think about resources sharing, engagement of local organizations, and the use of smart platforms, say mobile phones, big data, AI. Government services should be put under one roof on an electronic platform so that elderly people can make use of this one-stop service. All these initiatives don't just help elderly people. It can also benefit everyone in Hong Kong, whether you are an elderly person now or you become one in a few decades. You need to support this. It's just like what President Xi said in the 20th National Party Congress report. We have to create better lives for elderly people so that elderly people can have better care in their twilight years. And elderly people in Hong Kong can lead a better life.
Dr. Priscilla Leung. President, I speak in support of Dr. Ng's motion and the other amendments. Today, the debate is on stepping up the promotion of German technology to enhance the quality of life of the Silverhead Group and tackle population aging. And this is something I have been pushing for since I became a legislative member. Well, many members have touched on the $2 transport concession. I hope when the government rejuvenates the economy not to scrap the $2 subsidy. I remember that it took a very long time for us to implement the concession scheme. And this is very important to our debate today. Many members have said that by 2039, 30% of the elderly will be over the age of 65. And in recent days, we've seen news that some young elderly people are taking care of the more aged. So, for example, those from the baby boom in the 60s taking care of the elderly who are 80 or 90 years old, and nobody knows when they pass away at home. So by the year 2030 comes, we will see elderly people taking care of other elderly people, and we will need to think of their mental health. Or some of the new retirees who were born in the baby boom or in their 60s, and they take care of their elderly parents, as some quit their jobs to take care of their parents, and they live quite difficult lives. And there is actually a lack of needs catered to the elderly. Although we do see the personal emergency link service and other geotech services, it's not enough. How can we ensure that elderly people can enjoy the use of German technology? We should make good use of post-COVID. of a video conferencing diagnosis. So the elderly can see the doctor via video conferencing, and that can actually relieve the pressure on the medical sector. And then the elderly will not need to queue up to physically see the doctor. In Hong Kong, there's a gerontechnology residential or center home. So it takes about 3 million for the elderly to stay in this home. So can the government make this more easily affordable and not to charge such exorbitant prices? Because then more people can enjoy post-retirement life. I have some happy news to share with you. I know many elderly who are quite trendy. So they have ordered all these smart products at home. And then they learn to live with AI. Recently, a friend of mine who can afford such technology told me to remind everyone that when she bought these services, she didn't know that these products are so sensitive. And when she talks loudly at night, the toilet actually flushes automatically. And these products have very sensitive sensors. The elderly will need to learn how to live with these products. For gerontechnology products, they cannot be too high-tech that the elderly do not know how to use, because for such smart technology, sometimes the technology is too advanced. And now my friend has to take apart all the products and then reset them again. I so submit. Ms. Judy Chen. Thank you, President. Well, actually, all of us would face life and death, and we actually define turning old by age. Everyone lives in a different community, and they have different health, and people have different demands in their daily lives. Elderly people, other than relying on those who assist them, can also make use of technology to help them with self-care and alleviate the burden on carers. The administration has always been promoting aging at home, but to really help them age at home, we must try to promote gerontechnology to the elderly and to make such technology popularized. Today, I speak in support of Dr. Ng's motion in stepping up the promotion of gerontechnology to enhance the quality of life of the silver-haired group. And this is actually a good opportunity for us to discuss this. According to 2022 statistics, those above the age of 65 have reached 1.25 million, which is about 20.9% of the entire population. And according to this estimate, in 10 years, it would reach 30%. It can actually, when it reaches 2050, the number will continue to rise, and by that time, Hong Kong will become one of the places with the highest elderly population. Well, this shouldn't be too much of a problem, but from this phenomena, we can foresee what kind of impact it will have on society. If we do not try to take a step ahead to prevent the issues from arising, then we must try to do something now. We've seen 2 tragedies in Mayfu Estate and Sochuno Estate. So there needs to be more support for the elderly who live alone. But today, we still are not able to really resolve this. How can we make use of technology to make improvements is the reason why we want to promote geron technology. President, geron technology in other places have been developed for a long period of time, but many of these products may not be suitable for use in Hong Kong. How can we really age healthily is something we need to learn. We must give opportunities to the elderly to try to understand what difficulties they are encountering to really come up with innovations to meet their needs. For example, in some of the Geron Tech Expos, I have seen many products invented in Hong Kong. It may just be a very simple sensor put in an adult diaper, and the carer would not need to check on the adult every hour, and it can actually reduce the workload of the carer. So this is something that we can really promote as Geron Tech products in Hong Kong. I've noticed that the government has planned to launch the district centers for the elderly this year, and then to also have the neighborhood elderly centers. I believe that this is a good start. At the same time, the government can also look into extending the use of the medical vouchers so that the elderly can have a better quality of life. I so submit.
Reverend Peter Kun.
President, with aging population and a low birth rate, those above the age of 65 will by 2037 reach 30% of our entire population according to estimates. So that is actually a number exceeding 2.7 million. I believe that with the shortage of manpower, we must try to make use of technology and so I really must thank Dr. Ng for moving this motion to give us an opportunity to discuss this. I personally have visited many Geron Tech Expos. Every time I go to Japan and I see the Geron Tech products, I wish for myself to become old sooner because the products are very attractive and appealing. Very often, when the elderly become old, can technology really help them? Elderly people are much like children. All they want is for someone to care about them. Technology can help carers and the elderly to a certain extent to improve their life, but then to really take care of the elderly, it takes a lot of hard work. There is still a lot of room for improvement in Hong Kong in Geron technology. While we promote Geron technology, we must also try to raise awareness in the elderly's needs. We are facing an aging population. How can we ensure that they have a better quality of life? This is not something that only technology can resolve. I'm sure that no one will veto the motion today because I'm sure everyone hopes for the elderly to enjoy a better quality of life. The only thing we need to consider is that in the use of technology, I remember that when I travel, I've seen a dog. When you have dogs, you know that it takes a lot of work to take care of dogs. But then for an electronic dog, you can charge it during the night, and then during the day, it comes at my beck and call. So this is much like taking care of a person. We know that the elderly may not actually have many requests. They just hope that we would care for them and ask about them. We not only should invest in germ technology, we must also do a bit more for our elderly and try to come up with ways for our carers to help them and support them so that we can all work towards ensuring a better quality of life for the elderly. I still submit.
Mr. Scott Leung, thank you, Madam Deputy. We have an aging population. The census and statistics told us that in 2021, over age of 65, they made up 20% of the population. In terms of the forecast, by 2039, seniors will make up 31% of our population. With germ technology, we can cope with the problem, and this becomes increasingly important. They can help boost the efficiency of care at care homes, and they can also provide stronger support for elderly care at home, and they can also promote a sense of happiness for seniors. They contributed to Hong Kong's development, and we need to ensure proper care and support in their twilight years. We have this policy of home aging at home as the core and care homes as a backup. Now, for the care homes, we have limited workers at care homes. Germ technology can help meet some simple needs of seniors. It can help ease the pressure on manpower. In Denmark, there are beds that can help seniors turn around. In Singapore, there are sensors seniors can put on, and there are systems that can monitor the vitals of seniors. This means taking pressure off carers. For future care homes, there will be germ technologies in Hong Kong. Contactless vital sign monitoring systems, for example, warning systems with alert for fall or leavers of bed. In 2018, the INT Fund for Application in Elderly and Rehabilitation Care was set up with $1 billion in funding. The Social Innovation and Entrepreneurship Development Fund also set up an online platform for developers to get user feedback directly. That way, they can find out the needs of the users. These measures involved planning, funding, support for R&D. There is government support along the journey. But the question remains, and that is the market. We have a limited market in Hong Kong. So for tech startups, there is little room for development. So my suggestion is, for the germ tech firms, we need to provide opportunities for them in the GBA. We need to provide funding for them to develop germ tech products that can meet the needs in Hong Kong and the rest of the GBA so that their products can be promoted to the service units in the GBA. This means doing visits, doing trials for these tech firms. That way, we can create a bigger market for them, and this can also help drive down prices. That way, local care homes can buy the technology products to help with the work. On aging at home, there is no funding subsidy specifically for germ tech for aging at home. We need to dedicate the funding, or we can allow health vouchers or medical vouchers for seniors to buy germ tech products such as hospital beds and also other kinds of devices. Now, seniors can also use smart wristbands to monitor their own health at home. That way, we can have real-time monitoring of seniors' health. In the long run, this can help reduce the pressure on healthcare. For the Housing Authority and the Housing Society, they installed emergency alarm systems known as safety bells for seniors with need. The device can be linked up with smartphones. We can expand the funding scheme so that applicants, based on their need, should be able to purchase devices they can wear with alarm systems. Madam Deputy, we have seniors looking after other seniors and also those with disabilities looking after seniors. The carers have to stay home over long hours and they are under immense stress. Making use of gerontech smart technologies can help reduce their anxiety and reduce the stress on them. Making greater use of gerontechnology can help people meet their needs, and this is a question for the government. So I support Dr. Johnny Ng's motion on making greater use of gerontechnology to tackle population aging. I so submit. Thank you. Dr. Lo Wai Kwok. Madam Deputy, I thank Dr. Johnny Ng for his motion and the amendments from 5 members. Honoring the aged is a fine virtue of the Chinese nation. There's also national policy to support this under the 14th Five-Year Plan. It says we need to take steps to drive the development of the elderly care business. We need a basic elderly care system. President Xi Jinping delivered a speech on July 1st, 2022. He stressed that for Hong Kong, people want a better life. For seniors, they want better care. This is a very meaningful statement, and this is relevant to us. Based on the latest population forecast, we have an aging population. For those aged over 65 or at 65, in 2019, we had 1.32 million people. In 2069, we will have 2.58 million such people. And the ratio they make up will go up from 18.4% to 38.4%. The government has a duty to work with various sectors of the community in promoting gerontechnology to improve the quality of life of seniors and their ability to care for themselves. This can ensure a sense of security for seniors and a dignified life and happiness for seniors. The safety bells are the earliest form of gerontechnology in Hong Kong. In recent years, the safety bells have come in a variety of forms. They can be installed as mobile applications. They are also reminders for follow-up consultations, taking medicine, emotional counseling, making an appointment for clinical services. Gerontechnology covers a range of areas: health monitoring, assisting swallowing, and also anti-wandering systems, teleconsultation services. To popularize gerontechnology, the government needs to take a range of measures. They need to make them accessible, affordable, and also make sure seniors know how to use them. To make the products accessible, the government should make use of an INT fund, subsidize universities and institutions to research and develop gerontechnology products, and then work through the public sector pilot scheme, promote the use of such products that can provide sustainability and returns for the local sector. The Urban Renewal Authority launched a home improvement scheme using gerontechnology. Seniors allocated public housing unit are given home settings. They get home equipment. This is an experience we can learn from. In urban redevelopment projects and new development areas, we can pre-install gerontechnology products in units. Now, to make gerontechnology affordable, the government should expand the INT fund for application in rehabilitative care and elderly care. Funding should be made available for seniors to buy the products, which the government should also make sure seniors can know how to use the products. Now, the OGCIO launched a platform for seniors to learn about digital technology, but the government can do more. We need more resources for a community mutual help network, popularize gerontechnology, and we need more training. That's how we can make sure seniors are more familiar with children technology, and more seniors want to spend their twilight years in the rest of the GBA. The government should work with the GBA cities in the mainland, and we can jointly promote the use and development of children technology. We can also tap into our own advantage with medical technology, make use of teleconsultations, talk to the mainland authorities about cross-boundary sharing of data and health records. That way, we can have Hong Kong seniors staying for the long term in the mainland and they can still meet their medical needs. I so submit, Madam Deputy. Kwok Wai Keung. Thank you, Madam Deputy. I speak in support of the original motion and all the amendments. Last year, we entered into a super aging society. Over the age of 65, they made up 20% of the population, 1.4 million in total. The Census and Statistics Department told us we have yet to see the peak. Now, based on the population forecast 2020 to 2069, by 2028, that's 5 years from now, for those aged 65 or above, we will see 25% of our population in that age group. In 2069, we will see 35% of the population at the age of 65 or above. So we will see more seniors in the community. The crux here is that we have a very low birth rate. I'm not sure if this forecast has already taken into account the falling birth rate. So we don't have effective pronatalist policies. Is there any follow-up? How can we have a more proactive population policy to slow down the super aging of the community? Now, turning to our labor force, we have a shrinking labor force. This is anticipated. This shouldn't be something the government just realized overnight. There is talk of importing labor. This is short-termist thinking. They have ignored the fact that this is simply taking resources away from Hong Kong because the imported workers will remit the earnings they have to wherever they come from. This means local resources going away. It's uncertain on whether that will help grow the local pie. We want to create local jobs, a promotion ladder, and improvements to workplaces. Imported labor will hinder work in those areas. We don't attach enough importance to family values, even though we have a family council. Family continuity hinges on childbearing, but now we have continuity issues. How do we fix that? The government needs to step up its work. Now, coming back to elderly care, many members have already discussed this. We need money. There are well-to-do seniors. They are financially independent. They can make up their own mind on accessing or procuring better technology, better services. But what about the middle class and those in the grassroots? The technology is no good if the seniors cannot afford it. Many seniors put their lifetime savings into their property. Homes are unaffordable. They scrimp and save for the property. They finally have a shelter, but they no longer have money at their disposal. So the reverse mortgage scheme is a great measure. You need to step up the publicity. That way, seniors in the middle class or in the grassroots, if they have a property, they can take advantage of the reverse mortgage and stay financially independent. We need more publicity to drive a change in culture. We need to change the mindset that they need to leave something behind to their children. The seniors need to think for themselves too. Madam Deputy, German technology is more than just about ease of living. We need to create an industry of gerund technology. There are media reports saying that in 2025, in the Asia-Pacific region, for those aged over 65, we will see 600 million seniors in the Asia-Pacific in 2025. They will have daily needs. They need to spend on the daily needs and the technology. If we can have a local industry to meet that need, that will mean immense returns. This can also help get our young people to pay attention to seniors, because the young people will need to understand what the needs of seniors are. That's how we can also have intergenerational cohesion and see healthy development in that front. Does any other member wish to speak?
Dr. Johnny Ng, you may now speak on the amendments. Thank you, Madam Deputy. I'm very happy. I'd like to thank 5 colleagues for moving amendments. I'm sure that, like me, all of the members are very concerned with the life of the elderly. I agree and support the amendments. For example, Mr. Tony Tse talked about making complementary arrangements in building designs and urban planning. This is very important to the housing needs of the silver-haired group. Property developers in coming up with e-balconies or eco-balconies could actually have a better rate. And I think that in building public housing, the housing authority can also add in gerund technology so that it can support the elderly. Mr. Im Gong talked about the government strengthening cooperation and collaboration with cities in the Greater Bay Area to step up promotion of gerund technology so as to better support Hong Kong people to retire in GBA. I agree, because the 1 hour living circle in the GBA is very suitable for retirement, and it can actually help facilitate the elderly to live on both sides. And with the promotion of gerund technology, it can also help support our innovation technology. Mr. Shang Hailong suggested extending the scope of application of elderly healthcare vouchers to allow the elderly to use HCVs to purchase gerund technology products. I agree, because if we can actually extend the vouchers to rent or to procure gerund technology products, this is exactly what the elderly needs. And on the same note, Mr. Tang will also suggest the application of gerund technology vouchers. This can actually help those who are aging at home to purchase suitable gerund technology products because many of them actually cannot afford it at the moment. And he also suggests that there should also be monitoring system for elderly singletons, such as sensors and monitoring systems for bed exit and fall detection. And this can actually help us to ensure that elderly singletons receive timely rescue and assistance in the case of home accidents. Mr. Ma Fong Guok suggests encouraging the elderly to use technologies for self-health monitoring and advanced rehabilitation facilities such as exoskeleton and electrical wheelchairs to enhance their commuting convenience, and at the same time to build friendly communities for the elderly to help each other. IT can actually help those who are in difficulties to enhance their commuting. And it can also help those to live with dignity in communities with which they are familiar. We have actually adopted such technology in our district, and some feel that is very convenient, and it can actually enhance our communication between our district office with the community. The 5 members have raised many concrete considerations, and it actually makes my motion more significant. I hope that members will support my motion and that the government will really step up the promotion of gerund technology. Undersecretary for Innovation, Technology and Industry. President, I'd like to thank Dr. Johnny Ng for moving the motion and Mr. Tony Zhe, Mr. Yim Kong, Mr. Shanghai Long, Mr. Tang Ka-piu, and Mr. Ma Fong-kwok for moving their amendments. I'd also like to thank other members for their valuable comments. Here, I'd like to touch on the salient points of the Innovation and Technology Bureau. Hong Kong boasts as one of the regions with the highest life expectancy. With the increasing number of elderly people, how to better care for and support the elderly in a digital community is an important issue. As Dr. Ng pointed out in his motion, Zero technology can enhance the quality of life of the elderly, and they can actually alleviate the burden of carers and their families, and also ensure that the elderly enjoy better support. Here, the INTB have been taking a multi-approach to actually to promote this. Actually, many members, Ms. Chen Xiu-hong, Yong Ho-yen, and So Zhang-wing has also suggested creating a zero technology eco-circle to promote and to enhance the use of technology. The government in 2021, through the SIE Fund, developed and operated an inclusive platform to link up different stakeholders on the supply and demand sides. The platform can actually help the users and the suppliers to work on testing and also to receive feedback to better assist those products to be optimized and also to enhance the application of zero technology in Hong Kong. The platform also provides over 1,000 types of support and services for startups and SMEs in the design and development of zero technology. For example, for those that can be used in elderly care and rehabilitation care, to promote the systematic development of zero technology. The platform has always been carrying out a range of activities so that the sector and overseas can also learn about the current trends, the operations, and other services to help the sector understand and open up more developments in zero technology. Other than this platform, as of end of April this year, the SIE Fund has also funded 499 projects, out of which over 50 of them use technology to enhance elderly quality of life, such as outreach rehabilitation services and young people assisting the elderly people to learn the use of digital application, and over 15,000 elderly have benefited from this. On another hand, members have also talked about the support for zero technology development. The INT Fund under the ITC has been encouraging and providing funding support for universities and local public research institutions and private companies to conduct research and R&D projects on various technology and to conduct trials of the R&D outcomes in the public sector. And that include a funding of over 200 million. Examples include funding ASTRI to use the elderly's vitals and gait to develop a risk assessment on dementia, and other than promoting the use of zero technology, as Mr. Tang Fei, Mr. Chen Pui-leung, and Mr. Chen Wen-guo have also talked about how to better help the elderly use digital technology so that they can enhance the digital confidence. The government has been working very hard to promote digital inclusion to help our elderly people to better embrace digital life. And we have also been popularizing the use of zero technology. we launched the ICT outreach program for the elderly to assist those who live in RCHEs, receive daycare and home care services, and the hidden elderly to experience digital living. Since its launch in 2014, over 24,000 elderly have benefited. Other than enabling the elderly to experience digital living, activities also include other elements such as using smart robots to teach healthy exercises and to use VR and AR and to use AR archery games to train eye-hand coordination. The latest round began in April of this year, and an estimated 12,000 elderly will benefit. We will also set up mobile outreach stations in all districts and to visit malls and housing estates and parks to reach out to the elderly to help them use smartphones and mobile applications. Many members such as Mr. Chen Kim-bom, Ms. Chen Ho-yan have also mentioned that we can better use our resources, and we are going to step up our efforts on this end. Since the enriched ICT training program for the elderly was launched in 2019, through the 11 elderly academy across the districts, we have provided over 200 free of charge digital training courses for the elderly. Contents include I Am Smart and other popular government applications. It also includes online shopping, mobile payment, to help them to learn about digital technology. Those who completed the course can also act as teaching assistants to help teach their peers to enrich their social lives. As Mr. Lee Chen-keung suggested, we also arrange youth to act as instructors to promote intergenerational inclusion. Since its inception, over 5,800 elderly have benefited from this program. In 2021, we launched the Elderly IT Stars Recognition Scheme to commend the elderly for proactively using digital technologies to bring a positive impact to themselves, their peers, and we hope that we can encourage more elderly people to embrace digital living. In 2019, we also launched the Elderly IT Learning Portal. It offers short videos and tutorial clips so that the elderly can pick up digital skills at their own pace. Currently, there are over 33 learning modules, and as of today, we have recorded 350,000 views. We will continue to develop more content on the learning portal to provide courses that are of interest to them and to encourage them to enhance lifelong learning. Madam Deputy members, promoting the popularization of German technology to overcome the challenges brought by an aging population and thus improving the elderly's quality of life is the way forward. We will continue to work closely with all stakeholders to continue to promote the development of German technology and cross-generational digital inclusion. Through innovation, new products, and services catering to the needs of the elderly, we hope to help more elderly learn and use general technology to better address the concern raised by President Xi to resolve the difficulties and concerns of people's lives. I so submit.
Secretary for Labor and Welfare. Madam Deputy, once again, I thank Dr. Johnny Ng for his motion and the 5 members who moved their amendment, Mr. Tony Tseng, Mr. Eric Yim, Mr. J.C. Shang, Mr. Bill Tang, and Mr. Ma Fong Kwok. 31 members have also spoken on this matter. Members touch on a wide range of matters covering social welfare, innovation technology, artificial intelligence, medicine, urban development, $2 scheme, and seizing GBA opportunities. That's a wide range of matters. I thank everyone. I have taken note during your speeches. We have touched on policy matters, and there are also examples given on German technology. I thank everyone for sharing with me ways to make good use of German technology to help seniors. Now, some response from me on a number of matters. Mr. Bill Tang and some other members, Ms. Elizabeth Kwok, Mr. Stanley Lee, Professor Chen Wen-kwong, Mr. Chen Xiu-hong, Dr. Tan Yue-heng, Dr. Frank Ying-an, and other members touch on this matter. That is, we have the I&T fund for application in elderly and rehabilitation care. The question they raised was, can we allow individuals to apply for the fund instead of just allowing institutions to apply for it? Now, we spent $1 billion to set up the fund in December 2018. We set up this fund to do this. First, we want to help those in need, mostly people in care homes. There were roughly 30,000 residents, and then another 30,000 living in private care homes. And then there are also those living in care homes receiving subsidies. These were the people we wanted to help the most. So the fund was open to application from institutions. That way, we can benefit the seniors and persons with disabilities living in the care homes. Now, we've already spent $502 million out of the fund. Last September, we expanded the coverage of the I&T fund. So apart from subsidized care homes, all private or self-financing care homes for the elderly or for persons with disabilities were covered. So up to 2,200 places are now available. So there was this expansion. Private homes, self-financing homes can apply to the I&T fund. We have received 343 applications from private or self-financing service units. And they make up roughly 70% of all care homes not receiving the Social Welfare Department's funding. So we're making better use of the I&T funds. Even private homes, self-financing homes can make use of the I&T fund and procure German technology. That's a major step forward. So coming back to the question, can we let individuals apply to the fund? We have thought about this. For individual users, the better way to go is to make use of the community care service, the community care voucher for seniors. And here's the idea. Seniors get a choice. They can go to different service units and get the service they want. Now they cannot buy German tech products now, but then very soon, starting from the third quarter this year, the community care voucher will see a number of changes. First, it will be regularized, so the money will be there. And second, we will expand the scope, going up from 8,000 to 12,000 in 2025 to 26. That's a 50% jump. When you have 12,000 vouchers, that means we will be spending $900 million on the scheme every year. That's a lot of money. So starting from the third quarter this year, the vouchers will cover the renting of assistive technology product. This means the market for German technology will expand. More players can enter this market, including non-government organizations, and it also include local tech firms. We want to have this larger market. Seniors will benefit. Service providers, tech firms will also have a greater room to develop German tech products. So there is potential. And with this policy change, We're trying to have a better environment to benefit our seniors. Now, for products popular with seniors, you can see a list of them. Hospital beds, you can adjust the height of those beds. And there are also cushions, special wheelchairs. These are the popular items among seniors. Now, the community care vouchers will see an expansion in scope. We will be closely watching the needs of the users and any changes in their needs. We talked about care homes, those using community care vouchers. We have been talking about the frail seniors who cannot look after themselves. But then many seniors are healthy. They can look after themselves. So what about them? They go to the district community elderly centers or the neighborhood elderly centers. We have 213 such elderly centers. You have such centers across all districts like convenience stores. They have roughly 250,000 members who are seniors. So starting from the fourth quarter of this year, we will make it a requirement for these elderly centers to promote gerund technology. Many elderly centers are already working at this, in fact, voluntarily. But then starting from the fourth quarter this year, it will be their job to promote gerund technology. So there will be workshops, talks, to promote digital and gerund technology. The goal is to ensure exposure of seniors to gerund technology, to make sure seniors know what the technology is out there. As the members have said, if the money is there, the tech is there, but the seniors are not aware of the technology, then that's no good. So what we are trying to do here is to make progress in the promotion. Now, the two tragedies in the community, the heart-wrenching tragedies, a solitary senior and also a family of a carer who passed away. This is very saddening. I can fully appreciate this point. If we can make good use of gerund technology, then for solitary seniors, hidden seniors, or those households with nothing but just two seniors, then we can bring changes to them. And we can prevent tragedies from happening. For carers in particular, in the second half of this year, we will have a range of measures. First, round-the-clock support hotline for carers. Some months ago, we were talking about something about carers. Ms. Elizabeth Quat put forward an idea. She was already taking calls from those in need. We will have the round-the-clock support hotline. I hope that can help take some pressure off Ms. Elizabeth Quat. Of course, I hope she can carry on the work too. We will have professional social workers manning the hotline. There will be counseling, outreach, referral services, etc. The government has indeed a responsibility to support the vulnerable. But I would also like to take this opportunity to call on our community to pay greater attention to the needs of the seniors, persons with disabilities, and their carers around us. Let's all look out for one another, something that we take pride in. Sometimes that one extra step from us may be all that it takes to prevent a tragedy. In our discussion today, some issues came up. I want to respond to these points. Dr. Priscilla Low, Mr. Brave Chen, and Mr. Chen Hanpen touched on the $2 scheme for public transport fares. They may not have anything to do with gerund technology, but this is a matter of great interest to members, so I want to comment on this. For the $2 scheme, the government has a clear goal. The government will step up efforts to combat abuses of the $2 scheme. This is to ensure the resources go to the eligible seniors and persons with disabilities. That's our priority. We combat the abuses. Many members also mentioned this point. Can we expand the scope of medical vouchers for seniors? We consulted the Health Bureau. As we all know, the vouchers are spent on prevention, treatment, and rehabilitation. So there has to be something from providers of medical services after a consultation. There has to be prescription. So the vouchers cover medical equipment like hearing aids. The medical vouchers cannot be spent on purely buying or renting medical equipment or drugs. Now, another point, how do we seize the opportunities of the Greater Bay Area to meet the needs of seniors? Many members like Mr. Eric Yim made great comments, Mr. Lam Chen-sing, Mr. Chen Ho-yan, Mr. Chen Xiu-hong, Mr. Sunny Tan, Mr. Brave Chen, Mr. Robert Lee, Ms. Connie Lam. They discussed ways to make use of the opportunities of the GBA. In late April, I visited the mainland cities of the GBA with a number of legislative members and social welfare service units. We visited there and had a look at the gerund technology development there. Ms. Connie Lam was saying this. We're using gerund tech products from Europe, the US or Japan. Great quality, but very pricey. The visit to the GBA showed that technology in the mainland develops in leaps and bounds, and they are very affordable. In the West or in Japan, they offer gerund tech products, but the mainland alternatives are at half the price. And this is something we can explore. We went to not just the GBA, but also there was an earlier visit to Beijing. And we talked to the ministries and commissions. We discussed ways to make good use of the gerund tech products from our own country. So apart from using products from Europe, the US and Japan, we can also make use of the more affordable alternatives from our own country so that we can benefit more seniors. Madam Deputy, I want to say this. The government will continue to work with partners from various sectors in driving innovation and technological developments, including gerund technology. Our goal is to provide greater convenience to seniors, their carers. We want them to make greater use of gerund technology to meet the challenges from an aging population. Again, I think the 37 members who have provided great comments and their reminders. Thank you, President.
I now call upon Mr. Tony Tse to move an amendment. President, I move my amendment. I propose a question to you. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members. President, I declare the amendment passed. Mr. Yim Kong, as Mr. Tony Tse's amendment has been passed, you may move your further amendment. President, I move my further amendment. Now put the question to your state. I propose a question to you that Mr. Yim Kong's further amendment be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Mr. Zhang Hailong, as the amendments of Mr. Tony Tse and Mr. Yim Kong have been passed, you may move your further amendment. President, I move my further amendment. I propose a question to you that Mr. Zhang Hailong's further amendment be passed. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Mr. Tan Ka-biu, as the amendments of Mr. Tony Tse, Mr. Yim Kong, and Mr. Zhang Hailong have been passed, you may move your further amendment. President, I move my further amendment. I propose a question to you that Mr. Tan Ka-biu's further amendment be passed. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Mr. Ma Fong-kwok, as the amendments of Mr. Tony Tse, Mr. Yim Kong, Mr. Shang Hai-long, Mr. Tang Ka-biu have been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Mr. Ma Fong-kwok's further amendment be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Mr. Johnny Ng, you still have 30 seconds to reply, then the debate will come to a close. Dr. Johnny Ng. President, I would like to express my gratitude to 36 members for your valuable comments. I'd like to thank the two secretaries for carefully listening to our views. I'm sure that with a better collaboration between the legislature and the administration, we will work together to make it a better place to live. I now put the question to you that Dr. Johnny Ng's motion as amended by Mr. Tony Tse, Mr. Yim Kong, Mr. Shang Hai-long, Mr. Tang Ka-biu, Mr. Ma Fong-kwok be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the motion as amended passed. I now adjourn the meeting. We will commence at 9 a.m. tomorrow.